Mr. Obernolte? Mr. Obernolte votes aye. Mr. James? Mr. James votes aye. Mr. Bentz? Mr. Bentz votes aye. Mrs. Houchin? Mrs. Houchin votes aye. Mr. Fry? Ms. Lee? Ms. Lee votes aye. Mr. Langworthy? Mr. Langworthy votes aye. Mr. Kane? Mr. Kane votes aye. Mr. Rulli? Mr. Rulli votes aye. Mr. Evans? Mr. Evans votes aye. Mr. Goldman? Mr. Goldman votes aye. Mrs. Fedorchak? Mrs. Fedorchak votes aye. Mr. Pallone?
Votes no.
Mr. Pallone votes no. Ms. Teget? Ms. Teget votes no. Ms. Schakowsky? No. Ms. Schakowsky votes no. Ms. Matsui? No. Ms. Matsui votes no. Ms. Castor? Ms. Castor votes no. Mr. Tonko?
No.
Mr. Tonko votes no. Ms. Clark? Ms. Clark votes no. Mr. Ruiz? Mr. Ruiz votes no. Mr. Peters? Mr. Peters votes no. Mrs. Dingle? Mrs. Dingle votes no. Mr. Veazey? Mr. Veazey votes no. Ms. Kelly? Ms. Kelly votes no. Ms. Barragan? Ms. Barragan votes no. Mr. Soto? Mr. Soto votes no. Ms. Schreier? Ms. Schreier votes no. Ms. Trahan? Ms. Trahan votes no. Ms. Fletcher? Ms. Fletcher votes no. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes no. Mr. Auchincloss? Mr. Auchincloss votes no. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes no. Mr. Menendez? Mr. Menendez votes no. Mr. Mullen? Mr. Mullen votes no. Mr. Landsman? Mr. Landsman votes no. Ms. McClellan? Ms. McClellan votes no. Chairman Guthrie?
Aye.
Chairman Guthrie votes aye.
How is Mr. Fry reported?
Mr. Fry is not recorded. Mr. Fry votes aye.
The clerk will report the ayes and nays.
Mr. Chairman, on that vote, there were 29 ayes and 24 noes.
The ayes have it. The motion is agreed to. Please allow me to take a moment of personal privilege as we all join together to congratulate and wish happy birthday to our colleague, Gary Palmer.
Hey, Gary. Mr. Chairman.
Gentleman's recognized.
Mr. Chairman, I seek recognition to make a motion.
Gentleman will state his motion.
Well, it's getting late, and most Americans are in bed or heading that way shortly, and I think it would be beneficial, Mr. Chairman, to the public to continue to discuss these important health issues, the next title, while people are awake and can tune in. And as such, Mr. Chairman, I would move the committee recess until 9 a.m. tomorrow morning, and I would ask for a recorded vote on the motion.
The gentleman from Virginia is recognized.
Yes, Mr. Chairman, I move to table the gentleman from New
Gentleman from
Jersey's
Virginia
motion.
moves to table the motion.
I would ask for a vote on the motion to table.
No, it's a privileged motion.
Yeah, it's not debatable.
It's a privileged motion. You can't take it.
What's not?
You can't table.
Oh, you mean we have to vote on it? We have to vote on the motion.
So the vote will be on the motion to recess. Those in favor of recess will vote aye. Those opposed will vote no.
Excuse me,
The
Mr.
clerk
Chair,
will
the
call the
motion
roll.
is to
The clerk-
recess until 9 a.m. tomorrow morning.
The
That's-
vote of the motion is recess until 9 a.m. tomorrow morning. Those in favor vote aye. Those opposed vote no, and the clerk will call the roll.
Mr. Latta? Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller Meeks. Mrs. Miller Meeks votes no. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Ruley votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Mr. Gatt. Mr. Gatt votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Bardagan. Ms. Bardagan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Strahan. Ms. Strahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie.
No?
Chairman
Anyone
Guthrie votes
seeking,
no.
how's Mr. Crenshaw recorded?
Mr. Crenshaw is not recorded.
Mr.
Mr.
Pfluger?
Crenshaw votes no. Mr. Pfluger votes no.
Ms. Kamick?
Ms. Kamick is not recorded. Ms. Kamick votes no.
Is Mr. Hudson? Okay. Is anyone seeking recognition on the Democrat side to answer the roll call? Is Mr. Hudson recorded?
Mr. Hudson is recorded
Okay.
as no.
So no one else here? Would clerk will report?
Mr. Chairman, on that vote, there were 24 ayes and 29 noes.
The motion is not agreed to. So the chair calls up committee print subtitle D, Health, and asks the clerk to report.
Title IV, Energy and Commerce. Subtitle D, Health. Part 1, Medicaid.
Without objection, the reading of the committee print is dispensed with. The committee print will be open for amendment at any point. So ordered, and the chair has an amendment in the nature of a substitute at the desk. The clerk will report the amendment.
I guess I'm gonna.
Amendment in the nature of a substitute to Subtitle D, offered by
Without
Mr.
objection, the
Guthrie.
reading of the amendment is dispensed with. So the change is before us. Is there any discussion or amendments to the amendment in the nature of a substitute? Gentlelady from Colorado is recognized for 5 minutes to
Chairman, I
speak
move
on
to
the
strike
aims.
the last word.
Gentlelady is recognized.
Thank you, Mr. Chairman. Well, it's now 2 minutes of 1 a.m., Mr. Chairman, and I guess I can see why the Republicans wanted to sneak this health care bill through in the dead of night and defeat a reasonable motion to go till tomorrow morning so my constituents could know what's going on. And here's why. You can't just cut 700, Mr. Chairman, the committee's not in order.
Committee, come in order. Gentlelady deserves to be heard. Gentlelady will proceed.
Thank you. You can't just cut $715 billion for Medicaid without slashing benefits for people. You can't do it. And in fact, the Nonpartisan Congressional Budget Office says that 13.7 million Americans will be kicked off their health care. Here's how it breaks down. CBO estimates that 8.6 million Americans will lose coverage under this bill, and then 5.1 million will lose their coverage because I'm going to guarantee you the Republican majority's not going to extend the enhanced ACA subsidies. This bill asks people who are making barely more than the poverty level, just $15,650 a year, to pay more for their care, while at the same time providing massive and disproportionate handouts to corporations and billionaires. And it hamstrings states' abilities to pay for quality care that the Medicaid beneficiaries need. The Republicans are making insidious cuts to Medicaid and our health insurance system. As I said, it adds up to 13.7 billion fewer people. Republicans continue to make this claim. They have all day and night, saying that they don't support cuts for providers or patients. And in fact, my colleague from Colorado's 8th Congressional District, who sits on this committee, said, and I quote, "I don't support cuts that harm Colorado providers or patients." But look what will happen with these cuts. There will be cuts to providers and patients. Medicaid covers nearly 80 million people nationwide, including in my home state, nearly 1.2 million people. This includes, it's 163,000 people in my district, but look at the 3rd Congressional District, which is Western Colorado. It's a very rural district. It's 213,000 people. And in the 8th District, north of me, it's a very, it's a mixed district. It has 182,000 people. Medicaid is a critical part of our health insurance system, and it impacts people all across the country. It pays for care for new moms, for working families, kids with serious medical needs, and more. And that's why 65% of Americans say that Medicaid has covered them or someone close to them at some point. So here's what's going to happen. And the reason why these people support Medicaid is because it saves lives. States that have expanded Medicaid have saved tens of thousands of lives by doing so. People who got Medicaid through the expansion have a 20% lower overall mortality rate than people who do not. These people are living healthier, they're having more productive lives by having access to the care they need when they need it, not just when they show up to the emergency room. Now, I know we're going to have a lot more debate on two of the things my colleagues across the aisle say. Number one, these work requirements. Now, let's be really honest, is the work requirements that they're saying not only will throw many, many people who are eligible off of insurance, but it will also increase paperwork requirements, and it will increase costs for the states. I'd like, Mr. Chairman, I'd like to put a study from the Kaiser Family Foundation into the record, which shows that 92% of Medicaid recipients are working, in school, disabled, are caregivers, or seniors. And that for those very few people that you could find, most of them are already working. You're sure as heck not going to save $715 billion by throwing these people off of their Medicaid.
Without objection to
Thank you. Now, the other thing we're going to hear about, and I don't have much time, so we can talk about it later, is beneficiary fraud. Beneficiary fraud amounts to 0.1% of Medicaid. You tell me how you're going to save $715 billion through eliminating, quote, beneficiary fraud. With that, I yield back.
The gentlelady yields back. Is there any discussion on the amendment? On the amendment nature of substitute? Gentleman from California? Mr. Ruiz is Dr. Ruiz is recognized for 5 minutes.
Move to strike the last word.
Gentleman's recognized.
You know, we have spent the past 10-plus hours debating the many ways that this bill is bad for Americans. Over the next however many hours, now we will debate a health care bill that will make Americans unhealthier. It will make health care less accessible. It will make health care more expensive. Don't be fooled. The provisions in this bill are designed to decrease health care coverage, not strengthen our nation's health care system. This bill will drastically increase the financial burden on states and restrict their ability to raise funds to cover their share of Medicaid costs, so that they have no choice but to either raise taxes or cut benefits and cut pay for providers, making it less likely to find a provider to take Medicaid in those communities. It will increase out-of-pocket costs for care for low-income individuals who get their coverage through Medicaid expansion. It will lead to at least 13.7 million individuals losing their health care coverage, and even more cruel, it makes it much harder for these individuals to get coverage elsewhere on the ACA marketplace. This will only worsen the Medicaid medical debt crisis and force hospitals to provide even more uncompensated care. The atrocious policies in this bill will have lasting negative impacts for our nation's healthcare system and generations of Americans to come. As you vote on amendments tonight, I implore you all to put the health and well-being of your constituents first. Thank you, and I yield the remainder of my time.
Yields back his time. Gentleman yields back. Is there any discussion on the Republican side? Seeing none. The gentlelady from California, Ms. Barragan, is recognized for 5 minutes.
Thank you, Mr. Chairman. I want to speak in favor of the amendment, and
Gentlelady's recognized.
thank you. I just want to say that I fully support this amendment, especially in light of the very strong statement that it will not cut Medicaid benefits. But I also want to show you my latest chart. Actually, my latest poster board, I should say. This is a quote from a Republican senator. This wing of the party wants Republicans to build our big, beautiful bill around slashing health insurance to the working poor. But that argument is both morally wrong and politically suicide. This is a Republican in the Senate. Republicans themselves are saying this is going to slash health care for the working poor. So I have to agree with the senator, the Republican senator, on this one. And it's devastating. It's devastating to families, to people across the country. We saw it today, evidence today, by people who were here, who were removed because they were so afraid of losing their access to health care because they were speaking out, because they wanted to share their story. In California's 44th district, Christine, a constituent of mine, says, I'm retired and I live on a fixed income. I've been battling metastatic cancer for 2 years. And I'm afraid with the cuts to Medicare and Medi-Cal, which is Medicaid and healthcare in California, I'm afraid that the cuts from Trump administration and House Republicans, that I won't be able to continue on my cancer immunotherapy treatments if my Medicaid gets cut. Alicia from the 44th district says, I am a mother of 2 autistic boys. I can't express the gratitude I have for the services that Medicaid has provided my children. My children have been given a chance of normalcy in our community. Children with disabilities deserve a chance to be loved and respected by others, not discriminated because they cannot express themselves or ask for help. These types of barriers make their living challenging, especially for those with stemming that people are confused and say they're on drugs when in reality they're sick or they can't be understood. Imagine a world of disabled children and adults left to fend for themselves because their families cannot provide a service to help them understand daily life skills or advocating for themselves. She continues on, for them to understand that they do have a voice and someone is willing to hear them out and help. I ask you to reconsider and take the time to meet a child or an adult with autism and see how curious and brilliant they are. And so I share those two stories, and I share again this so important quote from a Republican senator just across the chamber here who says, this wing of the party, those Republicans that are in this room right now, that's this wing of the party, wants Republicans to build our big, beautiful bill. By the way, all these binders say the big, beautiful bill, so that's what we're talking about today, around slashing health insurance to the working poor. So Republicans themselves are saying they're slashing health care for the working poor. And at least this one Republican senator got it wrong. It's morally wrong, and it's political suicide. And with that, I yield back.
The gentlelady yields. Any other discussion on the amendments to in the nature of the substitute? The chair recognizes the gentlelady from, where is she from? Or Washington State, Dr. Stryer.
Washington and Oregon are the same. Thank you, Mr. Chairman. Kittitas Valley Healthcare is in Ellensburg, Washington. It's a critical access hospital. It is in a rural area. Ellensburg is just east of the snow-peaked Cascade Mountains, where the passes often close and so they can't easily access other care. Over 60% of the patients that they see at Kittitas Valley Healthcare rely on Medicare or Medicaid, and so really that is what keeps this rural hospital afloat. Now, I want you to know that they already struggle to keep labor and delivery department open. I want you to meet Isla. She is 4 years old. Her parents are Jason and Vanessa. They were so excited to welcome her into the world in 2021 after an uncomplicated pregnancy, but then everything went south in the delivery room. She came out pale, limp, severely anemic, low oxygen levels, and had to have emergency interventions. And thank goodness they had labor and delivery at Kittitas Valley Healthcare, because they were able to stabilize her while they called for emergency transportation to get her over to Seattle Children's to the NICU. They couldn't even use a helicopter because of the weather, and certainly couldn't use the mountain passes, so it took an actual airplane taking her over there. And I just want to drive home this point. As my Republican colleagues are looking at taking Medicaid away from 13.7 million Americans, that will jeopardize hospitals like KVH. And that means they might not have a labor and delivery department, might not have had it for Isla. She may have had a completely different outcome that I won't even talk about. But I want to be very clear. Our healthcare system is like a three-legged stool. And one of those legs is Medicaid. And if you take Medicaid away and you make the biggest cut ever made to Medicaid, that stool is going to collapse. That is our entire healthcare system, and it's going to hit rural America first, but it's going to hit every single hospital, and it's going to hit all of us because, you know, when labor and delivery closes at KVH, they lose one service. When people can't get primary care in Kittitas Valley, in Ellensburg, then they're going to get their care on an emergency basis in the emergency department, where it's expensive. And you know who's going to pay? All of us. Our insurance rates are going to go up because if hospitals are going to stay in business, they got to bill somebody, and people on Medicaid are not going to be able to pay. So I just want to be clear that these cuts, and let there be no doubt, these are dramatic cuts. These cuts are going to destabilize our healthcare system. They're going to leave people sicker and poorer and less able to work. And this is all to give a gigantic tax break to the wealthiest in this country, to the billionaires, to the Elon Musks. And I just have to emphasize that that is immoral, it is stupid to destabilize our entire healthcare system, and it's just plain cruel. So I want my Republican colleagues to understand exactly what they are doing when they take these votes. I yield back.
The gentlelady yields. Any other discussion on the amendment in the nature of a substitute? Hearing none. Chair, are there any amendments to the amendment in the nature of a substitute? Chair recognizes the gentlelady from Colorado.
Thank you, Mr. Chairman. I have an amendment at the desk, Health-FCD-AMD, underline 007.
Can you repeat that, please?
Health-FCD-AMD, underline 007.
Clerk will report the amendment.
Health-FCD-AMD_007, amendment offered by Ms. DeGette. Add at the end of the following section, effective date,
And Mr. Chairman,
provisions of this subtitle.
Without objection, the reading amendment is dispensed with, and
Mr. Chairman, if I could reserve a point of order, please.
point of order is reserved by the gentleman from Virginia, and the gentlelady from Colorado is recognized for 5 minutes in support of the amendment.
Thank you so much, Mr. Chairman. Well, staff didn't read the amendment, so I will. It says the provisions of this subtitle shall not be made effective unless and until the date on which the Secretary of Health and Human Services submits to Congress a certification that such provisions will not have the effect of reducing benefits provided under state plans or waivers of such plans, as promised by the United President in the article published by the White House entitled Fact Check. President Trump will always protect Social Security Medicare. And I want to say, since this process started, Mr. Chairman, Republicans have said repeatedly that they would not cut Medicaid benefits or coverage. The chairman of the full committee actually said in this very room, we're not going to do it in a way that threatens hospitals. So let's just talk about a couple of ways that these cuts are going to harm beneficiaries. The first one is the hospitals. The American Association of Medical Colleges, in fact, says that that it's likely in rural communities that a shortage of doctors and a shortage of funding for Medicaid is going to potentially close rural hospitals. And certainly, as Ms. Schreier talked about, is going to cut benefits. I have a letter from the Colorado Hospital Association outlining how this bill will hurt hospitals all across my state and the patients they serve, and I'd ask unanimous consent to put that into the record. Speaker Johnson himself said it's non-benefit related reforms to the program that are under consideration. But here's another one, and I want to take this moment to thank all of the people in the pink t-shirts that say, I fight for Planned Parenthood, who are right here in the audience, because they know, like we all know, Planned Parenthood provides health care for millions of Americans. Services like pap smears, primary care visits, and breast exams all across this country. 64% of Planned Parenthood clinics are in rural areas or otherwise underserved areas. Guess what? This legislation, we're going to be talking a lot more about this morning, is this legislation eliminates Medicaid funding to Planned Parenthood. And so what that means is that 64% of Planned Parenthood clinics in rural areas or other underserved areas is going to be eliminated for these beneficiaries. That sounds like a benefit cut to me. CBO estimates, as I said before, that just this bill will result in 8.6 million fewer people having health care coverage. And it does that by making it more difficult for lawful beneficiaries to enroll. It puts burdensome and confusing bureaucratic red tape between Americans and health care, and it throws whole categories of people off of Medicaid. You tell me how that is not eliminating care for people. Now, President Trump himself said that he would veto a bill that cuts Medicaid by taking away provider fees as a funding mechanism and by making states revise their current provider fees. This bill does exactly that. And so I guess I would have to say, if President Trump wants to keep his promise, I know he'll veto this bill if it ever gets to his desk, because it's going to cut, in this bill alone, over 8 million people off of Medicaid. So my amendment is very simple. It holds my Republican colleagues to their word. It just simply says that if the Secretary certifies that what the White House said, that the Trump administration will cut Social Security, Medicare, or Medicaid benefits, it can go into effect. And so this is a simple opportunity to ensure President Trump has kept his word, and all my colleagues on this committee have kept their word, that in fact, this won't go into effect unless and until they can certify that no one has been harmed by the provisions in this bill. I yield back.
The gentlelady yields back. The chair recognizes himself for 5 minutes on the amendment. The President and House Republicans have made it very clear. We've made it very clear that we will not touch essential health care services for vulnerable populations. The policies in the underlying bill protect and preserve benefits for vulnerable patients on Medicaid, including pregnant women, children with disabilities, and those experiencing financial hardships, while preventing against waste, fraud, and abuse. Examples: ensuring beneficiaries aren't enrolled in two state Medicaid programs, unnecessarily eating into state Medicaid budgets and taking resources away from individuals with chronic conditions and other life-threatening conditions. We also have common sense solutions that were bipartisan. Last Congress, these include policies to ensure deceased patients aren't enrolled in Medicaid programs and ensuring providers are eligible to bill state Medicaid programs. My Democratic colleagues want to paint the picture that Republicans are cutting Medicaid to pay for tax increases for billionaires, when in reality, we, under the leadership of President Trump, are protecting benefits for vulnerable beneficiaries for decades to come. We are stabilizing, we are saving, we are sustaining Medicaid for those it was intended for those who need it the most, the vulnerable in our population. That is what we are doing here. I yield back. Any other discussion?
Will the gentleman yield?
I yield.
Question? I would just ask the gentleman, who's going to define the essential populations? Is that defined in statute somewhere?
It is defined as a vulnerable population. You
Where
all
is
know,
that
we all,
defined?
excuse me, reclaiming my time. We all recognize that there are parameters by which people qualify. The most vulnerable in our society, the aged, the blind, disabled, children, mothers, pregnant women, those are the ones that this program was designed for. Those are the ones that this program is intended for. And I yield back, and I'll recognize the gentleman from, where is he from? Ohio? Ohio. Gentleman from Ohio for 5 minutes.
Thank you, Mr. Chair. Just a couple questions, because your you're making a very significant statement in that $700 billion later, Medicaid is going to be protected, and that the intent of these cuts is to help people on Medicaid, those who deserve it or need it. It's not clear. So first question, you all are adding a copay for low-income folks to go visit the doctor. So on top of all of the other bills that they're struggling to pay, you're adding a new bill. You're saying every time you see a doctor, you now have to pay more money. How is that protecting folks on Medicaid? How does the copay help people on Medicaid? Or how does it address waste, fraud, and abuse? I mean, what is the argument for adding an additional cost for folks going to see a doctor? If that money was being invested back into Medicaid, you could make that argument, but it's not being invested back in Medicaid. You're using it for the tax cuts. So what's the argument for requiring people to pay more to go see the doctor?
Does the gentleman have a question?
That's
That's pretty a long question.
No, that's literally the question. That's the question. What is the argument?
Again, what we're doing here is that we are making sure that we're going to sustain this program. We're going to stabilize this program. You know, I don't buy into the idea that just because you're cutting a certain amount of money, that means you've got to cut
No, I just want to reclaim my time. It's a question. You want to sustain the program. I get it. I get that's what you're saying. Why are you charging people more money to go see the doctor then? That is the question. What is the argument for that?
Part of what we are proposing is to make sure that this program is sustainable.
But you're not investing the additional money. You're saying to people, low-income folks, people who make $16,000, $17,000, $18,000 a year, you now have to pay more to go see the doctor. But that money, that new revenue is going to pay for tax cuts, not going to Medicaid. So how is that helping people on Medicaid?
Again, what we're trying to do is make sure this program is sustainable. I think it's presumptuous for you to say that money's not going back into the program. The money is going back into the program to make sure we sustain it, to make sure we stabilize it, to make sure that it's there for the most vulnerable in our society.
I mean, you can't say lie. We're not saying lie, but we know it's not. You're using that money to as part of the $715 billion that's being removed from Medicaid in order to pay for the tax cuts. So it's not helping anyone on Medicaid. The shifts to the states, where the states are going to have to pay more, we're going to pay less. A lot of states won't be able to pay their part. People will lose coverage. How is that helping to sustain Medicaid? How is that helping to protect Medicaid?
Whenever we clean up the rolls, whenever we take people who are not supposed to be on there, when we put illegals off of here, when we get people who are in more than one state, that makes more money for those who need it the most.
But you're not, first of all, you're taking health care away from 7-8 million people. Cleaning up the rolls is going to be heartbreaking for people who are about to lose their health care, that they lost their health care as part of an effort to clean up the rolls.
If they're not eligible for it, they shouldn't be on it in the first place.
But they are eligible.
No, that's not who we're going to take off the roll. If they're eligible, they will be on the roll. What we're going to do is to take those who are not eligible, who may be in more than one state, and we're going to make sure they're only in one state.
Wait, what?
What?
I'm sorry, this is confusing. This is why I'm going to yield back because I'm out of time.
The
I think
gentleman's
you
time
have-
has
You have
expired.
created enormous confusion on top of the real fear.
The gentleman's time has
anger.
expired. Does
People are
anyone
gonna
else
lose their
seek
healthcare.
time to speak on the amendment? The chair recognizes the gentlelady from Virginia, Ms. McClellan, for 5 minutes.
Thank you, Mr. Chair. Would the gentleman yield for a question, the chairman?
I'll yield.
Thank you. I want to make sure, because you've repeated several times, other members on that side have repeated several times, that this bill is intended to ensure that no one loses coverage, vulnerable people who Medicaid was originally intended for. And that caught my attention. And so I just want to ask point blank. The Affordable Care Act expanded who was eligible by allowing the states to cover adults with incomes up to 138% of the federal poverty line, which for an individual in 2025 is someone who makes up to $21,597 a year, which to me is someone who's pretty vulnerable. So will this bill ensure that individuals who make up to 138% of the federal poverty line, who were included in Medicaid expansion in the states that expanded it, who meet the requirements, will not lose any coverage? Is that the intent of this bill? Are they included in the vulnerable population that Medicaid was originally intended to cover, as stated by you, Mr. Chairman?
If they are eligible, they are going to continue to be covered. What we are looking to do is to remove those who are registered in more than one state. What we're looking to do is to make sure, and yes, there are those who are eligible in more than one state, and we're going to clean that up. We're also going to make sure that if they're not supposed to be on the Medicaid rolls, that they're not on the Medicaid rolls. Therefore, we're going to take care of those who are the most vulnerable, who should be getting this most necessary coverage.
And Mr. Chairman, just to be crystal clear, because it's 1 a.m. and very few people are paying attention to this, and I want it very clearly on the record. The majority party that wrote and intends to vote for this bill includes the expansion population in those states that expanded it to cover adults who make up to 138% of the federal poverty line. You include that as the vulnerable Americans who are eligible and should continue to get Medicaid.
The bill before us includes a work requirement so that if they engage in 80 hours a month and the parameters are set, there is no reason why they would not be able to continue on this Medicaid.
And Mr. Chairman, who will implement the work requirement?
The work requirements are in this bill, the parameters of that, and they will be administered by the states.
Okay. So that includes Georgia, which when it implemented work requirements, kicked eligible people off the rolls. That includes Alabama. This is not a question, this is a statement. That includes Alabama, that when they implemented work requirements, that kicked people off of the rolls who were otherwise eligible. That means if you fill out the paperwork incorrectly, you lose your health insurance. That means if the state hasn't figured out how to determine when you got pregnant, when you stopped or began work, you're kicked off. That means that under this bill, because they do multiple checks, if you've been laid off and you haven't gotten a new job yet, you're kicked off. That's what that means, and we're going to have a whole lot of discussion about work requirements tonight, because basically the work requirements are red tape requirements that if you fail to fill out these forms that states, there's evidence that states have not been able to implement in a way that doesn't kick off eligible people.
We're gonna have a lot of conversation about that this morning. I yield back.
The gentlelady yields back. Any further discussion on this amendment? The chair recognizes the gentlelady from Illinois for 5 minutes of questioning.
I yield my time, Mr. Chair, to Congresswoman Guthrie.
I thank the gentlelady for yielding. Mr. Chairman, I guess I'm confused because several times you said we're not going to cut Medicaid for vulnerable populations. You mentioned pregnant people, the disabled, and the elderly. But of course, there are a number of other people, low-income people, as I mentioned in my opening, who are on Medicaid. And I guess I'm wondering if those people will be cut off of Medicaid.
Ms. Saget, if they are eligible for Medicaid,
If they're eligible,
if they're eligible, they will continue to be covered. The most vulnerable in our society, a program that was
all
intended
those
for the
people-
aged, the blind, disabled, for pregnant mothers,
Okay,
for
wait.
children.
If I can reclaim, well, I guess I have Ms. Schakowsky's time, but almost all of these 8.6 million people who are going to lose their Medicaid are eligible. Now, you did mention several different groups. One of the groups you mentioned is people who are registered for Medicaid in more than one state. And I think all of us can agree that if people are registered in more than one state, they shouldn't be, and they should only be registered one time. But I've got the CBO score in my hand, and what it says is for those people who are registered in more than one state, that only saves $17.4 billion of the $700 billion that you cut in this. So I'm wondering where you're going to get the other money to save. If you're just going to cut $17.4 billion here.
That is not the only policy that we're getting these savings from.
Thank you. The other one you mentioned was this thing about the, quote, illegals, which you keep talking about. And I did put the statute into the record earlier that saying that Medicaid does not cover benefits for anybody who's not here legally, but some states do. Some states with their own state money. And so what your bill does, Mr. Chairman, is it says that we're not going to give matches to states that with their own money pay for undocumented people. But even that, so I get that you're saying we're not going to give that to them either, but that one would save $11 billion. So if you add it up to the people who are registered in 2 states and the states that with their own money cover undocumented people, that's like $28.4 billion out of $700 billion. So where are you going to get the rest without throwing eligible people off of Medicaid?
We are not throwing eligible people off of Medicaid.
Well, I hear you keep saying
Again, what we're doing is ensuring the beneficiaries who aren't enrolled in 2 state Medicaid programs, that those people are unnecessarily eating into state Medicaid budgets
Right,
and taking resources away from those who truly need it.
That's right. That's $17.4 billion.
That is correct, and that is
where do you
part
get
of the
other
savings that we
700?
are using to stabilize this program that is intended for the most vulnerable in our society.
I don't think you're going to answer my question, so I'll yield back to Ms. Schakowsky because several other of my colleagues would like you to yield to them. Do you want to yield to Mr. Archincloss?
No, I'm fine, unless you want.
Thank you, Ms. Schakowsky. I want to briefly touch on something that the gentleman from Ohio raised with the copays, which I believe are $35 per doctor's visit now. And my question for the gentleman from Georgia, our chair, is why are copays acceptable for primary care visits for Medicaid for low-income patients when they're not for prescription drugs? The gentleman from Georgia has done terrific bipartisan work on lowering copays for prescription drugs. How does that, though, apply to this situation where you're claiming to be strengthening Medicaid and yet you're putting barriers to care for primary care, which we know to be just as preventative and helpful in avoiding downstream costs as prescription drug adherence is. So what's like the philosophical difference there?
What we're doing is we're trying to mirror what is in current law for optional cost-sharing policies in Medicaid. This is not something new. This is something that has been done in the past and something we're going to continue. This is part of the savings to make sure that we stabilize this program, that we sustain this program, that it's going to be there in the future for the most vulnerable in our society.
But you're not putting those $35 back into Medicaid. Like Mr. Landsman
The
said. if you-
gentleman's time has expired. Ms. Schakowsky's time has expired. Does anyone seek time to speak on the amendment? Chair recognizes the gentleman from California. Okay, excuse me. The chair recognizes the gentleman from Kentucky. The chair.
Well, thanks. I just want to say what our bill does, and it seems like we're not actually talking about the bill that's before us. I want to make sure we are. So think about what this bill does. It stops us from paying for people that aren't actually eligible for Medicaid. So we had eligibility determinations that were suspended, changed a lot during COVID. All we're saying is and I didn't vote for the Medicaid program. I didn't vote for the expansion of the Medicaid program, so I didn't set the standard. I didn't set the qualification standards. The people who voted for that did set the qualification standards. And all we're saying is that twice a year that we verify people are qualified to be on Medicaid by the standards that was set by the people who voted for the Medicaid program and the expansion. It stops us from continuing to pay for 1.6 million people who are estimated by CBO to be enrolled in multiple states. Sometimes it's a transient population, people move. And so when you're doing the Medicaid managed care, states get per enrollee, and they believe, and 1.6 million people is what CBO has scored, are actually registered in 2 different states. We have a lot of that in my area. People move between Ohio and Kentucky and Tennessee. So we have that happen. It stops us from paying for states that choose to cover people that are not here in a legal presence. It stops people from qualifying for Medicaid while they live we put the exemption to $1 million. So if they have $1 million home, they can't qualify to be on Medicaid. It stopped us from paying per member, per month fees to insurance companies to pay them for covering people that have already passed away. I think these are all common sense approaches. It stops criminals from fraudulently billing Medicaid by impersonating doctors who pass away. I think we can all agree on that. It stops Medicaid from paying for gender reassignment surgeries for minors. And finally, it stops able-bodied people that aren't taking care of a dependent from receiving free Medicaid if they refuse to work a part-time job or at least spend some time volunteering. And I earlier today when we were talking, read directly from the bill all of the people who were exempt. And I would think if you took all the exemptions, you have to say if people aren't working with all the exemptions are truly people who are choosing not to work. And we feel like that's not fair to the American taxpayer. So that's what this bill does. And we think these are common sense approaches to make sure that we have saved the Medicaid program, because the Medicaid program is exploding. We know it's exploding. We have a $2 trillion budget deficit. I spent a lot of time talking to hospitals, providers. I changed some of my opinions and some of what's in the bill I was able to change because of what people said it would affect people's coverage. If you notice, state-directed payments are frozen where they are because people use this to make sure that high Medicaid hospitals, rural hospitals are high Medicaid, urban hospitals are high Medicaid. And if you have a high Medicaid and Medicare population and very few private pay, then you need the extra money for the hospital to be successful and stay open. And so there are a lot of things that we put in this bill because we spent a lot of time talking to providers, people who provide for people. But and I strongly believe that we came up with the common sense issues that I just read through the list, I won't read through it again, but we think that that's common sense to make sure that we have not people covered by multiple states, not paying for people that aren't even eligible to be on the program, people with $1 million home, people with all the exceptions. I can reread the bill again. I don't have it right in front of me, of the exceptions for people who or the work requirement is accepted for. And so we think these are reasonable approaches, and that's the bill we're discussing today. And I appreciate the time, and I will yield back.
Gentleman yields. The chair now recognizes the gentleman from New Jersey, the ranking member, Mr. Pallone.
You see, the problem is, from my point of view, Mr. Chairman, that what you define as eligible. I think probably the best example is the gentleman from Georgia's state. We have a couple cases historically where states have tried to impose, you call it work requirements, I call them red tape. And this is where the Congressional Budget Office gets most of the people that are thrown off of Medicare, not because they're undocumented, not because they're in 2 states, not for some of the other reasons that you articulated. It's about the red tape. So in Georgia, I think they had about 400,000 people that were eligible for Medicaid. In other words, that means that if they had filled out all the paperwork, had met had done everything they were supposed to do to file the paper requirements, they would have been eligible. But less than something like 7,000 of those 400,000 ended up getting Medicaid. Less than 10%, I don't know, 6%, 3%, whatever the figure was. Now you would say, okay, only those 3% are eligible because they're the only ones that filled out the forms, did everything properly with the forms, did all that. Well, the reality is that almost all those people would have been eligible. Most of them are working, something like 92%, I think, of those were working. There was just too much red tape. I don't know, because they couldn't figure out how to do it, because they didn't know about it, because it was too frequent that they had to fill out these forms. And so it's not that they weren't eligible, it's that Georgia, the state of Georgia, put too many barriers in the way of their being able to qualify. And that's what I think is happening here today, with this bill. In other words, I hate to use the example, but I'm going to. I look at someone who walks into this room and who's disabled, and I say, gee, how can I help them get health insurance? What I believe you're doing, not intentionally, but what I believe you're doing is you're filling out in this bill, figuring every way possible for them not to qualify, either because they can't fill out the paperwork, they don't know how to do it, I don't know, whatever. They might be illiterate. They can't physically fill it out. They have to go on a website, and they don't know how to use the website. They don't have the website. And then if they're not eligible because they didn't fill out the paperwork, then you have a thing that says, well, then they're not eligible for any kind of subsidy under the Affordable Care Act. So they don't have that option as well, which is, of course, also the basis for the CBO saying so many people get kicked off Medicaid. They assumed that if you didn't have Medicaid, you would go to the ACA, and that would have probably eliminated most of your savings, But instead, now you say they can't go to the ACA because they still haven't, they haven't filled out the paperwork for the Medicaid, so we're not going to let them go to the ACA and get any kind of subsidized care. And it goes on, limiting the enrollment period under the ACA. Saying that if they sign up today for Medicaid, but they don't actually get an official document certifying that for another month or 2, they don't qualify for Medicaid coverage during that period between when they applied, can't be retroactive. I mean, the list goes on like this. I can't even mention it all. So it's not that these people are not eligible for Medicaid. If they did everything that you say they have to do to qualify, meaning all the paperwork, of course they would qualify. Of course they would be. So it's really not fair to say that you're not kicking these people off. You are kicking these people off because you're putting everything in place to make it difficult for them to qualify, even though they really do qualify. And we as Democrats spent the last 4 years, when we were in the majority, trying to find out ways to make sure that these people didn't trip up in the process so they didn't qualify, because we wanted them to have health care. That's the distinction here between what you're doing tonight and what we did. And it's really a terrible thing, because it shouldn't be that these 8 million plus another 5, you're not going to get the subsidy for ACA. don't qualify. It's not fair. They should get health insurance. They do qualify. But you're going to make it so they can't qualify. That's what's happening here. And I think it's a really terrible thing, but, you're in the majority, so I yield back.
The gentleman has yielded. The chair now recognizes the gentleman from North Carolina, Mr. Hudson, for 5 minutes of comments.
Thank you, Mr. Chairman. And, Mr. Chairman, I just want to reject the idea that was just put out there, and we've been hearing it all day, that somehow Republicans want to keep people from getting Medicaid. That's just not true. We're here to fight for the people in our districts who depend on Medicaid. And I just reject that idea. This idea that, because the reality is this program is going broke. And it's going broke because of Democrat policies that have loaded the program up with a lot of people that don't qualify. And what I want to do is preserve it for Melissa from my district and Christine, who has a son who says without Medicaid, they would be homeless. And to suggest that I don't care or that I want them to somehow not be able to get access to that Medicaid so they'll be homeless, that's offensive to me. And so I just reject the idea. And to give more clarity, I'd like to yield to Chairman Guthrie.
Thanks. I just want a couple of things that my ranking member friend brought up. One is the enrollment period that in the ACA. When they say pass, it had a enrollment period that you had to apply for your health insurance. And it's something when you have guaranteed issue, which everybody in this side of the aisle is in pre-existing conditions, that absolutely nothing has changed in that. When you have guaranteed issue, you have to have a special enrollment period because then you could apply for insurance only when you needed it. And so over time, it's gotten to where it's almost, I don't think it's technically open enrollment. The way it's implemented, it's open enrollment. And we're going back to the original design of the Affordable Care Act that people had a certain time. If there's a life-changing event, you get married, you have a baby, all these other things that are life-changing events, you can change and enroll in your insurance, but there's an enrollment period that all insurance has that you have to apply for and not just open enrollment because just so people will not only take the insurance when they actually need it. And on the work requirements, you're right. Arkansas is a great example of where people were not able to maintain their Medicaid, not because they didn't qualify, it's because the process was so onerous. Arkansas had a monthly check that you had to monthly verify employment and became so difficult they couldn't do it. So what did we do? We spent a lot of time with Arkansas, Georgia, and other states trying to figure out what they did different. And so we require beneficiaries to have to verify work at the time of enrollment or during a redetermination of their eligibility. We're not doing the monthly checks that Arkansas had. And so this allows states and beneficiaries to take advantage of existing processing and paperwork that beneficiaries already go through to become eligible for Medicaid. And what's more, though, is that we're also encouraging states to use existing data sources like state payroll data so they can better utilize so-called ex parte reviews. This is already a pretty well-established concept for states. They use existing data sources all the time to help verify a number of different eligibility requirements. So right off the bat, we're talking about paperwork that's already part of the current process for applying for Medicaid, not adding additional monthly work requirements for the exact reason that what you just said, Mr. Rankin, the exact reason is that we don't want people to lose Medicaid who are eligible for Medicaid because they don't fill out the paperwork. We want people who are in the expansion population that are able-bodied, with the exceptions that I the list, to work, and we think that's a good use of the taxpayer dollars. That's why we have that in here, but we absolutely don't do it like Arkansas. We don't do it like other states have done it because we don't want to have happen exactly what you said, that red tape disqualifies them. They either choose, we want it to be either they choose to work or they disqualify themselves, not because of the paperwork. And we feel like we address that in this bill because that's the concerns that we have, exactly the concerns you just articulated.
Will the gentleman yield?
Sure.
Oh,
well, it's not my
the one who
time.
has the time has to yield, Mr. Hudson. So,
He's yielded.
So I just want to point out that on page 71 of the, is it the Ains? Yeah, of page 71 of the Ains, in subpart D, it does say, Mr. Chairman, as you said, that they have to certify and then recertify every 6 months. But it also, in paragraph little II, says that states actually can, at their discretion, conduct more frequent verifications of compliance. So they can actually do, under this AINS, they can actually do what Arkansas did. And that's part of the problem we have, is you're going to let the states do whatever they want. I yield back.
But, oh, I'm out of time.
No idea.
Yep. I'm sorry, we're out of time.
The gentleman has yielded. Does anyone else seek recognition to speak on the amendment? The chair recognizes the gentleman from, the gentlelady from New York. Who do you want?
Tonko, and then
Chair recognizes the gentleman from New York, Mr. Tonko, for 5 minutes.
Thank you, Mr. Chair. I move to strike the last word.
Without objection?
Thank you. I rise in support of this amendment. Let's call Republicans' so-called community engagement and eligibility check requirements what they really are, an attempt to make paperwork great again. If you've ever struggled with an insurance company denying care or been on hold with customer service for hours on end and thought, I wish this process could be even worse, Republicans have delivered the bill just for you. This is death by paperwork. What does this look like in reality? Imagine you're working 2 jobs to make ends meet and currently receive health care through Medicaid. Now every month in the mail, you'll get some confusing form that you have to spend an hour filling out and have your boss sign off on just to make certain you can see your doctor. Just what everyone was clamoring for, having your boss more involved in your medical care. On top of that, every 6 months, you're going to get another confusing form that's going to take another hour to fill out to make certain you haven't earned a single dollar too much. Otherwise, guess what? They're going to kick you off of your health care. All of this is assuming that the bureaucrats in charge of the Medicaid program in your state know that you've changed departments in the last month and send the mail to your right address. Otherwise, guess what? They'll kick you off of your health care for not responding. What Republicans are doing with this amendment is the health care equivalent of self-deportation. They want to make receiving actual health care so burdensome that people just give up on even trying. And guess what? It will probably work. As we have discussed, almost 14 million people will lose health care because of these and other requirements in this legislation. In New York State, these death by paperwork requirements could lead to 1.6 million people to lose coverage. Is there anything more soul-sucking than having to constantly validate your worth to an insurance company? Having to send document after document just to prove that you are worthy of care. These efforts are dehumanizing and demoralizing. This is the future that Republicans want for Medicaid, a system so mind-numbingly bureaucratic and full of red tape that no one can actually get the health care that they were promised. What if instead of spending all this time and effort and money on paperwork, we just made certain everyone had access to health care? Now that's a system I could believe in. So I urge all of my colleagues to support this vital amendment. Let's get back to providing health care for real people rather than finding soul-sucking ways to take it away. With that, I yield back.
Will the gentleman yield?
yields back.
Will the gentleman
Is there
yield?
anyone seeking recognition on the Republican side?
Yeah, yes, I'll yield to the Congresswoman from California.
Congresswoman from California is recognized.
Thank you. Since we're summarizing what the bill does, whoops, it's upside down. Let's review again what this bill is going to do and what the CBO has told us it's going to do. And that is the Republican bill combined, by the way, with the Affordable Care Act subsidies effectively expiring. It cuts at least $715 billion from health care. And we're talking about 13.7 million people being kicked off of Medicaid. Now, we can talk word salad, explain it this way, explain it that way, but the bottom line is people are going to lose benefits. People are going to be cut off of Medicaid, and that is not a good thing. We have heard everything from, oh, millionaires are on Medicaid. Let me tell you about what happened with what happened in California, what was happening to people in California that were on Medicaid. I had a constituent, many people, who were on Medicaid, which meant they couldn't earn more than $2,000 a month, and they couldn't have more than, I don't know, $500 in the bank. It was some very low amount. Those people couldn't even afford to replace their homes. They would never be able to afford to replace the roofs on their homes because they could never save. It was not permitted under Medicaid. So what they said was, hey, we are not going to judge your bank account. We're going to judge your income. Do you really think millionaires are getting income that's less than $2,000 a month? I mean, shut the front door. Come on. Be reasonable. That doesn't happen. That is not going to happen. But they're finding every which way they can to kick people off Medicaid. And in the next conversation, we will talk about the new requirements about checking in every 6 months. Because I can give you story after story about people get kicked off and how long it takes for them to get back on when there was just an error. I yield back.
Time has expired.
And I yield back, Mr. Chair.
The chair recognizes the gentleman from Ohio, Mr. Latta, for 5 minutes.
Well, thank you very much, Mr. Chair. I yield to the chair as much time as he may need.
Thank you. I want to address the earlier comments regarding the coverage loss in this bill. Let me make sure everyone understands. The estimates that are being cited here include policies that are simply not in our bill. The CBO has determined policies in our bill that would only result in 7.6 million recipients being shifted off of Medicaid. All of this comes, all 7.6 that are shifted off of Medicaid come from able-bodied adults who choose not to work. It comes from illegal immigrants. It comes from recipients who are getting benefits who are not actually eligible, so that those who truly need it will be able to get it. And it includes potential future growth that is unrealized. The individuals my colleagues are concerned about today, the disabled children, mothers, and seniors, are not impacted by this bill. We're seeking to strengthen this program, to stabilize this program, to sustain this program for them, the most vulnerable, instead of illegal immigrants and able-bodied adults. It's that simple. It's common sense. Democrats continue to mislead the public about the impact of our bill by claiming that they result in 13.7 million losing coverage. That simply is not true. Democrats are adding an additional 5 million to that number because they are attributing the effect of policies that not only aren't in our bill, but aren't even in the committee's jurisdiction. They want to convince everyone that the impact of our bill is as scary as possible. This is nothing more than fear-mongering. They're telling you that kids and people with disabilities are going to be kicked off of their coverage. That's simply not true. And what's sad is that you know it's not true.
Will the gentleman yield?
You know it is not true.
Will the gentleman yield?
I yield.
Okay, I entered into the record the CBO estimates. The CBO estimate says that we estimate the expiration of the expended premium tax credits will increase the number of people without health insurance by 4.2 million in 2034 relative, yada, yada, yada. So take your 8 million that you're okay with kicking off Medicaid and add these, and that's how you get to the number. Okay, so you might be okay with 8 million people coming off. We're not. But when Republicans, and let's not forget, Republicans tried to put an end to the Affordable Care Act. This is their way of attacking the Affordable Care Act. By allowing these premiums to end, the premium tax credits to end, which is how you get the additional 4.2 million. So I want to make sure, because the math adds up if you do the math, and if I had a whiteboard, I could do it on a whiteboard, but I don't have one tonight. But just believe CBO, Congressional Budget Office, it is 13.7 under their leadership. The bill combined under
Reclaiming my time, the gentle lady knows perfectly well that that is not true. That it is not kicking 13.7 million people off of Medicaid. And that is simply not true, and the gentle lady knows that. This is nothing more than fear-mongering. It's nothing more than misleading the public. What we are doing here is stabilizing this program. This is a program that I worked in for for over 40 years as a pharmacist, and I can assure you, it is a program that is needed. It is intended for the most vulnerable in our society, the aged, the blind, the disabled, pregnant mothers, children, those who truly need it, and that's what we're doing. We're making sure that no illegals are going to be on this program. We're making sure that people aren't registered in more than one state. We're making sure that there are going to be work requirements so that able-bodied adults are truly in need of it. That's what we're doing. We're stabilizing this program. To insinuate, to fearmonger that we are trying to kick people off is simply untrue. And I yield back my time. Is there anyone looking to speak on this? The gentleman from Louisiana, Mr. Carter, is recognized for 5 minutes.
Thank you, Mr. Chairman. You've said consistently tonight that you want to stand up and sustain the program, that these attempts are to find waste, fraud, and abuse. Can you share with me what percentage, if in fact you are able to find these and make these cuts, will go back into Medicaid to sustain the program, as you say?
All of it.
All of it. None of it's going to be, thank you, none of it's going to be used to support tax breaks.
What this does is to free up more money for states so that they can run these programs and invest in these programs. That's why we depend on states.
So all of it, none of it will go for tax breaks, period. You said all of it, so I just want to make sure that we're on the same page. Because for me, all of it means all of it.
When we free up money for the states, they can make investments into their programs, making it a better program for those who truly need it.
Right.
That's what we're trying to do.
And I'm supportive. So every penny we find goes back into building this program. So if we find waste, fraud, abuse, we find people that were not eligible to be there, that money will then go back into building even stronger Medicaid.
Okay.
Yes?
Why don't you go?
That's not a trick question.
I'm sorry. Please repeat.
Okay. So if you're able to find waste, fraud, abuse, people who should not be on the rolls, and you deem that to be savings, will those savings all go back into Medicaid to build a stronger Medicaid? And none of it will go toward giving tax breaks for anyone. That it will all go back in to the program to make it better.
When states save money, when states save money, they have more money to invest into the program to make it a better program for those who need it the most, the most vulnerable in our society. That's what this program was intended for. And that's what we're trying to do, is to stabilize this program, because right now it is out of control.
I'm going to reclaim my time because you clearly don't want to answer this very basic question. So I'm going to let the people figure it out. The chairman has said that all the money goes back, but when I ask him, will it all go back into the program to make it stronger, he tap dances. I yield the balance of my time to Mr. Landsman from Ohio.
Thank you. A quick question for the chair, since you're entertaining questions. You just said that, because we're getting into the policy now. As you said, the folks who are on multiple states, that's a policy change, but it's one of many policy changes, your words. The policy changes that you all are pursuing, you said shift people off of Medicaid. What is the difference?
Shift people who are not eligible and who should not be on it in the first place.
What is the difference between shifting and kicking somebody off?
Shifting people who are not supposed to be on there. Listen, if they're not supposed to be on there, you can kick them off.
Okay,
if
so there's
they're
no
not
difference.
eligible, they should not be on a program
Got it.
as necessary as this program is, because we need to protect these people
I
out.
reclaim my time. That's good. So shifting people off is no different than kicking them off. You have said that you want to save Medicaid, protect Medicaid, sustain Medicaid, but you've admitted tonight, thankfully, that you all are cutting Medicaid.
That is
That you
not
are-
what we
that
have
you are
admitted.
shrinking. I
Do
reclaim
not
my
put
time. I
words
reclaim-
into my
Will the
mouth.
chairman respect the parliamentary rules
you're
of your
shrinking-
committee and allow him to
You're
speak?
shrinking Medicaid by $715 billion. That will mean that 8.6 million people will lose health insurance. You're cleaning up the rolls, as you said, removing people through red tape, co-pays, and cuts to states. So in the last 30 seconds of my time, I do think that you should heed the advice of Republican Senator Josh Hawley when he says, walk away from this. This is morally bankrupt and politically suicidal. I yield back.
The gentleman yields. The chair recognizes the gentleman from Florida, Mr. Bilirakis, for 5 minutes.
Thank you, Mr. Chairman. I yield my time to the chairman of the full committee, Mr. Guthrie.
So I just want to put back to where we are. We put a lot of time, a lot of thought. We want people to be covered. They're eligible for Medicaid. And just so you know, a lot of numbers have been thrown around. This year in 2025, we're going to spend $650 billion on the Medicaid program. When this bill is full in effect, in a decade from now, so this year we spend $650 billion. All the cuts that the other side have been trying to describe, the Medicaid spend under this bill in 2034 will be $1.1 trillion. That's where the direction of the program is going under this bill. We're going to spend $1.1 trillion where we spend $650 billion. So just people need to know where the direction this is going. And so what we're saying, the people that are being shifted off of Medicaid, the people who set up Medicaid, people who voted for Medicaid, people who have this program in place, set up eligibility requirements. And all we're saying is we're going to check the eligibility requirements twice a year to make sure that people match the eligibility requirements. The other group, we have a lot of I read people in the Indian health system, people that have disabilities, people that have a dependent child, people that have substance use disorder, people that have a diagnosed mental disorder. We have all of those exceptions in our bill. So when you break down all the exceptions, if you're 18 to 64 and you're not one of those exceptions, you're able-bodied and choosing not to work. So we're saying all you have to do is work, and you get to, because the taxpayers are providing your health insurance. And we think that's just fair to taxpayers. So people who are eligible, people who are working, all they have to do is work. And somebody says, well, 64. Well, I'm 61. I hope I'm working until I'm 64 at least. But when you're 64, it says you can volunteer. So what you can't do is say you retire at 55, and if you retire at 55 and go on Medicaid, well, you still have to, engage in your community. You have to be a volunteer because you're getting a taxpayer-funded benefit. And so that's what we're asking there. And the other one is people that are covered that aren't here in a legal presence, and we're just saying that shouldn't be covered under the federal health care program. And so the number you need to know is, as of today, we're spending $650 billion on health care. If this bill is enacted as it is written, we will spend $1.1 trillion 10 years from now on Medicaid. So the idea that we're rolling back the program to some negative direction, it's not accurate. And then with the work requirements, we want to make sure that able-bodied people who are eligible to work are working, and people aren't separated from Medicaid because they can't go through the red tape. And so there are requirements you check twice a year. We've made it easier. We do give state flexibility. Arkansas has said, hey, they've learned from their mistakes. They've learned how to do it better. They've got data to do it better. We talked about AI a whole lot in the previous section. And so there's opportunities for states to do it better to make sure people are working and they can check it more often. But the absolute intent and the absolute expectation from the members of this side is that people who are not on Medicaid is because they choose not to work, not for other reason. But I will, again, these two numbers, this year we're going to spend $650 billion. 10 years from now, we're going to spend $1.1 trillion on Medicaid.
Will the gentleman kneel for a question?
Sure.
Don't you think we're going to spend more on health care if we kick, or as you say, shift people off of Medicaid, because they're gonna like get more sick and go to the ER? Don't you think we're gonna spend more in the long run?
Well, so the answer to that is that one, that we just want people eligible to be on Medicaid. If we need to change the eligibility, I mean, when y'all had the majority, I didn't change the eligibility. And the second thing is, we do think people who are qualified to work and able-bodied to work should work. And so if they work, they get their health care. And the third section is that people aren't here in a legal status, and that's a debate I know that we can have, but we feel that to be on the federal health care program, you should be here in a legal status. And so but we're still going to spend that much more money on health care. And I will yield back to my friend from Florida.
The gentleman's time has expired. The chair now recognizes the gentleman from California, Dr. Ruiz, for 5 minutes.
Thank you, Mr. Chairman. In Spanish, we have a saying, entre el dicho y el hecho hay un gran trecho. Between what is said and what is done, there's a large trench. And, you know, you said you want to increase people on Medicaid. Well, we did in the Affordable Care Act with the Medicaid expansion, of which you voted against. But now this bill is designed to kick those people out. It's essentially a backdoor way of repealing the Affordable Care Act, the Medicaid expansion that covered people, low-income individuals, even more in Medicaid. So we're hearing over and over from Republicans that this bill will not cut benefits. That's not true. Reducing federal funding, imposing restrictions on how states can pay for Medicaid, creating administrative burden and red tape for beneficiaries, these things have consequences. The bill simply passes the buck to states to deal with the massive financial problem it creates for them. The Congressional Budget Office estimated that states would resort to limiting optional benefits and reducing enrollment in Medicaid should provisions in this bill become law. That is cutting benefits. CBO also estimated that the bill will result in 13.7 million individuals losing their health care coverage. How is that not cutting benefits? When you legislate, you have to look at the big picture. Another part of this big picture is that these red tape work requirements are designed to get people off of the rolls, is designed to go after the Medicaid expansion that covers more than 20 million low-income people. The Medicaid expansion saves lives. More than 27,000 lives and counting have been saved across the states that have adopted to expand Medicaid because of increased coverage. In states that expanded Medicaid, opioid deaths were 6% lower, cancer screenings were 5% higher, and rural hospitals were 62% less likely to close. And now you're going after Medicaid expanded patients with these onerous work requirements. You know, we have some examples here, as we mentioned before, through the Arkansas and the Georgia experiment. In Arkansas, it resulted in 18,000 Arkansans from being kicked off of Medicaid in just 1 year. 1 in 4 people subject to the requirements lost their health care, many of whom were working or otherwise subject to an exemption. In other words, these are individuals that qualified. In Georgia, which has the 3rd highest uninsured rate in the country, something I would not be proud of, burdensome red tape requirements have prevented over 240,000 Georgians likely eligible for health care from enrolling in its state-specific Medicaid expansion program. So let me give you some examples of how this works. The red tape requirements create crushing administrative barriers like paperwork, long wait lines, and unreliable online portals for Americans trying to stay on care. In Arkansas, people who try to set up online accounts reported an inability to get in touch with state agency staff, long wait times, and an inability to navigate the state's online portal. One Arkansan attempted to document her work hours, shared, quote, "My mom said I needed to go online and do this, and that I was on the phone with a lady trying to. She said I needed to do something with my hours. Well, I was on the phone with a lady for like an hour. Then she sent me to someone else. Then she sent me to someone else. So I just gave up from trying to report my hours worked." Medicaid enrollees who may be eligible for certain exemptions because they are caregivers, disabled, or students often get buried under red tape and can lose their health care as a result. One enrollee applying for a caregiver exemption shared, quote, The worker told me that I would need to provide documentation showing that my husband's disability required me to be a caregiver. The worker was not able to tell me what kind of documentation I would need to provide. So red tape requirements often require logging hours electronically, punishing low-income Americans who do not have internet, smartphones, cars, or reliable transportation to log hours in person. In New Hampshire, one mother shared her experience trying to log her work hours. Quote, "We do not have internet at our home, so I rely on my phone. At times, we do not have phone service due to our finances. Even when I have phone service, sometimes when I try to upload documents on my phone, I have trouble and end up needing to go to Health and Human Services in person. But right now, I do not even have a vehicle that is roadworthy to drive to Health and Human Services." These are clearly examples of way this is designed to get people frustrated, to give up, to not undergo these onerous work requirements, reporting to get them out. In fact, the vast majority of the 8 million people that will be kicked out of Medicaid in this bill come from these type of onerous work requirements. Entre el dicho y el hecho hay un gran trecho. So all night we'll be correcting these falsehood over and over again. And with that, I yield back.
The gentleman yields back. The chair recognizes the gentleman from Texas, Representative Pfluger, for 5 minutes.
Yeah, thank you, Mr. Chairman. Hey, I loved our AI discussion earlier, so I just did a little AI search. And I want to see if because I think we agree that healthcare is important, but this is just what it said on the AI overview that's really pretty basic. Medicaid was designed as a health insurance program for low-income individuals, including children, some adults, pregnant women, and people with disabilities. And I just want to, since we're in the business of asking questions, does anybody disagree with this on the other side? That's just the AI overview. I mean, it's not like technical or anything. But, you know, I bring that up because I think that our similarities on healthcare outweigh a lot of our differences, that we want to make sure we provide healthcare for people that deserve it.
Will the gentleman
When
yield?
it comes to, I'm going to keep going for a second. When it comes to Medicaid, you know, this program was designed specifically for a group of people that would not have otherwise had benefits. And that's really, I think, the heart of this. And that's where that brings us to the differences, I think, that we have. And the differences are, and please correct me if I'm wrong here, but the differences are that we don't believe people that aren't eligible for Medicaid should be receiving the benefits. I don't believe that the 1.6 million people who are fraudulently enrolled in Medicaid should be taking benefits from the people that came into this room here today that were fighting for it, or for the people in my district, the children who need Medicaid. So I'll ask the gentleman from California, because you spoke last, but do you agree that 1.6 million people who are fraudulently enrolled should not receive Medicaid?
I agree that if there's any fraudulent enrollment, that the court should settle who is committing fraud and who is not,
All right,
and not by
let me go to the
theoretical
next-
policy.
Let me go.
The other
I'll
thing
take my time back. I want to ask you a series. I want to ask you a series.
And I have another answer
Okay,
when you say low income.
I'm gonna take my time back. What about people? My friend from California. If you live in $1 million home,
I don't.
Should you be qualified for Medicaid?
I don't live in $1 million home, trust me.
Lives in $1 million home, should they be
In
enrolled
California, you
Medicaid?
can't buy a home for less than $1 million.
No, I don't think,
I'm
they
asking-
should. But let me ask you a question. Do you think an
I'll reclaim my
individual?
time.
The chair recognizes
Thank
the
you.
gentleman from
Thank you.
Texas.
We got all night. It's
This
2
is
o'clock
a
in the morning. We
serious
got.
question. But if you allow me, this is
Buddy.
a serious question.
Come on.
Sir,
Well, he's asking me questions. He wants to engage. I'd like to.
chair
ask him
recognizes the gentleman from Texas, Mr. Pfluger.
Thank you.
He has 2 minutes left.
We got lots of time to do this. Trust me. Look, we have a difference, I think, between the two sides where we don't believe that people who are here in this country illegally should receive Medicaid benefits to the detriment of those that we just described as having been needing the benefits as the targeted population. This bill stops us from paying per member per month fees to insurance companies to pay them for covering people who aren't even alive. This bill stops criminals from fraudulently billing Medicaid and impersonating doctors who passed away. This bill stops Medicaid from paying for gender reassignment surgeries for minors. That's a difference, I think, between the two sides. And that's okay. Let's just call this what it is. There are differences in the way we see this. This bill stops able-bodied adults who have chosen not to work, who have chosen, and that's their choice, and there's nothing wrong with that. But this bill says, you know what? If you're an able-bodied adult and you don't want to work, you don't qualify for Medicaid. That's a difference between the two sides. It's okay to debate that. We are saying that we believe there's a work requirement to be able to receive Medicaid.
Gentlemen, yield.
So I will ask you a final question.
Well,
If you'll answer the question, I'll yield. Do you believe that you should have some sort of work requirement to be able to receive these benefits?
No, that's an easy one.
I'll
Now,
take
but
the
hold
time.
on.
I'll take the
But-
time.
Okay, now, so look, there's a lot of.
He's my friend, so wrap it up,
Yeah,
10 seconds.
you're a good baseball player, and we play good together in the baseball field. Look, you said that Medicaid was intended for low-income individuals.
No, that's what AI said.
Well, I mean, and we
We had a good
agreed, and
AI
you agreed,
discussion.
and you agreed. You said that.
Mr. Chairman, my time has expired. Yield back.
The gentleman yields. The chair recognizes the gentlelady from Massachusetts, Representative Trahan, for 5 minutes.
Thank you, Mr. Chair. I move to strike the last word.
Without objection?
So I think we're going to go all morning with a tastes great, less filling volley, back and forth. You're going to accuse us of being for all sorts of people who should be on the rolls, and it's just going to be a complete misrepresentation of what we believe. Democrats are pretty unapologetic about expanding health care, right? We came up with the ACA. Since we enacted the ACA, Republicans have been trying to repeal it. And the problem with that is you've never had an alternative. So when you talk about shifting people off of Medicaid, like just be honest about it. You're taking away health care because you don't agree that we ever should have expanded Medicaid to begin with. You just used AI, which proved it's flawed, to define what Medicaid, who that should cover. So let's just call work requirements what they are. They're obstructions. I mean, to the sitting chair, Georgia's the only state in the country that's currently enforcing Medicaid work reporting requirements. The results are already proving what we've long known. This is an expensive, bureaucracy-creating policy, and it doesn't work. Despite spending over $40 million in state and federal tax dollars to launch the program, fewer than 4,500 people have enrolled. That's well short of the state's own goal of 25,000 in the first year, and it's less than 2% of the 359,000 Georgians who would have gained coverage if the state had simply expanded Medicaid like 40 other states did. Nearly 80% of the program spending has gone to administration and consulting fees, not medical care. That means public dollars are being spent building bureaucratic barriers instead of breaking them down. And now the state has launched a $10.7 million advertising campaign just to convince people to sign up for a program that was designed to be difficult to access in the first place. Look, if this is the model that our Republican colleagues want to take national, yeah, we're going to stay here and fight it tooth and nail because it doesn't work, it's expensive, and it basically just takes health care away from people. Georgia's experiment is already showing us what the outcomes will be. Fewer people with coverage, more wasted taxpayer dollars, and a health care system that's harder, not easier to navigate.
Will the gentlelady yield? Right here, Lori.
Yes, I'll yield.
Would you agree that the biggest difference we have is our viewpoint on whether or not work requirements should be part of this system? I mean, do you agree, like, just the foundational debate that we
No,
have?
we're going to go one by one on all the ways that your policies that you are putting into this bill translates into less people with health care. Work requirements is just one of them. I'll stay
Lori,
here
would
all
you,
night.
would you mind,
I yield back.
would the gentlewoman yield?
Oh,
her
yes,
time?
absolutely. I yield to
Thank
my
you.
colleague from Massachusetts.
The gentleman from Texas is talking about coverage and disagreements there, but I want to talk about cost and disagreements there, because there actually is something that we both agree on both sides, which is we actually agree on a version of universal access to health care. It's a 1980s law, EMTALA, that says that if you get sick, you can go to the emergency room, right? You call 911, someone has to answer. Does anybody on the other side of the aisle disagree with that? If you call 911, someone has to answer, right? So what we're saying as Democrats is, hey, you know, it's actually a lot cheaper if fewer people have to call 911 and go to the emergency room, and instead they get to see a doctor or afford their prescription drugs or see a substance abuse therapist before they go to an emergency room. And what Republicans are saying is, no, we want to add copays to people seeing a primary care physician. We want to gut SAMHSA and substance abuse treatments. And we want to kick people off the Medicaid rolls so they have no access to preventative or primary care. And at that point, those people still get sick, right? Sickness is not an eligibility requirement. They're still sick. They're going to the emergency room, and they will now, not just they, all of us will pay more money. So Democrats care about lowering healthcare costs through comprehensive healthcare policy. Republicans want to have higher health care costs. And I yield back to the gentlewoman from Massachusetts.
The gentlelady yields. The chair recognizes the gentleman from Ohio, Mr. Balderson, for 5 minutes.
Thank you, Mr. Chairman. I yield my time to Chairman Guthrie.
Thank you very much. And I've heard the Arkansas come up a couple of times, so I'm sure this will as well. So I just want to start by saying this year we're spending $650 billion in Medicaid. We're going to spend more money each and every year over the next 10 years. In 2034, under this bill, the CBO estimates we'll spend $1.1 trillion in Medicaid, from $650 billion to $1.1 trillion. And so on the work requirements, because my friend doctor from California said that brought up the Arkansas model again, and we don't want to repeat the Arkansas model. We agree that was the wrong way to do it. And I strongly believe Arkansas didn't set their process up because they wanted to use it to get people off Medicaid. They wanted people who are going to take taxpayer dollars for free health care, have some obligation to do something for it. Most people work for their health care. They get it through their employer. And we think that able-bodied people who are eligible to work should do something and not just have something given to them for free. And so Arkansas did that. They made it overly cumbersome. They made monthly checks. It was outside of the normal process. People couldn't get checked in the way they want. So Arkansas backed off because they knew that was separating people from Medicaid that they didn't want separated from Medicaid, and they're trying to do it better. So just since we brought Arkansas and Georgia up a couple of times already, just remember the bill today would only require a beneficiary to have to verify work at the time of enrollment or during a redetermined position of their eligibility. And this allows states and beneficiaries to take advantage of the existing processing and paperwork that they already go through. This is already a pretty well-established concept for states. They use existing data sources all the time to verify a number of different people with eligibility requirements. So right off the bat, we're talking about paperwork that's already part of the current system by learning from it. And I accept the criticism of what Arkansas did it with good intentions, but I accept the criticism of what they did. So who are we requiring to work? We are requiring to work. We're not requiring. The work requirements do not apply to pregnant women, individuals under 19, individuals over 64, if you're foster youth and former foster youth under the age of 26, so it does not apply to you. If you're members of a tribe, it does not apply to you. Individuals who are considered medically frail, which includes but is not limited to individuals who are blind, disabled, have a chronic substance use disorder, who have a serious and complex medical condition. You are not required to work. Individuals who are already in compliance with work requirements under TANF and SNAP do not have to go through the process with Medicaid. Individuals who are a parent or caregiver of a dependent child or an individual with a disability are not required to work, or are incarcerated or recently released from incarceration within the past 90 days. There's also provisions for short-term hardship waivers for natural disasters and for counties where the unemployment rate is greater than 8% or greater than 150% of the national average. So if you're not pregnant, if you're between 19 and 64, if you're not a foster youth or a former foster youth under the age of 26, if you're not a member of a tribe, if you're not an individual who's medically frail, if you're not an individual who is already in compliance with other work requirements, if you're not an individual who is a parent of a caregiver or a dependent child or individual with a disability, or not one who is incarcerated or recently released from incarceration, or you're not in an area where there's a short-term hardship for a natural disaster, and all those apply. So if you're not pregnant, if you're between 18 and 64, you're not a foster youth, I'll have to repeat it because I know it's going to come up again, not a member of a tribe, if all those things I just described, then I think you're an able-bodied person. If you're not working in this condition, you choose not to work, and we have a system in place. We're requiring a system to be in place that the red tape doesn't eliminate people just because they can't go through the red tape. And I will yield back.
I yield back, Mr. Chairman.
The gentleman yields back. The chair recognizes the gentlelady from New York, Ms. Ocasio-Cortez.
Thank you so much, Mr. Chairman. I just want to also clarify once again that, as has been stated several times by the Republican majority here, many of the work standards and requirements and many of the ways that they are designing these changes to Medicaid are based on changes in Georgia. Georgia has the third highest number of uninsured Americans in the country. Catastrophic. And that's with the so-called improvements from monthly reporting paperwork requirements to annual paperwork requirements. And so the Republican majority has looked at the state with the third highest number of uninsured Americans and said, that's what we want to model our Medicaid system after. This catastrophic failure. And I understand that the Republican majority wants the American public to be sold into accepting this by saying, you know what? We are secretly paying for Medicaid for every Venezuelan in the world, and that there are millions of 8-year-olds getting sex reassignment surgeries on Medicaid dime, and if we just take all of that, that will somehow make your Medicaid, cut that and make your Medicaid better. Sounds ridiculous because it is. And then they want to say, if you have $1 million house, right, let's set this cap at $1 million. Okay, cool. I have a question though. I have another number that I think is interesting. Maybe what if you're getting a $22 million house, inheriting a $22 million house? Because what Republicans are saying is that if we make all of these cuts, we will then shift that and invest it into Medicaid for people who actually deserve it. But if that were true, then the top line number, our budget for Medicaid, would be staying the same, right? We'd be taking from undeserving people and giving it to deserving people, and that should even out. But that's not what's happening in this bill. This bill is cutting nearly $1 trillion in Medicaid spending overall. Why? Because down the hallway, they are trying to finance tax cuts for people who are inheriting $22 million houses. Because in 2017, Republicans and the Trump administration tried to increase the exemption of what you get a tax break on. If you used to inherit an $11 million house, you would get no taxes. You had no taxes on that, in that estate tax. They said that's not enough. We need no taxes on a $22 million house.
Will the
And that
gentlelady yield?
Expired, I have to finish. That expires now. And it costs a lot of money to extend that tax break up to $22 million. So to pay for that, they are doing this. They are modeling and completely retrofitting the United States Medicaid system to model it after the state with the third most catastrophic uninsured American number in the country. In the dead of night at 2:38 in the morning, when everyone is asleep, when we've asked for the opportunity to do this in the light of day, so that people can call their representatives' offices in order to stop this disaster. So let's be crystal clear about what's going on right now, because it's not so-called illegals who do not receive a dime in federal Medicaid dollars. That is a tall tale. Being nice today. And with that, I yield back.
The gentlelady yields back. The chair recognizes the gentleman from Texas, Mr. Weber, for 5 minutes.
Thank you, Mr. Chairman. I'm going to yield back to you.
Thank you. I appreciate that. Because I do have the honor and privilege of representing the state of Georgia, I do want to speak about that. And I want to be very clear about the work requirements, the community engagement requirements that are proposed in this bill and how they are different from what Georgia is doing. First of all, let's understand, Georgia is not an expansion state. Georgia did a targeted eligibility expansion for select adults only if they meet the state's work requirements. Now, it's difficult to compare the results to an actual expansion state that covers all low-income adults. But let me emphasize again, the steps in this bill that this bill takes to ensure that those who are working will keep their coverage. The bill is designed to be flexible. It's designed to be flexible for states and easy for beneficiaries to meet the requirements. It only applies to able-bodied adults without dependents. Chairman Guthrie went over the exceptions. Again, it only applies to able-bodied adults without dependents and provides ample exception processes like carve-outs for short-term hardships and for areas facing economic hardships where there are insufficient jobs. The number one goal of this bill is to make clear that if you're working, that the process can work to make sure that you keep your health insurance.
Mr. Chairman, I have a
Make sure you
question.
keep your health insurance. But at the end of the day, we believe that it's the right thing to make Medicaid coverage for able-bodied adults, just like insurance for every other American.
Will the chair
You've
yield
got
for
to
a
work
question?
to keep it.
Will the chairman yield for a question?
Actually, at time now, you want to keep going, Mr. Chairman? All right. We'll yield to the gentlelady.
Thank you. In terms of some of the exemptions, pregnancy is covered, correct?
May I interrupt? I'm glad you're addressing us instead of speaking to the camera.
Yeah.
Keep going.
Pregnancy is covered, correct? Yes. As an exemption? I have a question. Given the Dobbs decision and the fact that many women in many states are forced to be
All right, I'm
carrying...
going to have to stop. I'm going to reclaim my
Okay,
my-
what about
reclaiming my
miscarriage?
time. Thank you.
What about miscarriage?
I'm reclaiming my time. Thank you. I just want to make the point that we'd like for you to address the Republicans and let's have a dialogue
Okay.
this way and not to a camera. Mr. Chairman, I yield back.
But
The gentleman yields back.
But I'm asking the question, what about a miscarriage?
The gentleman
I'm
yields
trying to
back.
engage in the way that the
The
gentleman
lady
requested
is
me
out
to.
of order. The gentleman yields back.
Oh, so
The
we don't want to
chair,
answer
is
for
there
women having
someone on the
miscarriages and
Democratic
bleeding out in
side
parking
who
lots?
looks
Okay.
to be recognized? The chair recognizes the gentleman from New Jersey, Mr. Mendez, for 5 minutes.
Thank you, Chairman. And first, I want to associate myself with the comments from my colleague from New York, because I think she hit this exactly on the head. This would all be a different conversation if this wasn't part of a budget resolution that calls for the extension of the original Trump tax cuts. So we know that those cuts have to be paired with spending cuts, which is what this conversation's about, the $880 billion that we have to cut. And that's why it makes listening to our friends across the aisle so difficult, because you're tying yourself into knots to talk about improving Medicaid, but you're not doing that, right? So as my colleague from Louisiana said, if you were taking this money that you believe you're saving in the program and reinvesting it in Medicaid, well, that would make a lot more sense. Mr. Pfluger said that he wants the program to work for the people it was intended to, the people who are here today, both earlier in the day and now at 2:30 a.m., but the savings that Republicans think that they're going to find are not being invested to make those services better for Medicaid recipients. Chairman Guthrie has talked about how much we're going to be spending in 10 years, but whatever savings that Republicans think that they're going to find are not being put towards the solvency of the program for what we're going to have to spend in 10 years. In this moment, the reason we're having a conversation around potential savings in Medicaid, which is really cutting health care for millions of Americans, is to pay for the tax cuts, as we've previously discussed, disproportionately benefit the wealthy. We've had this conversation around the specific words that Republicans would like to use, like shifting. If I was in an office and I was shifting an employee, I'd be shifting them to another role or to another office. I don't hear the Republicans talking about where they're shifting these individuals to, off Medicaid to what program? Because it's not just Medicaid, it's also the ACA, right? So you're making it harder for people to have health care, and you're not telling anyone where they're going to be shifted to. So if someone relies on Medicaid, right, and now they have these work requirements, this red tape, right, that like in Georgia, like in Arkansas, boots people from Medicaid, right, where are you, quote, shifting them to, right? And you haven't made that point clear at all, or spoken to the American people who rely on Medicaid, who rely on the ACA expansion to know where they're going to go. And that's why they're so worried, and that's why we're so worried for them, because we know you're not reinvesting in the program. We know that you have no alternative to Medicaid or the ACA, and that's what's so alarming. And until you can answer those questions, we're going to keep calling out what harm this will do. But I want to yield to my colleague from New York, because I think she was about to touch on some really important questions that the American people need to hear.
Thank you so much. I think my colleague from New Jersey, it seems as though I touched on something that was sensitive for the majority. But this is an important question. Many of us, we're here in Congress. This is a body that is less than 30% female, so it is not uncommon that many of my colleagues are unfamiliar with our biology and the needs for 50% of Americans. Since the majority did not seem interested in answering the question, I would like to pose a question to council. Able-bodied American. Obviously, if you're pregnant, you are covered under the exemption, correct?
That is correct.
If you are not pregnant, you would not be covered under the pregnancy exemption, correct?
That is correct.
So if a woman miscarries, she would then be kicked off the exemption, correct?
The exemption also includes postpartum coverage.
Postpartum, miscarriage. Is miscarriage covered under that?
If a state includes miscarriage under postpartum coverage, then yes.
Federally, in this statute, is miscarriage explicitly included in the language of the text?
The bill includes postpartum coverage as an exemption.
Miscarriage is not listed, correct?
If a miscarriage by a state is included in postpartum coverage, then yes.
Is miscarriage explicitly included in the text of the bill?
It is not explicitly stated in the text.
Thank you very much. I think this is tremendously important for my colleagues to understand, because President Trump nominated anti-abortion, anti-choice Supreme Court justices that now, because of the Dobbs ruling, have forced women to carry not just carry out miscarriages, traumatic miscarriages, which can be debilitating, life-threatening, and then on top of it, could potentially endanger their insurance status. Sit with that. Thank you.
I yield back.
Gentleman yields back. The gentlelady from the doctor from Iowa is recognized to speak on the amendment.
Thank you, Mr. Chair. I move to strike the last word. I've heard mention from our colleagues on the other side of the aisle, $22 million houses. And let me just explain the death tax from an Iowa perspective. The death tax is a fifth-generation family farm. You've heard the expression land rich. They have assets in land which are not sellable, and in order to pass a farm down or a small business down from one generation to the next generation, you have to pay the inheritance tax on that. And that tax often requires the sale of that farm. So I have farmers that want to pass their farm on to the 6th generation or their small business. I don't know about the $22 million homes in New York, but I know about the farms in Iowa, and I know about the farms in Texas where I grew up. Number 2, my colleagues on the other side of the aisle have mentioned the ACA, and they've talked about loss of coverage, or they've talked about what we're trying to do, thinking and reading our minds. Well, I happen to remember the ACA very well. I happen to remember that the Washington Post gave 4 Pinocchios to the president for the lies, or excuse me, the misrepresentations and falsehoods about the ACA. What were those?
Which president?
If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. Your premiums will go down by $2,500. Premiums never went down. People lost their coverage. They lost their health care. They lost their health insurance. And I had patients calling me who lost me as their doctor. You didn't seem to care about anybody losing coverage at that time. That has happened, and insurance premiums have gone up every single year. People that were small businesses that offered coverage could no longer offer coverage. So I find it rather remarkable that you would comment on this now on a program where the costs are skyrocketing. With that, Mr. Chair, I yield.
Will the gentlelady yield for a question?
No, I've already yielded back.
Gentlelady yields back. Is anyone seeking? The gentlelady from California, Ms. Matsui, is recognized for. Gentlelady, okay, gentlelady's time from California, Ms. Matsui's time.
Thank you. Thank you for yielding. Well, Mr. Chairman, you all keep talking about these exemptions that are in place to protect people that I guess you agree deserved health coverage from losing it under the red tape requirements. So I want to follow up on what my colleague from New York was talking about, because I guess I don't know how this is going to work. There's a provision in the text related to automatically determining compliance with the requirements. And so I want to ask counsel about that if it's in the bill. So can you confirm on page 76, line 10, that a state only needs to automate this process, quote, where possible? Quote, where possible? That's from the bill. I'm asking counsel.
The question is if it says where possible?
Yes.
Yes, it says where possible.
Yes, it does. Okay. And then I guess I'm just wondering how it would work for the state to automate some of these exemptions. So let me go back to what my colleague from New York was saying. First of all, it exempts somebody who becomes pregnant. How's a state automatically going to know that somebody enrolled in the Medicaid program becomes pregnant and should be exempt? Are people going to be reporting pregnancy or what? Is that in the bill?
I would need to refer you to the Centers for Medicare and Medicaid Services for implementation.
Is that in the bill, how they're going to determine whether somebody's pregnant?
I would need to refer you to CMS for
That
how
answers
implementation.
no. What happens then if they have a miscarriage? How will the state know that automatically they're exempt?
I would need to refer you to CMS for
You
an
don't know that
implementation
either.
question.
How would they know if somebody had a stillbirth? Would they know that?
Again, for implementation, I'd have to direct you to CMS.
Okay. How about somebody, because as the chairman said, somebody with a substance use disorder is going to be automatically exempt. How's the state going to know if an individual has a substance use disorder? Are they going to require some kind of reporting by providers?
The implementation would be established by CMS.
So that's not in the bill either. What about a disabling mental disorder, and what condition, does the bill say what conditions that would include a disabling mental disorder?
The definition is established by the Secretary.
So we don't know what a wait, so Secretary Kennedy would establish what a disabling mental disorder was?
The Secretary of Health and Human Services.
That would be, okay, that would be Secretary Kennedy. We look forward to that. Now, somebody with a serious or complex medical condition, is that defined in the bill?
It would be established by the
Yeah,
Secretary.
it's not defined in the bill either. And so I think you can see where I'm going. Is the state even required to automate exemptions? Or is that, or again, that goes back to where possible, correct?
I'm sorry, that was the question, yes.
That's directed at you, sir.
Yes.
Sir. Okay, so, Mr. Chairman, it seems to me the only thing the states are required to do is to automate compliance with the work standard. So all the people I described above, as well as parents and others who are purportedly exempted, would have to prove somehow that they were exempted. And it's obvious that these exemptions and the so-called automation is nothing but window dressing because there's no provision in the bill for how you're going to be able to do this. I thank the gentlelady for yielding, and I yield back.
Gentlelady yields back. Is there anyone seeking recognition? Gentleman from Georgia, you're recognized for 5 minutes to speak on the amendment.
Yes, just a little background, and my colleague from Iowa brought this up. And these numbers are astounding, but, and I think it's all surrounding, where we're headed and why we're dealing with this right now. Thank God we're dealing with it because it does not paint a really pretty picture for the future. But number one, I don't think it can be denied that in 2018, right before COVID, we had the best economy in the history of my lifetime. Now, how did that happen? I knew the left was delusional.
I think, I'm not quoting here, but I think it was about, one of the reasons I ran for Congress was the growth then under the President Obama was about 1.3% in GDP. And it was kind of considered that that's about all it should be. That's just the way it's going to be. We're not going to manufacture anything anymore or whatever. But I will say this, since 2010, total national health care expenditures have increased by $2 trillion. We're paying today $4.9 trillion in health care costs. It's almost 17% of GDP. Now, I've heard different folks say that we need to model our health care after other nations. Well, you got Germany, they spend about $7,000 per capita. Sweden, $6,000. Canada, our neighbor, $5,905. The United Kingdom, $5,387. And so I think what we're trying to do, and this is a question that I ask, I served on the Healthy Future Task Force, where's all the money going?
Will the gentleman yield?
The providers, they're, what they're being paid on a fee basis is going down.
Yeah. Will the gentleman yield?
Yes.
Yeah. So I appreciate this point because healthcare in America costs a lot of money, and I've heard from the gentleman from Georgia as well as the chair of the full committee that Medicaid spending is out of control and that Republicans are coming in to save Medicaid by cutting it. And I think we have to just put facts on the table that Medicaid is actually the most efficient health program in the country, okay? And that's despite covering costly care that no other payer covers, particularly long-term services and
Did
supports.
you just hear what I said? Did you just hear what our health care cost is? Do you know we're spending almost $800 billion on Medicaid?
Medicaid expenditures are growing at a slower rate than private insurance. Private insurance premiums are going up at 2x wages. Medicaid expenditures per capita are going up slower than that, and that's despite the fact that Medicaid is covering long-term services and support for the elderly. And here's the thing. The home and community-based services for long-term services and support are optional. It's not federally mandated, it's optional at the state level. So when you all slash Medicaid, the states are going to have to restrict the home and community-based
So what you're
services.
saying is if we put everybody in this country on Medicaid, we're going to cut it and we're going to be down there with Canada at 5,906.
I'm saying that
per
Medicaid
capita.
is a much more efficient insurer than United Health Group is, and it's certainly a more efficient insurer than
Well,
the emergency
I could
room is.
assure you of this, that, if you need a hip, you're going to get in line. I'm going to tell you, the biggest problem we got in healthcare today is a shortage of providers, okay? And the reason for that is because, Medicaid and the provider network is not there.
If the gentleman from Georgia...
I mean, New York right now has a tremendous shortage of doctors.
Yeah, we should
mean,
challenge
people are
certificate of
waiting
need
in line for
laws
healthcare.
or foreign trained physicians. We can have that conversation. That is not the conversation we're having in this room right now. The conversation we're having in this room right now is not how to strengthen Medicaid, not how to provide home and community-based services for the elderly population, which is growing, which is why Medicaid spending is going up. The conversation we're having is how do we pay for the tax cuts for people who don't need tax cuts?
Yeah,
And we're
here's
doing
how
that
we
by
pay
taking
for
away
it.
healthcare.
We grow GDP, okay? That's the secret. That's the secret sauce. If we don't grow GDP, we're out of business. We can't,
We're not having that conversation in here either. The conversation we're having in here right now is taking away healthcare.
Yeah, well,
Gentleman's time.
I've looked at it
I
for a
don't
long, okay, my time is, I yield
Time's
back.
expired. See, discussion on the gentlelady from New York, Ms. Clark.
Thank you very much, Mr. Chairman. I did want to just share with one of my colleagues from Texas that when the gentlelady from New York looks at the screen, and if she wants to check her hair, she wants to say anything she wants to that screen, she has the right to do so. And there's not a member on this panel that can tell another member where to look, who to look at, and where they want to look. So you need to back up off your rules because we are not going to be dealing with that tonight. The man from Texas, and if you know who I'm talking about, let him know I said it. On the other side of that, there was a colleague from Iowa that talked about the farms, and I can appreciate the 6-year farm passed down of $22 million, but I can also appreciate the fact that in Brooklyn, New York, you can buy your house when you're 50 years old at $20,000, and now you're 65 years old, and that same house that you bought is now $1 million. But guess what? You're retired. You're retired. So, we are not going to be able to crack the code on this because you folk want to give your rich friends, your billionaires, the tax cut and extend it. But there are some realities that we need to deal with here that is not a one-size-fit-all scenario. And I'm going to look at myself. Wait, my hair, wait. Oh, okay.
Will the gentlelady yield?
I will yield.
Thank you so much. And speaking of where we are addressing and who we are addressing, there are 13.7 million Americans on the other side of that screen right there. Hello? Hello. I'm talking to you because I work for you. And they deserve to see what is happening here. Because there are plenty of districts, including Republican ones, where 25% of your constituents are on Medicaid. 40% of your constituents are on Medicaid. And yes, I am talking.
Will the gentlelady yield?
I am talking to them, and I will not yield because it was a terribly disrespectful comment, and I will not yield to disrespectful men. Thank you very much.
You yield back?
We'll yield back to the gentlelady.
Yes, I yield to the doctor from California.
Yeah, I'm going to look at the screen too and address all the people that are watching. I've heard a lot of misstatements from the other side. They mentioned that their intention is to cut in order to save. And that's the whole reason why we're having this. That's not true. The whole reason why we're having this hearing is because of the budget resolution that around the tax cuts that primarily will go to billionaires, said that the Committee on Energy and Commerce shall submit changes in laws within its jurisdiction to reduce the deficit by not less than $880 billion for the period of fiscal years 2025 through 2034. It doesn't say anything about saving Medicaid or any altruistic reason. It doesn't mention even waste, fraud, and abuse. It's just spin that they're using now. The purpose that we're cutting so much is in order to pay for the reconciliation bill that is going to give tax cuts in the billions to billionaires. It's right there in the budget resolution as part of this tax bill. So spare me the phony, altruistic intentions. The other thing that they mention is that costs are going up in healthcare. Well, if you cut Medicaid, if you take $13.7 million off of a million people off of Medicaid, costs will go up because Medicaid helps with prevention. It helps lower costs. If people can't see their doctors and people get sick and go to the emergency department or have to be hospitalized in the ICU, costs will go up. And regarding this number that's thrown out, whether we're going to spend 1.1 trillion, et cetera, look, in 2035, you're cutting $710 billion from Medicaid. So regardless of what we spend in the future, because inflation goes up, people's health will go down, costs will go high. I mean, it's almost absurd and very misleading to say that just because we're going to spend more in 2035, that somehow this isn't going to cut Medicaid. Thank you.
The gentleman's time's expired. I don't know whose time it was, but it's expired, so.
I yield
anyone
back.
Speak time? Okay, thanks, Ms. Lark. Anybody have time on our side? Gentlelady from Indiana seeks recognition to speak on the amendment.
Mr. Chairman, I would like to yield my time to the gentleman from Georgia, Mr. Carter.
I thank the gentlelady for yielding, and I want to make an important point here, and that is that we've been talking about work requirements, we've been talking about getting illegals off of Medicaid, we've been talking about the duplication that some recipients were eligible in more than one state, and all of those things are important, and all of those things do save taxpayers money and give states the opportunity to improve the programs by having more money available, and all of them sustain and save and stabilize the program, and that's important. But there are other things too. There are other things that this bill does. One is the doc fix, and I think that's important. It was mentioned that we were having trouble getting physicians to participate in this program. One of the reasons why is because since 2001, Medicare physician payment rates have declined by roughly 33%. That creates a growing instability for medical practices, and we don't have as many doctors participating because of that. That is we need a healthy healthcare marketplace so that we can have a system that encourages independent practice instead of having a system that only works for consolidated healthcare conglomerates. So far this decade, we've been having to patch together payment updates to the Medicare physician fee schedule. But that's not a good way for us to operate and certainly not good for the physician workforce.
Would the gentleman yield?
Thankfully, this bill, just a second, thankfully this bill includes a fix to the Medicare physician fee schedule, marking the first time physician reimbursement will be tied to inflation. And that's important. So to my point, what we are doing is that we're making this program better. We're stabilizing it. We're sustaining it. We're saving it. We're going to have physicians for the most vulnerable in our society, thanks to what we're doing in this legislation, in this bill. The structural reform in this bill to physician payments is essential. to preserving beneficiary access to care and addressing longstanding deficiencies in the Medicare physician fee schedule. So this bill in a lot of ways includes many big wins for American patients.
Will the gentleman yield?
And I'll yield to the gentlelady from Iowa. Mike.
Sorry, thank you. Mr. Chairman, thank you for recognizing me. Thank you for holding the markup and advancing this legislation to safeguard and strengthen Medicaid. I'd like to comment on Representative, I'm not allowed to say his name, excuse me, the gentleman from Georgia's comments recently. I think what's very important in this bill is the doc fix. This is a tremendous issue in Iowa, in rural areas such as Iowa, in getting physicians into practice. 75% of the MEI for year one, and then 10% of the MEI for subsequent years. This is a policy that I've been advocating for since my first term in Congress, so that seniors and people on Medicaid can have access to physicians, especially independent physicians, and in rural areas. This not only saves them money and preserves quality care, but it saves the program money as well, too. I look forward to working with us on a permanent, lasting doctor's fix and on physician reimbursement, and I yield back the balance of my time to Representative from Georgia.
And I yield back.
Will the gentleman yield?
All right, the gentleman yields back. Anyone seeking recognition? The gentleman from Florida. Do we have more than one Floridian? Mr. Soto, we do, so I'll tell you by name.
We have a bunch of Floridians.
We have a bunch of
Mr. Chairman.
Floridians, I know, so that's why I said Mr., we have both.
And
Male
it's,
and female Floridians, we gotta, all right, anyway, let's start his time over, I'm sorry. So Mr. Soto from Florida is recognized.
thank you, Mr. Chairman. I move to strike the last word, and here at 3 a.m., I have amazing news for you all. You don't need to kick 13.7 million Americans off of health care. I'm just going to repeat that. You don't need to do it. You don't need to kick 13.7 million Americans off of health care. Here's a little advice on reconciliation. We could see a real middle-class tax cut package with no major cuts to Americans' health care if you simply abandon tax cuts for billionaires and giant corporations. You could increase the standard deduction for families. You could increase the child tax credit for families. You could have no tax on tips or overtime or Social Security. You could extend the premium tax credit. Heck, you could even help out with SALT. And you could do all of that by simply rolling back the corporate tax rate to 2018 levels, or maybe even just a partial rollback. And then you could also roll back billionaire tax rates and the TOPS tax rate to 2018 levels, or maybe just a partial rollback. That would get you anywhere from $1.5 to $2 trillion. That would pay for all those things. And you wouldn't have to add $5 trillion to the debt in the process. It would actually reduce the deficit, which exploded, doubled, almost tripled after all that. And you certainly wouldn't have to be here tonight at 3 in the morning kicking 13.7 million Americans off their health care between Medicaid and the Affordable Care Act because of the extended premium tax credits that right now would lapse. And you would get a lot of support from Democrats for a true middle-class tax package. I think we might even get this unanimously because this is what we're for, an actual middle-class tax cut. But I get it, you're not going to follow my advice. And that tells our constituents all they need to know. They need to know you're making a choice and that this is mostly about billionaires and giant corporations and not about the middle class. Because if that happened, that bill would sail through this Congress in a bipartisan fashion. And I yield my time to the gentlelady from California, Ms. Barragan.
Thank you. I just want to show a chart. Just a little reminder of some of my colleagues whose constituents are relying on on Medicaid. You could see Colorado's 8th district, 25% of people are relying
Point
on
of order.
Medicaid. Yes, I've used this chart before. What's the
Sorry,
issue?
gentlemen, state your point of order.
Mr. Evans is named on the board, and he is in the room.
He's on the board, but I haven't said his name. I said the person who represents Colorado's 8th. I've used this chart before.
I think
Do
that's
do
one
you
of-
guys not want the people to know that a member of Congress in this room's
Gentlemen,
constituency
gentlemen,
represents
what rules
25%?
follow.
Then
It's
the
not a
point of-
rule that it can't be on a board.
The point of order is sustained. It's the same principle of saying their name or having it posted there. It's the same principle.
This is the most ridiculous double standard in a committee hearing ever. Because we have done this every single day for the last, I don't know how many years I've been on this committee. And it's totally ridiculous. And this is their way of trying to protect their members. In Colorado's 8th district, 25% of Medicaid recipients,
I'm sorry, just suspend. That's the poster that needs to come down.
it's not even on the screen.
I know, but it needs to come down. It was.
Okay, well, here, let me read it for the people. It's Colorado's 8th district is 25% of people relying on Medicaid. In Michigan's 10th, another member of Congress that's in the room, 24% of his constituents are on Medicaid, and Republicans don't want you to see the chart. They don't want you to see how many people rely upon
Mr.
Medicaid in
Chairman,
their
come
district.
on.
And let me tell you, those members, how many times have we heard those members speak up in this committee hearing? Speak up and say, I'm going to fight for my constituents. I'm going to fight for the Medicaid recipients, really. I mean, this is really something I've never experienced before, Mr. Chairman, where there's new rules all of a sudden that are being enforced when the other side has called out the president by name and this and that, and has allowed charts to be used before, and is now saying, no, you can't use charts? I mean, it is just so ridiculous. But let's go back to the facts. Let's go back to the focus here. It's astonishing to me. It really is astonishing to me that you have members who sit on this committee, which is the committee of jurisdiction, that is about to cut or shift. I'm going to use a Republican word, shift. That really means kicking off people off of Medicaid. That are in this room who represent a huge chunk of Medicaid recipients who haven't said a single word, who haven't said a peep about Medicaid. I mean, really? I would think you would be in here standing up for your constituents. But I can understand why it's so hard to defend what is happening. So let's go to one of my other charts. Let's go back to this one. Because maybe the Republicans who represent a huge chunk of the Medicaid community can take a lesson and a word from Senator Hawley and stop the slashing of health care benefits. Stop the slaughter, because that's what this is. It's going to be absolutely devastating. We have heard from constituents, we've heard from recipients. This is a lifeline for them. What else does the bill do? We haven't even talked about this one. They're kicking hungry people off of food benefits, low-income people off of food assistance. I mean, how do you defend that? Seriously. It's remarkable to me to see that to find places to cut, to give billionaires a tax cut, and we know they're going to be the beneficiaries, that this is what we're doing. Now, we keep hearing this word also of undocumented people getting Medicaid. And there is a prohibition against people that are undocumented getting Medicaid. But you know what Republicans are suggesting we do is, if you have a child that gets into a car accident and has to be rushed to an emergency room, that you say the doctor has to turn that person away and not give them any care and turn them away and not treat them. That's what they're saying. That's exactly what they're saying. Because you know why? Some of the numbers that are tied to undocumented folks is when they go to a hospital in the emergency room and they're being treated and the hospitals aren't going to turn them away. As a matter of fact, we have heard in the past Republicans have said that we should kick them out of school, we should not treat them medically. I mean, talk about the inhumanity. Where is the compassion? Where is the humanity? And by the way, if one of these people works for them, undocumented, it's okay. Then we're going to protect them. I remember when I was a freshman member of Congress, meeting with other members, and a Republican had confessed to me and other people that he helped get papers under the table for some undocumented person who worked in his home because they worked for him. I mean, the hypocrisy in this Congress is something that's just beyond comprehensible. And we've heard it today in this hearing. Don't be fooled. Don't believe what is being told. Check the CBO. They are kicking people off of Medicaid in the millions, and they're perfectly fine with it. I yield back.
Time has expired.
Mr. Chairman.
So first, we had so let me explain about, we have referred to each other, my friend from California. I've called you by name before, we've called each other by name. There was a point of order raised earlier, and I just want Mr. Griffith to, where that point of order comes from and why we're sustaining the point of order and not calling people by names who are in the room. That's how it, Mr. Griffith's going to read.
Well, Mr. Chairman, I was going to respond to the fact that it's somehow new. Actually, it's from Jefferson's Manual of Parliamentary Practice and Procedure. The rule of the House is almost identical. No person in speaking is to mention a member then present by his name, but to describe him by his seat in the House or who spoke last or on the other side of the question. Now, in the practice of the House, a member is not permitted, this is out of the notes, to address another member by name or to address a member in the second person. That was a Speaker Boehner ruling previously. This comes up from time to time. Now, Mr. Chairman, let me just say so that everybody understands, this is not something, and this is where we're all tired, and this is where sometimes people get excited. The chairman of the committee is not the referee and make calls on his own. This is like making an objection in court. The court, in this case, cannot rule sua sponte. The chairman has to have an objection. So when people get upset, well, you didn't call it on me, well, that's because no one raised the objection. When the objection is raised, however, this is the rule of the House. It is a longstanding rule. As I said, it goes back to Jefferson's Manual of Parliamentary Practice and Procedure. And unfortunately, we in the House have gotten sloppy. These rules are not to pick on one side or the other. They are made to make the House more efficient and to make the committee more efficient and to create a situation where we have comity, C-O-M-I-T-Y. I said that a few years ago and somebody thought I was talking about comedy, a joke. No, it's not a joke. But it's to make the situation a little less tense in tense situations, that you not refer to people by their name and as a part of the debate. And so that's the reason that I raised it earlier and then raised it again. So it's not to pick on anybody, it's to try to move things forward, but it is the chairman's job only to rule once an objection has been made, not to act as a referee and raise the issue sua sponte.
Well, thank you, and the ranking member's asked to have time since we had time. So
Mr. Chairman, I'm speaking on the point of order. Yes, in support, I think, of what you said. Look, I think that the gentlewoman from California, sitting there in the yellow, I think that
we have to use our names to figure out
I
who's
think
from
that she's
California.
made a good point, which is that in the past, we've never hesitated to call people by their name, their first name, their last name. I mean, I've called, I said August today, right? I mean, he's right, Mr. Griffin is right in saying that the rule says you can't do that. But I mean, understand, if we are now going to follow that rule, I will insist on it as well. And that means you can never mention the person's name, their first name, their last name, ever again, right? That's what he's saying. And I'm not arguing with Mr. Griffin that that's not the rule. The rule does say that. I just read it. But I mean, this is going to make it very difficult for us to operate if every time we mention a person by name, first name, last name, whatever, whether they co-sponsor the bill, whether they're the sponsor of the bill. I mean, like a lot of times we'll say, well, thank you. I want to thank the sponsor of the bill, Ms. Barragan, because she is the chief sponsor, the Democratic sponsor of the bill. I mean, if that's the path we're going down, I mean, that's fine, but I don't think it's a good idea. I think that in the past we've been very flexible and we've not insisted that we never call a member by name. So I would just hope, Mr. Chairman, that we don't start down that path, because it's going to be kind of crazy around here. And if you're going to call this as a point of order and say we can never call a person by their name, then I will do that every time, and you're going to have to figure it out. How are you going to identify somebody? You know,
Let's
the woman with the yellow dress. I mean, you know, what are we doing here?
All right, so we'll work through this as we move forward, but.
Can I ask a point of just clarification?
So let me just finish. So my understanding is it's in the debate, so I've been over careful with it too. So when I said gentleman from Texas, I had two people start speaking at the same time. You have to figure out how to sort that out. It says in debate, so if I'm saying today is Mr. Palmer's birthday, I think that's okay, but if I'm debating Mr. Palmer, I should call him the gentleman from Alabama. We'll work through that. I think we can
Mr. Chairman.
we can get it right. But I know the
If you'll
gentlelady
yield,
from
Mr.
California had a
Chair-
point of order.
If you'll yield, that's not what the rule says. And I would just say, I think that you and the ranking member should work it out.
We'll work it out.
Because what I believe, I think Mr. Griffith will agree with me, is what this, actually, he just said this, is this rule is designed to force comity. And I do think that we have gotten to, my view is we've gotten too casual in this committee in general. But however, I do think if the chairman were going to say, the gentlelady from California, Ms. Barragan, or the gentleman from Virginia, or whatever, I think you can be a little bit free with that. But if people are debating and they are accusing people by name of things, I think that's the intent of the rule. But you guys are going to have to work it out, because the plain language of the rule, as you say, is, I almost said your name. As the gentleman from Virginia says, the plain language of the rule says, no person in speaking is to mention a member then present by his name. So, there you go.
And Mr. Chairman, I would just say, at least in Jefferson's, it's specifically in the section on debate, which is why I think it only applies to debate. But you're correct, in the rules itself, it is not in that same order. But in Jefferson's, which is the basis of everything else that we do, it's in the section entitled Order in Debate.
Mr. Chair, can we go back to healthcare?
Can I ask my clarification question?
Yes, the gentlelady from California.
Are you saying it applies to somebody who's in the room? Or are you saying it applies to any member of Congress's name, even if they're not in the room?
So, Mr. Chairman, it applies to their name if they're in the room. In any member of Congress, you cannot say insulting words. To be brief, you can't use words that would tend to be insulting or incite. So if somebody's in the room...
Would you agree this fixes the problem? Because these members are not in the room, these names are out, and it's just now the district number?
I think that's accurate.
Just so everybody knows what we're talking about, no name is on it anymore, and now it just says Colorado.
We did let you continue when you had the names covered, if you remember. So
What's that?
So when the friend from New Jersey came and covered your letters, we let you continue with that up there. So yeah, we did let that happen. All right, so let's, do you have something on the point of order? Or are you ready to get back to healthcare? Okay, so the point of order, so it was Mr. Fulcher's turn, and then we'll come back to the other side. So the gentleman from Idaho.
Thank you, Mr. Chairman.
I'd like to yield my time to the gentleman from Georgia, not in debate, so Mr. Carter.
I thank the gentleman for yielding, and again, I want to bring up the fact that aside from just work requirements, aside from illegals on the program who shouldn't be on it, aside for those who are in duplicate states, there are a lot of other good things in this bill, including the doc fix, including PBM reform, something that this committee has worked on in a bipartisan way, and something that's going to save taxpayers billions of dollars. The Drug Price Transparency and Medicaid Act, which will ban spread pricing in Medicaid managed care programs, is included in this bill. It'll save nearly $3 billion. Look, when it comes down to it, we all want the same thing. Whether you're a Republican, a Democrat, or an independent, we want accessible, affordable, quality health care. And because of that, we need accessibility. Approximately 450 independent pharmacies closed in 1 year from June of 2023 to June of 2024. Many of you have heard that Rite Aid has announced it is filing for Chapter 11 again, and that it'll close or attempt to sell all its 1,200 pharmacies in the coming weeks. For independent pharmacies in 2023, Medicaid prescriptions made up an average of 20% of all prescriptions that were dispensed. So the good news is that pharmacists will be able to negotiate better terms in their contracts. Some of the most basic yet most life-sustaining medications are often under-reimbursed, and pharmacists are rarely paid for the actual cost to dispense. Another part of this bill is the Protecting Patients Against PBM Abuses Act, which will prohibit PBMs from being compensated for Medicare Part D covered drugs based on the manufacturer's list price. In other words, it delinks the price of the medication from the drug itself. This is good, and this will help to save taxpayers money as well. What is the problem? So I want to make sure we all understand that there are other parts of this bill. I keep hearing that you're only saving money, you're only having the savings through the work requirements and through the more frequent checking, but that's simply not true. There are other parts that are saving to this bill that are bipartisan in fashion, that are helping all of us, and that will make the program even better. It'll help to save the program, to sustain the program, and to make it better. And I'll yield back to the gentleman from Idaho.
Thank you, Mr. Chairman. I yield to the chair. Gentleman yields back. The chair recognizes the gentlelady from Washington, Dr. Schreier, for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I often get up at around 3 in the morning thinking about things, and so this is the perfect time for me to bring up several things I've been thinking about during this discussion. One of those is that there is not an exemption for people who just lost their jobs. And I've been thinking about this a lot lately because here we are, tariff wars, barreling toward a recession, people are losing their jobs. I think of rangers in my district. I think about people who work in small businesses. Maybe they do, they're machinists and rely on aluminum and steel. And, you know, if they lose their jobs, that feels like that's the one time in their life they're really gonna need Medicaid. And so I just wanted to bring that up, that this feels like it's also a penalty for people who, through no fault of their own or because of a recession, just lost their jobs. So I want you to consider that. The other issue that came up is that you know, the costs are ballooning for Medicaid. I just wanted to point out the same thing is happening for Medicare, and that one way to keep costs down is to prevent illness, treat people early, and it becomes less expensive, and that the ER is the most expensive place to take care of people. I also wanted to address this issue of, you know, I you may not want to kick people off of healthcare. This has come up a couple times, but I mean, I think you just have to look at the facts. Like, it might not be your intention, but the Georgia Budget and Policy Institute found that a cumbersome enrollment process and restrictive eligibility criteria contributed to the program's lack of success. 4,000 enrolled out of a projected 100,000. This led to significant costs and paperwork that disincentivizes people from applying. All right, I got that through. Next, workforce. My colleague from Texas pointed out, and he said that the biggest problem right now in healthcare is that there aren't enough providers. Now, I don't know that that's the biggest problem in healthcare, but it is a huge problem that we do not have a pipeline for new docs, and we have doctors who are retiring early or resigning. And in part, that's because of inadequate Medicare reimbursement and inadequate Medicaid reimbursement. But the thing is that, first of all, they don't want the fix in Medicare reimbursement if it is happening at a cost to their patients. Like, the trade-off of the patients who they care for, who they care about, losing their access to health care, that's not a trade most docs would want to make. Also, by the way, if you take Medicaid away from patients, then those doctors, because they adore their patients, are providing uncompensated care. Like, that actually brings their salaries down. So I just wanted to point out, like, if you really want to help here, one thing you could do is enhance Medicaid. In fact, I have a bill that would raise Medicaid reimbursement levels to match Medicare levels. That would allow more doctors to be able to see more Medicaid patients, to give more kids a medical home, to prevent illnesses, and to keep our emergency rooms from backing up. Okay, I'm looking down my list here to see if there are other things here. I found another one. Okay. I keep wondering, like, what are you gonna do with 13.7 million Americans who don't have insurance? Like, remember how upset we were in 2017 about the whole, like, repeal and replace of the Affordable Care Act? We were up in arms. They were taking health care away from people with pre-existing conditions, and they didn't have anything to replace it with, but at least it was repeal and replace. We just didn't know what the replace would be. This is repeal Affordable Care Act and slash Medicaid and have no plan. And so I want to emphasize, like, this is worse than we were dealing with the first time round, and that I believe that without a plan to cover those 13.7 million people, this is a very disingenuous argument and is directed at the wrong place. Thank you. I yield back.
Gentlelady yields back. The chair recognizes the gentleman from Texas, Mr. Crenshaw.
Thank you, Mr.
5
Chairman.
minutes.
I move to strike the last word. So it's almost 4 a.m., and I want to be clear. I think we got to talk some facts. That's why we're all here, right? Talk facts. And here's a fact. We're not here to cut the Medicaid lifeline for the neediest Americans. It's just a lie. And here's a basic principle.
We decided we weren't going to say lies, so.
We would like to take the words
Take
down.
my words down. I didn't say any of you were liars. I said it is a lie.
Mr. Chair, I thought we said we were not going to use
Well,
that.
hey, stop interrupting me. I reclaim my
Gentlemen,
time.
suspend. Hey, Mr. Crenshaw, we decided not to use the word lie, so we're not going to use that word. We decided.
Lie is a common word in the English language, and it's, okay. It is a falsehood perpetuated by people who perpetuate falsehoods. Now, here's the basic principle. Medicaid has to be preserved for the people it was meant to help. Children, mothers, seniors, Americans with disabilities. And our mission during this entire process has been very simple. Protect Medicaid for those who genuinely need it so that the program can actually survive in the long term. I want to clear some things up. Here's what Democrats claim, and then the facts they keep ignoring. Some might call these lies, but I won't. I'll just suggest that they are stating blatant falsehoods. Are you happy with that? Number one, Democrats say we're kicking poor people off Medicaid. Here's the reality. CBO numbers. 4.8 million of those numbers are from able-bodied adults choosing not to work. They're not being kicked off.
they're being told to work or volunteer or look for work. That directly contradicts what was just said by Ms. Schreier, by the way. 1.6 million are duplicative
Objection.
enrollees
Objection.
who are enrolled
Objection.
in 2 states at the same
Objection,
time.
he used a colleague's name.
I was just, what? I didn't hear, I'm sorry.
If I could roll 2 eyes, I
So
would.
we're not using the word lie, and we're not in debate using a colleague in the room's name, so if you did
These-
that,
these-
All right,
You're
let
in
me
the majority.
rephrase.
These
Let
are
me
your
rephrase.
rules.
It directly contradicts the statement that was just made by one of my colleagues on the other side of the aisle. Here's another number. 1.6 million are duplicative enrollees who are enrolled in 2 states at the same time. Here's another number. 1.2 million individuals, they're not even eligible for coverage in the first place, just according to the laws that we have. Another 1.4 million people are illegal immigrants. That's not exactly the narrative they've been spinning, is it? Number 2, Democrats say we're taking away substance abuse treatment. That is just false. This bill specifically exempts individuals with substance use disorders, full stop. Number 3, Democrats say we're cutting Medicaid. Here's the reality. An actual analysis by CBO Medicaid baseline projection shows Medicaid spending will still grow by 6.5% above 2021 projections, even after this $800 billion in savings. So let me ask you, how can one honestly claim we're cutting a program that is actually still growing? Just intellectually. How can you claim that? Asking for a friend. Number 4, Democrats say there aren't illegal aliens in Medicaid. Here's the reality. We know states are doing this. California uses a managed care organization tax scheme to shift costs to the federal government. That frees up about $5.2 billion in state funds. California then uses that money to pay for Medicaid coverage for illegal immigrants, skirting the federal ban. This bill closes the loophole by cutting federal funding by 10% for states that use Medicaid or other state-based programs to cover illegal immigrants. Vast majority of Americans would agree with that. Number 5, Democrats say we're causing steep state budget cuts by changing provider tax and state-directed payment rules. Here's the reality. State-directed payments in Medicaid managed care arrangements have actually grown by about 62% between February 2023 and August of 2024. These payments do have a place in supporting our hospitals. Texas uses them to support our most needy, but you have to have common sense. You can't let them grow out of control and let them grow indefinitely. All we're doing is freezing the provider tax and state-directed payments. That's it. It's a freeze. This will preserve payments for hospitals that need them. So guess what? Again, no cuts. The sky is not falling. Look, in summary, this bill is nothing like Democrats claim. Nothing. It's past 3 a.m., and I've watched my colleagues make false statement after false statement for the sole purpose of scaring the most vulnerable in our society. Democrats have forced disabled Medicaid recipients to travel to D.C. and crowd the committee room for nothing but cynical political theater. And my message to all of you who are tricked into being here, guess what? Your Medicaid benefits aren't at risk under this bill. Full stop. They're using you, and they're lying to you. Notice how...
Mr. Chairman, take it down. You need to educate your member. Come on.
Take my words down.
Well, don't.
I just want to point out one last thing.
Can you suspend? We agree we're not going to call each other out in debate or use.
Not
the word
that many
lie, so
synonyms
please
for the
honor
term
that.
lying.
Please honor
Mr.
that.
Chairman, you've already warned him. You need to take his words down.
Take him
You
down.
already warned him. He did it again. You
him
need to
down.
take his words down. I would like to get
committee
a
will
parliamentarian
suspend.
ruling on this.
Listen to
The
the
committee
lady
will
in the yellow
suspend.
You're disrespecting your chair.
And he said,
It's
take
his
my
ruling.
words down. He's being a jerk. Oh, my apologies. I didn't.
I withdraw the word lying. You happy? To all of you they brought here, they're using you and they're misrepresenting the truth to you.
And just suspend. The gentleman has withdrawn the word that was objectionable, and therefore he may proceed.
I just want to end with this. Notice how none of these measures can even be loosely interpreted as cuts, because they aren't. In sum, this is a serious evidence-based policy-making exercise. It's not heartless
We
austerity
had the clock
driving.
wrong when he was talking.
Protecting Medicaid for the truly needy. That's what we're doing.
All right, the
I
gentleman's
yield back.
time has expired. The gentlelady from Illinois is recognized for 5 minutes.
I'd like to yield my time to Ranking Member Pallone.
Well, thank you. I don't intend to, use any terms that people don't like here. I just want to talk about the reality because the gentleman from Texas talked about facts. And I think the facts are very different from what he described. If I'm a person that's on Medicaid now and I get kicked off, which is what the CBO says is going to happen to 8-something million and another 5 because you guys have not, because the Republicans have not reauthorized the subsidy, right, for enhanced Medicaid. I'm one of these 13 million people that all of a sudden I don't have Medicaid anymore. Okay. As far as I'm concerned, I don't have Medicaid. I don't have health insurance. You know, what do I do? And what is the impact of that on the rest of the public, right? I mean, or the hospitals, the nursing homes, whatever. I mean, the problem that you have here is you're reducing access to health care. If people do not have health insurance, they're not going to have access to health care for the most part. Maybe they can go to the emergency room, but they're going to stop seeing a doctor. You also have in this bill that certain people are going to have a $35 copay every time they go to the doctor, so that's going to reduce their access. And then also the quality of care is going to be reduced, right? Nobody has mentioned yet, maybe somebody did, I don't remember tonight, about getting rid of the nurse staffing rule. I mean, the Republicans have actually touted that that's such a great thing. It's not, because it means that the services at the nursing home are going to be worse because you don't have the nurse at night, or you don't have a nurse or enough nurses during the day. So I wish, you know, I wish my Republican colleagues wouldn't just keep talking about numbers, wouldn't keep talking about who's being kicked off. The bottom line is that if I'm one of these 13 million people who no longer has health insurance, or I'm one of these people that can't afford the copay, even if I have Medicaid, or I'm one of these people that maybe didn't get kicked out of the nursing home, but is going to have terrible care, maybe, you know, develop bed sores, and I'm going to die sooner than I normally should, I'm impacted. And that's what I don't understand here. We can talk all you want about whether you're kicked off or not, or, you know, whether you're trimmed or cut or whatever, but you can't get away from the fact that there's going to be 13 million people who are no longer have the coverage. There's going to be a lot more people that are going to not see a doctor because they have to pay $35 every time they go. A lot more people who are going to suffer because they're in a really crappy nursing home because the services that are provided can't be provided, you know, without the nurses or whoever, you know, is going to be staffing the place. And we as Democrats feel very strongly that our goal here is to provide people with care. Make sure they have health insurance. Make sure that it's affordable for them to go to the doctor. Make sure that they have quality care when they're at a nursing home. And that's what's lacking here. That's what I don't understand. You, for some reason, believe that with all this red tape and everything, and all these restrictions on enrollment, and all these copays, and all these eliminations of requirements like nursing homes, like nurses at a nursing home, that somehow things are going to be all right. But they're not. They're not going to be all right, because a lot of people who are eligible and would normally qualify based on what the CBO is telling us are going to get kicked off, who really do qualify, who actually are working, who actually meet your criteria, but somehow because of the paperwork can't file the thing that says, or can't figure out how to go about this. That's what the CBO is saying. And I know it's late, and I know that the gentleman from Texas, wants to talk about the facts. Those are the facts. That's why CBO is saying all these people are losing care. That's why we're here. That's why we care. We don't want services to disappear. We don't want people to not see a doctor. We don't want people not to have health insurance. And that is what you're effectuating here. No matter what you think otherwise, that is what's going to happen. And I think it's a very sad thing. And there's no way you're going to convince me that these things are not going to happen. They are. If you pass this bill 6 months from now, a year from now, those people are going to be calling our office and say, I don't have health insurance, I can't see a doctor, and my services at the nursing home stink. That's the reality. Those are the facts. I yield back, Mr. Chairman.
Gentleman yields back. I think it's from the gentleman from The gentleman from Alabama is recognized. Gentleman from Oregon, you'll be next, after you'll be the next Republican. Gentleman from Alabama is recognized for 5 minutes for the amendment.
Thank you, Mr. Chairman. I will do my very best to stay within the safe space that's been created in here so we don't offend anybody. Reminds me of some of what's going on at some of our college campuses, creating a little safe space for everybody. But I do want to address some things. One is on the work aspect, aspect about this. And again, listening to what's been cited tonight, the 13 million people are going to lose their health care. Even the New York Times has said that's a false number. And but you can keep using it. I'm fine with that because I think we know how this is going to come out. But healthcare and work are integrally linked in this country. I mean, talk to any healthcare professional you want to, and they'll tell you that people who work generally have better health than people who don't. Half of all Americans get their insurance through their employer. Seniors get their Medicare because they worked and paid into the system, and our service members and veterans get their health care because of their work to serve our country. Most of the Medicaid population, whether it's children or seniors or people with disabilities, it doesn't make sense to have any sort of work requirement for them, and we don't. But the interesting thing is that my colleagues keep saying that only 8% of able-bodied adults who are getting Medicaid, that these are able-bodied adults with no dependents, are not working. Well, the unemployment rate for people with disabilities is only 7.5%. So you've got people with disabilities who won't work. There are groups out there advocating for their right to work, yet my colleagues across the aisle are defending able-bodied adults with no dependents who refuse to work and want people who are working paying taxes to pay for it. That doesn't make sense. If you're able-bodied and you don't have dependents, then you should be working or looking for a job or volunteering, contributing something to your community and to society. Our colleagues want to portray this as some kind of cruel policy because they believe people shouldn't have to work to pay into the welfare systems or that we should encourage people to move out of poverty. I think that's, we get caught up in this whole issue of what all this costs, and we don't think about what it's costing us in terms of the quality of life, because we've got so many people with great talent, great ability that we're denied their creativity and their intellect because they're trapped in this system. We talk about welfare reform in the 90s under President Clinton. There was a bipartisan consensus that people who could work should be working as a condition of receiving federal assistance under SNAP and TANF. Now, those who don't know their history would just hear this and say, sure, we agreed on work requirements for those programs, but not Medicaid. Well, the thing is, Medicaid today is different from what Medicaid was in the 90s. At the time, there was no need to add in work requirements to Medicaid because Medicaid only covered the most vulnerable: children, pregnant women, seniors, and people with disabilities. 20 years later, Democrats under President Obama changed the very nature of the Medicaid program and the relationship that we have between work and federal benefits by expanding Medicaid to cover all low-income Americans, regardless of whether they work or not. It's time that we restore that linkage between work and health care. And to those saying that this is unnecessary because Medicaid beneficiaries are already working, I say, great, let's prove it. You shouldn't have any objections to work requirements if you think the 92% of the able-bodied adults with no dependents are already working. I also want to point out something else, and that is, you talk about cuts. When you passed the so-called Inflation Reduction Act, I called it the Income Reduction Act, you set up enhanced premium tax credits would expire this year. And I have to wonder why you would self-impose a cut on that yourself. You put billions of dollars into the Green New Deal agenda. You set up this Green New Deal bank at the EPA, but you set up the enhanced premium tax credits to expire. So, I think there's a lot of things that have been misrepresented here, but the most important thing here, Mr. Chairman, is that we've lost sight of the value of work. My time has expired. I yield back.
The gentleman yields back. The chair recognizes the gentlelady from Virginia for 5 minutes.
Thank you, Mr. Chair.
I stayed in their safe space.
A lot of the discussion tonight has been over how this bill is supposedly going to help sustain Medicaid long-term. And there's been a lot of talk about costs going up, but we haven't addressed the reason the costs have gone up. And this bill does nothing to address the reasons the costs have gone up. Over 50% of the costs are spent on the Medicaid population of seniors and individuals with disabilities. And it's because they have more complex healthcare needs.
They didn't take me on this.
A lot of it is tied up in prescription drug costs,
Stayed in their safe space.
the chronic diseases that they have. They're more expensive to treat. And yet the so-called savings from this bill are not being invested to bring down the costs of long-term care or to bring down the costs in a meaningful way of prescription drugs or to invest in the healthcare workforce at large. It's these little piecemeal, I don't even know what to call them because they're not fixes. It's like piecemeal Band-Aids
Just took care of it.
that ignore that the reason the cost of Medicaid are going up are the same reasons that the cost of health care is going up. Because of an aging population with chronic diseases. And what Medicaid expansion and the Affordable Care Act were designed to do was recognize when you have insurance, you are more likely to be connected to a medical home where you get preventative care, to stay healthy, to avoid chronic illnesses, or to get treatment early, to not have your primary care provider be the emergency room, because all of those things increase the cost for everybody else. And so I would take my colleagues at the other side of the aisle at their word when they say, well, we're just trying to make Medicaid more sustainable. If we were doing this in a bill that holistically looked at the costs of Medicaid and the cost of health care, but that's not where we are. We're doing this in the context of a reconciliation bill where congressional Republicans passed a budget plan that said to this committee, find $880 billion in cuts, not to reinvest in other programs under your jurisdiction, but to pay for tax cuts. And this bill is not being done in a vacuum. But against the backdrop of everything the Trump administration has done to cut the federal workforce, which impacts states like Virginia and their income, which shifts other costs to the states, which ties their hands on their ability to raise funds to pay for their increased share of Medicaid under this bill, while they're trying to pay the costs of every other action of the Trump administration, where you have a research hospital that's facing devastating cuts to NIH funding grants. At the same time, they're the largest Medicaid provider in the region. And I think we're losing sight of who is suffering from our inability to look at the big picture and try to tackle the problem with rising healthcare costs holistically are people who just want to know, if I get sick, I can go to the doctor and not go bankrupt. Who just want to know, if I need to get preventative care, I can. And want to know, if I've lived in my house, if my mother has lived in her house for 50 years, paid $45,000 for it, and then needs to go into long-term care, she's not forced to sell that house. because it's now $1 million. And we're losing sight of these people in these, back and forth arguments at 4 o'clock in the morning or whatever time it is, and not looking at the big picture of how do we comprehensively tackle the cost of
Gentlelady's time has
And I
expired.
yield back.
Chair recognizes the gentleman from Oregon, Mr. Oregon,
Mr. Oregon. Yeah.
for 5 minutes.
Thank you, Mr. Chair, and move to strike the last word.
Without objection.
Thank you. So Medicaid is an essential and necessary program. I should know because 40% of my constituency is on Medicaid. And the reason partially that we have that many folks in Oregon in my district on Medicaid is because of, I'll call them liberal policies. We can't get back into the woods where the jobs are so that we could drive down poverty in one of the most poverty-stricken spaces in the United States. We can't get into the mines. We can't get into where water is. So guess what? People are broke. They don't have the jobs they used to have. So, all right, fine, 40% on Medicaid, an essential, necessary program. If you go back and look at the history, by the way, I think this bill should be called the Accountability Bill, because what it's striving to do is make groups accountable for the billions and billions of dollars that we're spending. So accountability, let's go back to 1967 when Lyndon Johnson was trying to pass Medicaid. He and Congress back then imposed criteria, eligibility criteria. You couldn't just everybody get on the program, no. It was the aged, the pregnant, the children, the disabled. From day one, there were criteria that had to be met, from day one. So why would anyone complain that we've heard over and over again about us suddenly here in this many, many years later, demanding that people actually meet the standards established so long ago? What happened? Did accountability go away? It shouldn't. This program is costing us literally billions and billions and billions of dollars. And if we want to continue to have any chance of maintaining this essential and necessary program, we better make sure that those who are utilizing it actually meet the criteria established so long ago. Why would people object? And that accountability goes across the board. There's been so much said tonight, it's hard to pick out any one thing to address, but something that I've heard over and over again is it's all about the billionaires. It's not. The Tax Cut and Jobs Act, if it were to expire, the National Taxpayers Union projects that upwards 6 million jobs would be lost, along with $500 billion in lost wages and upwards of $1 trillion in economic growth. The only way we're able to keep doing what we're doing is because there's taxes being paid. And while we're talking about that, let me bring up a really inconvenient fact for a lot of the folks on the other side of the aisle. The top 10%, you know, those billionaires, pay 70% of the taxes. The top 10% pay 70% of the taxes. Okay, what are we going to do if we run those folks off by raising their taxes, as we heard over and over again? Who's going to pay that 70%? By the way, we also heard over and over again about the 5 million, excuse me, the 8 million people that are going to be affected, and then there's been reference to another 5 million under the AC enhanced credits. The AC enhanced credits, it's actually 3.8 million, but there tends to be some exaggeration. I would just want to say about the enhanced credits, those came up in 2021. They were added on to an already existing credit program. That's why they're called enhanced credits. They cost about $335 billion over the next 10 years if they're renewed. What happened? Just in 2021, just what, 4 years ago? That a new feature was added in, and suddenly the Democrats suggest that it has to be permanent. Why? What is this? A ratchet that just goes one way? We can, once having done it, we can never go back? Please, but that's not what we're talking about tonight. Tonight we're talking about a bill that involves 8 million out of the 70 million people that are on this essential and necessary program. We're talking about 8 million people out of the 70 million people. But if you listen to these folks over here, You would think it's all 70 million. It's not. We're talking about 8 million, and of those, as we already heard from the gentleman from Texas, many don't belong on there at all. So why in the world wouldn't we be extraordinarily cautious in how we extend this benefit? And by the way, a work requirement for those who are able, for the $9,000 a year it costs for them to be on that program, I think that's too much to ask. That they at least try to get a job or they volunteer. Come on. So what irks me is that the same tactics used years ago are being used now. Metascare was called 30 years ago. I wish we could stop doing that. It's not
Gentleman's
right to scare
time
people.
has
I yield back.
expired. Gentleman yields back. Does anyone else seek recognition to speak on the bill? The gentlelady from Texas is recognized for 5 minutes.
Well, thank you, Mr. Chairman, and I will try to be brief. I know it's late and I know we have a lot of ground to cover, but I've been listening to the debate on this amendment, and I just heard my colleague from Oregon giving a history lesson with some inaccuracies, starting with the creation of Medicaid in 1965. President Lyndon Johnson, a great Texan, who signed that bill into law with the Congress. But what we are missing here as we talk about this, my friends on the other side of the aisle and some of my friends from Texas who are not in this room seem to want to take us back to a golden age of Medicaid as though we haven't amended this bill in the past, as though the ACA didn't happen 15 years ago. And we keep talking about what was intended and what happened in 1965, but Congress amended this in the late 1980s to include pregnancy, pregnant women, right? That there are all sorts of complications in how this has actually been administered and worked over the years, but we had 1965, we had amendments in the 80s, we had the Affordable Care Act 15 years ago, right? And then we expanded it again. And so I don't understand why we are continuing to talk as though there's only one thing and it's only the original bill, because the American people do not want to repeal the Affordable Care Act. I thought we learned that lesson back in 2017. And what it seems like we're trying to do here is ignore the Affordable Care Act or act like it wasn't passed by this Congress, signed into law, and it hasn't been the law for the last 15 years. And what we've said is everything my colleagues have said before about it is better to get people health care coverage, it's better to get into the doctor before you have to go to the emergency room, that it makes sense to expand this program so that people can get affordable health care. And, you know, I heard a lot of the conversation, and I'm sure it was irksome to some folks in the room about where various states, you know, rank vis-a-vis others in terms of coverage. Well, I can tell you that I love my home state, but we are dead last when it comes to, or I guess we're first when it comes to having the most uninsured people in our state, in the country. And so we should all be trying to help people get access to affordable care. That's what the Affordable Care Act was. And the American people like it. Our state hasn't expanded it, but other states have. And that is the law. That is what we're talking about. And so this you know, make Medicaid great again kind of message that we're getting today is just really ignores the history of this program and where we are in this moment. And so I could talk about a lot of other things, but we got a lot more amendments to get through, so I'm going to yield back now.
The gentlewoman yield?
Yeah, I'll yield my time to Mr. Menendez, to my friend from New Jersey.
Thank you, I appreciate it. And I know it's late and we still have so much more to cover, but at 4 a.m. you don't want things to sneak between the cracks. So our colleague from Oregon said what would happen if the Trump tax credits from 2017 were to expire. I believe he cited a study or a report by the National Taxpayers Union, which, as we know, is a conservative taxpayer organization that was founded by James Dale Davidson. Quickly about James Dale Davidson, he wrote a book called The Plague of the Black Debt: How to Survive the Coming Depression in 1993, in which he predicted, similar to the organization's predictions of what would happen if the Trump tax cuts were to expire, that Clinton is going to be a one-term president. I am as sure of this as I am that the sun will rise tomorrow, and that the U.S. national debt would increase by $1 trillion during Clinton's one-term presidency. As we all know, at the end of President Clinton's 2 terms as president was the last time we had a balanced budget and a surplus, which George W. Bush blew up shortly thereafter. So I yield back.
Thank you, Mr. Menendez, and I yield back, Mr.
The
Chairman.
gentlelady yields. Any other member wish to be recognized? Hearing none, there's no further discussion. The vote occurs on the amendment. The gentleman has requested a recorded vote. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia.
No.
Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Miller Meeks. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Benz. Mr. Benz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Ruley votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone.
Aye.
Mr. Pallone votes aye. Ms. DeGette. Aye. Ms. DeGette votes aye. Ms. Schakowsky. Aye. Ms. Schakowsky votes aye. Ms. Matsui. Aye. Ms. Matsui votes aye. Ms. Castor. Aye. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Strahan. Ms. Strahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mrs. Harshbarger is not recorded. Mrs. Harshbarger votes no. Ms. Miller Meeks is not recorded. Ms. Miller Meeks votes no. Mrs. Kamick is not recorded. Mrs. Kamick votes no. Mr. Fry is not recorded. Mr. Fry votes no. Dr. Ruiz is not recorded. Dr. Ruiz votes aye. Mr. Chairman, on that vote, there were 24 ayes and 29 noes.
The amendment is not agreed to. Are there further amendments? For what purpose does the gentlelady from Florida seek recognition?
I have an amendment at the desk. It is,
Can you give us the number of the amendment, please?
yes, sir. It's the Castor Amendment 47.
Mr. Chairman, can the gentlelady please read the
It's,
number of the amendment?
excuse me. It is 47, Health, FCD, AMD 047.
Can you repeat that, please?
Yes, it is Health, FCD, AMD 047.
Do we have it yet? We don't have it yet.
Okay. All right, I'll wait till it's actually.
Okay, does any other member have an amendment?
Mr. Beasley, are you ready? All right, Beasley.
For what purpose does the gentleman from Texas seek recognition?
Mr. Chairman, I have an amendment at the desk.
What's the number on the amendment, sir?
The number on the amendment, sir, is AMD 046.
You got it?
Mr. Chairman, I don't have that amendment at the desk.
Okay, does any member have an amendment that we have? The chair recognizes the gentleman from New Jersey.
I have an amendment at the desk.
And the number on the amendment?
Health-FCD-AMD_222.
The clerk will report the amendment.
Health-FCD-AMD_222. Amendment offered by Mr. Menendez. Add at the following.
Without objection, reading of the amendment is dispensed with, and the
Mr. Chairman-
gentleman is recognized for
Mr.
5
Chairman,
minutes.
If I could reserve.
Before the gentleman is recognized, the gentleman from Virginia reserves.
Yes, sir. Reserve. Point of order.
Now, the gentleman from New Jersey is recognized for 5 minutes to speak on the amendment.
Thank you, Chairman. My amendment is straightforward. It would prohibit this bill from going into effect if any of the provisions result in the deaths of individuals stemming from reduced access to health care services. To put it simply for my colleagues, having health care coverage saves lives. But their bill will leave millions of people without access to health insurance and life-saving health services and medications. And despite President Trump promising that he will not cut Medicaid, this bill includes the largest cuts to the Medicaid program. And the $715 billion in cuts on the table translates to 8.6 million Americans losing their health care coverage. In other words, policies in this bill will result in a catastrophic benefit cuts and millions of people losing their health care. This includes low-income children, people with disabilities, pregnant and postpartum women, caregivers, veterans, and older adults in long-term care. The data is clear. Uninsured people are sicker and die earlier than people who have insurance, and policies like Medicaid expansion lead to reductions in mortality rates. And now my Republican colleagues want to move backwards from this progress by rushing to gut Medicaid and take away coverage from millions of people to pay for tax breaks that only benefit the wealthy and big corporations. It is a betrayal of the people who sent us here to act in their best interest, and thank you to the people who are still here. We appreciate you being here. In my home state of New Jersey, Dominique has had sickle cell disease since she was 6 years old. She has spent much of her time in hospitals and doctors' offices to receive care. Through her Medicaid coverage, she is able to see a hematologist regularly to treat her condition, acquire necessary medical equipment, and receive treatment for any potential medical emergencies. In her own words, Dominique says that without Medicaid, I probably wouldn't be alive because I wouldn't have been able to afford the medicine. The Republican bill would terminate health insurance for individuals like Dominique. My amendment aims to protect people like Dominique by preventing this grossly misguided bill from going into effect if any of the policies result in deaths of Americans, something we should all be advocating for. And for all of the Republicans claiming that this bill will only eliminate so-called, quote, fraud, waste, and abuse, my amendment puts their claims to the test. If the Republicans truly believe that these Medicaid cuts are simply to root out fraud, waste, and abuse, this amendment should be an easy yes vote. My amendment is extremely common sense. No law should result in more deaths and less access to life-saving care. I urge my Republican colleagues to support this simple amendment. I yield back.
The gentleman yields. Is there further discussion on the amendment? The chair recognizes the chair from Kentucky.
Thank you,
for 5
Mr.
minutes.
Chair. I just want to say, I share my colleague's interest. Boy, nobody here wants anybody to pass away. And that's why this bill would ensure we're doing just that. So this bill would repeal the Biden administration's nursing home minimum staffing rule, which, according to CMS's own estimates, 80% of current nursing homes in the country would be unable to find enough staff to meet these rule requirements, meaning facilities will likely reduce their patient intake or they'll close entirely. More seniors will die if nursing homes close and they have nowhere to go for long-term care. More seniors will die in hospitals as they wait to be discharged to a facility for post-acute care. This top-down mandate will exacerbate provider shortages, increase cost, and put the nation's most vulnerable at increased risk. And this is why we're repealing the rule, and that's why I urge my colleagues to reject this amendment, and I yield back.
The gentleman yields. Any further discussion on this amendment? The chair recognizes the gentlelady from California for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Objection?
It's 4:30 in the morning, and we've been debating the finer points of this bill for hours now, and we will keep doing so. But I want to bring this back to the people that matter the most, the constituents we're fighting for. Because let's be clear, whether we're talking about work requirements, massive cuts to state budgets, or anything else in the hundreds of pages of this bill, this will strip health care from millions of hardworking Americans. It will rob people of their fighting chance against illnesses like cancer. People like one of my constituents, Denise. Denise is a breast cancer survivor and an amazing advocate. She was brave enough to share her story in the hopes that no one would have to fight the battles she did without support. In her words, Denise had had to fight all her life for everything. As one of 5 siblings, she started working at the age of 13 to help support her family. She put herself through college, met her husband, and became a proud mother of 2. Then tragedy struck her family. Denise's husband was diagnosed with a rare and aggressive brain cancer. Denise stood by him through it all, through the pain, the treatment, and ultimately his passing. Losing him meant not only heartbreak, but loss of one of her family's sources of income. That's when Denise became eligible for Medicaid. Then came another blow. Denise found a lump in her breast. Because of Medicaid, She got care immediately and was diagnosed with breast cancer. Because of Medicaid, Denise says, she was able to take on this battle. She fought to be here for her children because she didn't want her kids to lose two parents to cancer. Denise told me, "I'm excited to say I am a survivor of breast cancer by the help of Medicaid." Denise is a fighter and a survivor, like many Americans. She's worked her whole life, and when she fell on hard times, she has support to help her get back on her feet. Yet my Republican colleagues would say Denise isn't someone who truly needs Medicaid. Let's be clear. Denise is alive today, thanks to the Affordable Care Act Medicaid expansion. Denise's children aren't orphans today because of the Affordable Care Act Medicaid expansion. Without Medicaid, Denise might have put off the care she needed. Uninsured people are almost 3 times more likely to skip necessary care because it's too expensive. For cancer patients, delay could be deadly. Republicans can try to spin it, but the truth is, the bill before us is a death sentence for patients like Denise. If they succeed in pushing this cruel bill, millions of Americans will not survive their cancer diagnosis. So I'm grateful to my colleague for introducing this important amendment. If Republicans are confident that their bill won't cause more cancer patients to die, this should be a simple yes vote. I yield back.
The gentlelady yields. Are there any other members seeking to speak on this bill? The chair recognizes the gentleman from Texas for 5 minutes.
I move to strike the last word and support this amendment.
Without objection?
$884 billion. That's what this poster signifies here. These are the VIPs that had VIP seating at President Trump's inauguration. These are the billionaires that he prioritizes at every turn, kind of like that big old jet. $880 billion. That's how much Republicans are gutting from this Medicaid in this bill. I want everybody to just think about that for a second. Republicans are stealing health coverage from 14 million Americans so that Trump's buddies can get another tax break. That's the trade-off, working Americans for these guys. That's why this Menendez amendment is so important, because it says that if any part of this bill increases mortality or reduces access to care, then those provisions won't take effect. That's not radical. That's common sense. And make no mistake, without this amendment, we already know what will happen. More people are going to die. More people are going to lose coverage. Millions are going to lose coverage. And communities like the ones that I represent and members on this committee, on both the Democratic and Republican side represent, are going to suffer. Take 76104. It's not just any zip code in Fort Worth. It has the highest maternal mortality rate in the entire country. And this bill will only make that worse. Why? Because Medicaid isn't just a line item in the budget. It's the difference between life and death for moms in the district that I represent. There are some amazing providers in the DFW area, Parkland, many others, and they are doing amazing work. They're offering wraparound care to pregnant and postpartum women, most of whom rely on Medicaid. And so let me tell you what that care looks like. At the North Texas CHC, they're educating moms on how to have a healthy pregnancy. They teach them what warning signs to watch for, like severe headaches, shortness of breath, so they know what to do when it's time to go to the hospital. They do car seat inspections. They provide a baby pantry for moms who don't have enough food or diapers. They follow moms closely after birth, especially those having serious health conditions. And here's something we don't say enough. The most dangerous time for a new mother is often right after the baby is born. That is when complications strike. That's when lives are lost. But here's the catch. These organizations are already stretched thin. I think that everybody in here knows that. So if 14 million people lose coverage, That means more uncompensated care at places like Parkland and John Peter Smith Hospital. That means fewer resources, and that means these providers will be forced to scale back, and moms in the district will pay. And they've told me directly, we will have no choice but to cut back services if this bill passes. Those are providers in Fort Worth and in Dallas. And so, yes, this bill has a direct line to maternal deaths in the district that I represent. It puts lives at risk to give $880 billion back to these guys. These guys don't need that money back. It's just bad policy. It's cruel, and we should be finding ways to strengthen Medicaid, to expand postpartum coverage, to invest in community care, not taking a sledgehammer to the very systems that are saving lives. And so I ask my colleagues, if you're not willing to vote for this amendment, if you're okay this is going to increase mortality, then just say that, because moms are dying. And we don't need for moms to die. We need for moms to be around to take care of their kids, because that, and by taking away their health care, we are definitely increasing maternal mortality, and that's something that we don't need. And so I urge every member here to support the Menendez amendment, and let's not add death to the cost of this legislation. I yield back.
The gentleman yields back. Does any other member seek recognition on this bill? The chair recognizes the gentleman from New York, Mr. New York, for 5 minutes.
Thank you, Mr. Chair. I move to strike the last word.
Without objection.
I'm speaking in support of this amendment today on behalf of all of the constituents in my district who have benefited from Medicaid, including Susan and Aria. I hold here a photo of Aria. Susan Miller is the mother of Aria, a young child with cerebral palsy, cortical visual impairment, and epilepsy. Aria is tube-fed, so Medicaid covers all of her formula and supplies, not to mention her medications for her epilepsy. Aria attends the Kevin G. Langan School in Albany, New York. Susan shared that by attending school through the Center for Disabilities, Aria has accomplished so much when they thought she would not. She is standing with help and starting to take steps and saying words and learning. She even participated in the Special Olympics last September. Susan shared, Medicaid is my child's lifeline. Please don't endanger my baby's life. Please do not cut Medicaid. There are so many children and seniors that need this to survive. Medicaid and all of the programs make life possible for their special needs and give them the life they deserve. I've been so scared and reached out and keep doing what I can, for I am her voice. This is important for my child's survival and so many others like her. Some may belittle Susan's fears and argue that they aren't cutting Medicaid for families like hers. Republicans falsely claim that children like Aria and children like Isla won't be impacted by their package, but I've read the text and that's simply not true. New York State stands to lose billions of dollars in cuts to Medicaid from the reduced federal match, the provider tax provisions, and more senseless provisions in this cruel package. When states have to make these massive cuts to their Medicaid programs, where do you think they're going to look first? To the most expensive patients, the elderly, the sick, and the disabled, to the very people that my Republican colleagues claim they are trying to protect. I urge all of my colleagues to support this vital amendment. Let's get back to providing health care and life-changing services for children like Aria. With that, Mr. Chair, I yield back.
The gentleman yields. Does any other member seek recognition? The gentleman recognizes, the chair recognizes the gentleman from California for 5 minutes.
Thank you, Mr. Chairman. This amendment talks about how people who are uninsured go without care. Going without care exacerbates whatever illness or chronic illness they have that could increase their risk of dying. And that's what this bill puts at risk, many people's lives. Let me highlight this story of a nurse who has diabetes. Stephen Jaime of El Centro is a registered nurse and caregiver for his daughter, Olivia. Nurse Stephen at El Centro Regional Medical Center Outpatient Clinic struggles to obtain insulin for himself and his daughter through private insurance. Stephen and his wife serve as caregivers for their daughter and have only a week's supply of insulin left before they run out. Quote, even with insurance, in my experience, there's so much that insurance will not cover for the cost of insulin pumps. The pumps work to provide the need, and sometimes the need is higher than what insurance or Medicare or Medicaid is willing to cover, unquote. He has contacted his daughter about increasing his insulin, and while the doctor agrees, insurance companies deny coverage. Stephen runs the only diabetes education program in Imperial County, recognized by the American Diabetes Association. As a healthcare advisor, he witnesses firsthand how patients must wait until their conditions worsen to meet specific healthcare criteria. He is extremely concerned about the impacts of Medicaid reductions on his patients. In fact, the Diabetes Patient Advocacy Coalition states that the budget resolution will likely lead to cuts to the safety net Medicaid program, which provides health insurance to almost 80 million low-income Americans. This action would disproportionately impact Americans most in need, including those with diabetes and other chronic conditions who rely on Medicaid to access the medications and technology they need to manage their conditions. So to break it down to real-life examples, let's say a Medicaid expansion patient who has found it very difficult to keep up or navigate the system for the work requirements and decides that he just gives up, goes without the Medicaid coverage and goes without the checkups, the follow-ups, the insulin, the medication for his diabetes. He has chronic hyperglycemia. He starts to develop neuropathy, blindness, other comorbidities. Eventually, he falls into a diabetic coma and he is rushed to the emergency department. Those are real stories, stories that I have of patients that I have taken care of who have gone without health insurance, therefore health care, and whose conditions exacerbated into an emergency where now they're being rushed into the emergency department. And in some cases, with patients that require antihypertensive medications or require medications to help treat their congestive heart failure and they don't have any, they come in gasping for respiratory failure and sometimes even in cardiac failure as well. And so sometimes most of the time we can resuscitate them, but sometimes we can't. And we pronounce them dead in the emergency department. That's a real life experience in the emergency department with patients who go without insurance, go without health care. And that's what this bill is intended to do, is to protect those people, is to protect the millions of Americans as part of those 13.7 million that are not going to have health insurance moving forward, to protect them from ending up in the emergency department and possibly dead because they couldn't get their medications, they couldn't get their health care. So that's why I urge everybody to vote yes on this amendment, and I yield back.
The gentleman yields. Does any other member seek recognition? Chair recognizes the gentlelady from Washington for 5 minutes.
Thank you. Thank you, Mr. Chairman. I wasn't planning to speak on this particular amendment, but I was listening to Dr. Ruiz speaking, and he was talking about diabetes and the importance of care. And I wanted to tell you, I got a letter from a doctor in a rural part of my district. She is the only endocrinologist in town, I believe. And she had been practicing there since 2009. So she had some time practicing before the Affordable Care Act went into effect. And at that time in her practice, said 80% of her patients had diabetes, 50% of them had type 1 diabetes. After the Affordable Care Act fully went into effect a few years later, and many more adults were able to enroll in Medicaid, she saw many new patients with type 1 diabetes seemingly coming out of the woodwork. These were not new diagnoses. Instead, these were adults with type 1 who had never had insurance as adults and had been surviving for years by purchasing over-the-counter insulin called NPH or regular without a prescription. They had been getting by barely, and many had already developed permanent complications because of inadequate care. Well, after the Affordable Care Act, they had insurance for the first time in their adult lives. She could get them started on better treatment with newer insulins, insulin pumps, continuous glucose sensors. For her patients who have Medicaid, which is most of them, she can get them started very quickly on the best treatments with insulin pumps and continuous glucose monitors and diabetes educators, which just helps them manage their diagnosis optimally and live their best lives. For her patients who have Medicaid as their payer, who have developed new onset diabetes since the rollout of the Affordable Care Act, they are better overall because they've had good care all along. So she wanted me to emphasize to you that if Medicaid takes coverage away for these patients, it'll be like going back to the dark ages in terms of treatment. For adults with type 1 diabetes, before the Affordable Care Act, not having insurance meant trying to survive when there were treatments available, but they were out of reach due to not having insurance. Pumps are expensive, I can tell you that firsthand. Continuous glucose monitors are expensive, I can tell you that firsthand. And if you're paying the cash price for insulin, that is expensive, I can tell you that firsthand. So to take away Medicaid from these individuals would be truly inhumane and will lead to worse health outcomes and ultimately much more of a financial and social burden for the country when you have to pay for people suffering with long-term complications that were preventable. And with that, I yield back.
Gentlelady yields. Are there other members seeking recognition? Chair recognizes the gentleman from Louisiana for 5 minutes.
Thank you. Thank you, Mr. Chairman. I yield to my good friend from New Jersey.
Thank you. I appreciate the gentleman from Louisiana yielding. And I appreciate all my colleagues on the Democratic side of the aisle lifting up stories from their districts from across the country about what these cuts would do to so many vulnerable Americans. And I also appreciate my colleague from Kentucky speaking on the amendment, although his point was really focused on the moratorium on implementation of rule relating to staffing standards for long-term care facilities under the Medicare and Medicaid programs, and in his view, what those staffing requirements would do in terms of the operation of long-term care facilities and seniors that rely on them. I would just note two things. One, this amendment's broader than that, and it ensures to the American people that the bill would not go into effect if any of the provisions result in the deaths of individuals stemming from reduced access to health care services. So if the bill were to pass along a party line vote, Section 44121, the moratorium on staffing standards for long-term care facilities would be part of the bill, which I believe would alleviate the concern that you have with the rule as it is. So I was just curious if my colleague from Kentucky, after hearing the stories of constituents from our districts and from those across the country, would consider speaking in support of the amendment to ensure all Americans that this bill will not go into effect if it could lead to the death of any individuals who rely on Medicaid, especially because we've heard from our Republican colleagues this will only impact able-bodied people and that the cuts will not impact the most vulnerable amongst us. So if that were to be the case, then I think this amendment is something that all members of the committee, both Republicans and Democrats, would be able to support. So
Sorry, I didn't hear you.
Sure, I'm happy to repeat. So I would just ask that based on the stories that my colleagues have shared, the fact that Republicans have spoken that this bill only impacts able-bodied people and that cuts would not impact the most vulnerable amongst us, cuts would not impact those for who the program was originally intended for, whether you would speak in support of the amendment, which simply states that the bill will not go into effect if any of the provisions result in the deaths of individuals stemming from reduced access to healthcare services. I also mentioned that the section that you had spoken on, the moratorium on implementation of rule relating to staffing standards for long-term care facilities, if the bill is passed along party lines, that would be part of it. So now that you've heard from so many of our colleagues about the constituents that cuts to Medicaid would impact, whether you would speak in support of the amendment to ensure to all Americans that these cuts will not lead to a loss of access to care that could result in the death of any Americans who currently rely on Medicaid.
Well, I don't need to vote for the amendment because I wouldn't support a bill if I thought it was going to lead to the death of any American. So I'm not supporting a bill that leads to the death of Americans. I don't think ours does. I think it strengthens the Medicaid system. So I'm supporting the underlying bill.
Well, I think just given how late it is and how many questions people have and the disconnect between the two parties, I think supporting the amendment would just send a very clear signal to all Americans that this bill will do what the majority says it will.
I think the bill stands for itself. I don't think it's going to lead to the death of individuals.
Okay. Well, I think an amendment like this one, instead of hoping and thinking it would provide a little more certainty for all the Americans out there who understandably rely on Medicaid and all that it does to improve their lives, especially those with long-term disabilities. I would just want them to be able to wake up in the morning and know that both Republicans and Democrats want this program to continue to serve those populations, and this amendment would really solidify that. So I hope to have the support of everyone on this committee, both Republicans and Democrats. Thank you, and I yield back to my colleague from Louisiana.
Gentleman yields. Is there any other member seeking recognition? Hearing none.
Roll call, please.
If there's no further discussion, the vote occurs on the amendment. A roll call vote has been requested. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller Meeks. Mrs. Kamick. Mr. Obernolte. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Mr. Gatt. Mr. Gatt votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle votes aye. Mr. Veazey? Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Bardagan? Ms. Bardagan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Strahan? Ms. Strahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no. Mr. Allen is not recorded. Mr. Allen votes no. Mrs. Miller Meeks is not recorded. Mr. Obernolte votes no. Mr. Chairman, on that vote, there were 24 ayes and 27 noes.
For what purpose is the gentleman for Texas seeking recognition?
Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment.
Mr. Chairman, is this amendment FCD-AMD_046?
Yes.
Amendment offered by Mr. Veazey, strike section 44132.
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Buried deep in this $800 billion in cuts to Medicaid and the Affordable Care Act is a particularly harmful provision that will prohibit states from creating a new provider tax or existing ones. Provider taxes allow states to expand access to covered Medicaid benefits by taxing providers such as hospitals and nursing homes instead of increasing the burden on taxpayers. Provider taxes are used to ensure that federal tax dollars are returned to your state and spent in your districts and communities. And let me be clear, this provision is a direct attack on the way states fund health care. This is a move that would devastate state Medicaid programs, especially in places like Texas. And my amendment moves to strike this provision entirely. Now, I represent Texas, and we are a state that has not expanded Medicaid. And I want my colleagues to understand something. Texas runs the leanest, most efficient Medicaid program in the country. That's not an opinion, it's a fact. We spend the lowest percentage above federal minimum requirements of any state. And so if you're looking for a fiscal discipline in Medicaid, Texas is the model. And so when we say this bill will punish states, a state like Texas gets hit the hardest. And for what? For doing more with less? This moratorium on provider taxes is not some technical tweak. It's going to be a gut punch to how state manages Medicaid. And when my Republican colleagues say this won't hurt kids and this won't hurt moms and this is not going to hurt the disabled, I've got news for each and every one of them. It's just not true. I'm going to tell you exactly why. In states like Texas, provider taxes are the backbone of our Medicaid financing system. We use these tools to supplement federal funds to enhance care for children, for pregnant women, people with disabilities, and vulnerable adults. This isn't a loophole. It is a congressionally sanctioned mechanism used responsibly by 49 out of 50 states. Only Alaska doesn't use them. And so let me say again, 49 states use these provider taxes, and that means the state will, that means healthcare of over 81 million people across the country is funded in some way by provider taxes. And we want to give their state no option to adjust if necessary. If this was some shady, abusive gimmick, why is everyone doing it? And why has Congress allowed it for decades? These taxes support supplemental payments to providers that allow states to improve behavioral health access, expand home and community-based services, and support critical safety net hospitals. And this bill will be particularly detrimental to Texas because of the way we fund our provider taxes. In Texas, these provider taxes are locally designed and state approved through what's called the Local Provider Participation Funds, or the LPPFs. These aren't imposed from Austin. They're built from the ground up. And local communities get to decide to participate. They pass ordinance and the state legislature sign off. And they use the funds to meet local health care needs. And some counties participate and some don't. It's called federalism. It's called local control. And this bill would take a sledgehammer to that model. And not only would it cap the tax rate, it would freeze the system entirely. No new LPPFs could be created. If a county doesn't have one now, guess what? They are out of luck forever. That means if a community wants to improve maternal care, build out a children's clinic, or respond to a health crisis like a workforce shortage or a behavioral health emergency, they can't. Their hands are tied. And that is just short-sighted, it's dangerous, and it's uniquely damaging to Texas. That gives us no ability to adjust, respond, innovate, and let me tell you, local hospitals are worried. I've already heard from local hospitals about reconsidering plans to expand services for children, moms, and babies. Parkland, one of the largest safety net hospitals in the country, said this provision will put them in a very precarious situation, threatening their ability to deliver essential care. And rural hospitals in Texas stand to lose the most. They will close as a result. Rural hospitals in Texas will close. And let's be real, this isn't just about Medicaid beneficiaries. This is going to touch everyone, because if states can't use provider taxes to finance Medicaid, they will have to find money elsewhere. That means raising taxes on everyday citizens, sales taxes, income taxes, property taxes. So when folks say, oh, this bill won't affect the average American, I say again, that's a lie. This bill will affect everyone, whether you're a mom.
What?
I strike that.
Thank you.
This bill will affect everyone, whether you're a mom trying to schedule a prenatal visit, a child needing therapy, or a taxpayer footing the bill for a broken system that can no longer self-fund. And what message are we sending to states with this provision? I have run out of time, Mr. Speaker, but Mr. Chairman, but I wanted everyone to know just how this is particularly going to hurt a lot of our communities around the country, but Texas in particular. Thank you.
The gentleman yields. Does any member seek recognition? Chair recognizes the gentleman from Kentucky.
Thank you, Mr. Chair. I appreciate the opportunity to speak to this. So here, the issue when Medicaid was set up, it's a state-run program. So state makes a lot of decisions on what they cover, who they cover, how they cover. And it's always been a share between the states and the federal government. And so in Kentucky, it was 72, it's currently 72 cents, 28 cents for the most vulnerable. But if you're an able-bodied adult, it's 90 cents from the federal, 10 cents. That's the way it was set up. And so when I was in the General Assembly, I remember before I even understood what provider taxes and things were, people would get up on the House floor, the Senate floor, and say, let's expand this program. It only costs us a quarter, or 25%. Well, a quarter of a several billion-dollar program was real money, and you had to make decisions, and you had to be efficient, and you had to work. But then providers would come to the General Assembly. So the General Assembly doesn't go tax providers. The providers goes to the General Assembly and says, come take money from me, put that money in your general fund, and then send it up to Washington and draw down federal dollars. It became an unopened checkbook on the federal taxpayers. And so throughout time, there's been limits put on provider taxes throughout. Currently, it's at 6% total of a revenue of a hospital can be for the provider tax, but it just became just an unlimited drawdown of federal dollars. Some states like California have figured out that, well, they can tax their Medicaid managed care plans and get around the provider tax. So what we're doing here is all of those kind of funding. So the General Assembly of Kentucky, we call it the General Assembly, really doesn't have to make decisions because they can just go to some kind of healthcare entity, draw down money, send it to Washington, and take federal tax dollars. That's why the explosive growth of Medicaid has been there, and that's why previous Congresses, I'm not even sure when the 6% came in, so I can't even answer who voted for it or who didn't, but I do know that it was just a protection on the federal taxpayer. And so I've had a couple of people comment that this provision or these similar provisions we have, we hold harmless other provisions. Said the hospital is going to close across their states, but if they're operating today, so if a hospital in your state, rural, urban, suburban, is operating today, there is not a penny they're going to see go backwards. So I don't understand how saying you're going to have the same money you have today and it is going to just shut hospitals down tomorrow. And that's the argument people are making. It's not accurate. And so what we want to make sure is that we have control on the drawdown of federal dollars and have a say in the drawdown of federal dollars. So we've decided, and there's been a lot of discussion of this, we decided to hold states harmless and hold them at the provider tax where they are. And we think that's the right policy, and I will yield back.
Gentleman yields. Any other members seek recognition? The chair recognizes the gentleman from California.
Thank you so much, Mr. Chairman. This bill will increase the financial strain and burden on states. There's no doubt about that. It will require the unfunded mandate for the states to administer the work requirement programs. There will be 13.7 million uninsured, which will drastically increase uncompensated costs in hospitals. And there will be more administrative reporting and eligibility verifications, which are unfunded mandates as well. So while there will be an increase in unfunded mandate costs and increased uncompensated care costs to states, this bill hamstrings states from using the provider taxes that produces matching federal funds. So let me give you some quotes from the California Hospital Association, which said that this legislation proposed by the House Energy and Commerce Committee to enact massive Medicaid cuts is a devastating blow that will be felt by all who need hospital care. That was a quote by Carmela Coyle, President and CEO of the California Hospital Association. She continues, cuts of this magnitude cannot be absorbed. Hospitals will have no other choice but to reduce patient care services or, in the worst cases, close entirely. That means care is lost for everyone, children, seniors, privately insured people, no matter what type of health insurance coverage you have. The National Rural Health Association says the Medicaid program is a lifeline for the rural hospitals. Medicaid cuts will close rural hospitals. Since 2010, nearly 190 rural hospitals have already shuttered their doors or stopped inpatient care. Public payers, including Medicare and Medicaid, comprise a large share of hospitals serving in rural areas, making rural hospitals more vulnerable to cuts in these programs. Medicaid funding is critical for sustaining rural healthcare systems, including hospitals, clinics, community health centers, and long-term care facilities. Right now, almost half of rural hospitals across the country are operating with negative margins, meaning that any reductions to Medicaid funding would force many facilities to reduce or eliminate essential services, delay much-needed equipment upgrades, or close their doors entirely. So this will affect patients on Medicaid and patients on private health insurance. This affects everybody. And so when the states are strained with their budget, what do? Now, we know this by history, but by experience, but we also know that the CBO kind of informed us of what they would do as well. So in order to to pay for this unfunded mandate that you all are imposing on states, they will raise taxes or have to shift funds from other programs. Another thing states will do is they will cut benefits. But, whoa, I heard before that they said they were not cutting benefits. This is how these benefits are going to get cut. And they will also reduce eligibility, further reducing the people that are on the Medicaid programs in those states. The other thing they'll do is they'll reduce physician payments, which will lead to less access to physicians who take Medicaid patients. And in some cases, with physician practices that see a high caseload of Medicaid patients, they may have to close their clinic, and patients with private health insurance will have less access to those physicians as well. So I hope you all take this seriously, and that this provision that freezes the provider tax, is detrimental and fits into this cascading downward spiral of the access to care for not only Medicaid patients, but also patients on other health insurances. And with that, I yield back.
Gentleman yields. Does any other member seek recognition? The chair recognizes the gentlelady from Michigan.
Mr. Chair, I move to strike the last word.
Without objection.
Mr. Chairman, by freezing states' providers' tax rates and prohibiting any new provider taxes, Republicans are gutting the ability of states to respond to their individual health needs. Most states rely on provider taxes as supplementary revenue to finance a portion of their Medicaid program, serving as a cost-effective tool to maximize federal support. In Michigan, approximately 20% of the state's non-federal Medicaid funding is generated through provider taxes. Freezing provider taxes will increase rates of uncompensated care, hamstring and destabilize providers, restrict access to health coverage, and increase risks of service cuts and closures. The biggest concern in Michigan is the way that it's drafted. In just the first year, Michigan would lose over $1 billion. And with provider rates capped at a fixed amount, the provider tax implications will continue to grow into greater funding challenges. I believe we must reject any effort that would restrict access to care that patients deserve, which is why I support Representative Veazey's amendment, and I yield back.
Gentlelady yields. Does any other member seek recognition? The chair recognizes the gentlelady from California for 5 minutes.
I'd like to speak in support of this amendment.
Without objection.
I'd like to support this amendment and take an opportunity to read what the California Medical Association has stated about this particular section. CMA opposes Section 44132, the moratorium on new or increased provider MCO taxes. We are strongly opposed to the new draconian funding freeze on provider and managed care organization taxes. This freeze is a cut that will ultimately reduce funding for safety net providers already on the brink of closure, especially in rural communities. 1/3 of all rural hospitals are at risk of closing nationwide. The moratorium will also discriminate against states that want to adopt an MCO or provider tax in the future to ensure plan and provider participation, cover beneficiary caseload growth, or meet new public health challenges in their states. Moreover, these capped allocations will not keep pace with increasing costs and caseloads brought on by inflation, economic recession, public health emergencies, and natural disasters. These cuts jeopardize our patients' health and the viability of the entire healthcare system. As the independent CBO estimated last week, reduction in provider and MCO taxes would result in 8.6 million people losing Medicaid coverage. Over time, a funding freeze will have the same impact. States will not be able to close the funding gap and will ultimately be forced to cut coverage and benefits for Medicaid enrollees will get less care. Veterans, seniors, people with disabilities, children, pregnant women, and low-income working adults. rural communities across the nation will suffer enormously from these disproportionate cuts. We urge the committee to withdraw this short-sighted proposal, and it is signed by their president, Shannon Udovak-Constant, and their CEO, Dustin Corkian. Again, I think this is something that's going to be devastating, not just for California. The Kaiser Family Foundation says all states but Alaska finance part of the state share of Medicaid funding through at least one provider tax, and 39 states have 3 or more provider taxes in place. So I support this amendment, and I yield back.
Gentlelady yields. Does any other member seek recognition? The chair recognizes the gentleman from California for 5 minutes.
Thank you, Mr. Chairman. Look, let's have an honest conversation about what we're talking about here, right? Provider taxes is a provision of Medicaid law that has been abused. And the fact that so many states are doing it is an indication of just how widespread the abuse is. And we've created a system, unfortunately, that incentivizes the bad actors, and states feel bad when they're left behind. I mean, here's a system where the federal FMAP for expansion population is 90%. So a state imposes a tax on its own providers. The state only has to pay 10% of the tax. The federal government, and U.S. taxpayers, pay 90% of the tax. The state kicks back the tax that the provider paid and pockets it itself, or in some cases, finds ways of getting it back to the providers. Okay, that is a system that should never be allowed, because it is just a way of drawing down federal dollars. So what we're proposing here is a simple moratorium. We're not taking anything away from anybody. All we're saying is don't make the system any worse. More draconian solutions have been proposed in the past by, ironically, my colleagues across the aisle. President Obama in 2013 proposed actually ramping down the maximum allowed safe harbor on the provider taxes, all the way down to 3.5%. And at the time, then Vice President Joe Biden called provider taxes a scam, because that's what they are. So the fact that all we're doing here is capping it is a lot less draconian than is what has been proposed by Democrat administrations in the past. So let me just suggest to everyone here, this is a problem that we need to fix. I mean, this is a huge wart on our Medicaid system. It creates all kinds of perverse incentives, and it rewards the states that are willing to be the most abusive. It needs to be fixed. But let me challenge everyone here. I hear what people are saying about rural hospitals and healthcare providers. I have them too. And I don't want them hurt by a lack of revenue. So let's sit down and talk about how to phase out provider taxes and figure out an alternate way of getting these providers the funds that will backfill their losses there. And that way we will have fixed the system while at the same time holding our providers harmless. But I mean, this is baby steps here. All we're doing here is saying, let's not let the abuse get any worse. Everyone ought to be able to agree to that. I yield back.
Gentleman yields. Does any other member seek recognition? The chair recognizes the gentlelady from Illinois for 5 minutes.
Thank you, Mr. Chair. I yield my time to the gentleman from Louisiana, Mr. Carter.
Thank you very much. I move to strike the last word.
Without objection.
I want to thank my colleague for offering this amendment. As a former state legislator, I know firsthand what provider taxes mean for states like Louisiana. Imposing a moratorium on new or increased provider taxes is simply Republicans' plan to restrict what a state can do in the future with their Medicaid program. Yes, you heard it right. The party in favor of so-called states' rights is controlling what states can do and can't do with their provider taxes. As everyone on this committee knows, provider taxes are a critical source of revenue that states like Louisiana use to finance their state's share of Medicaid costs. That's why proposals restricting states' ability to carry out the provider taxes should be seen for exactly what they are: Medicaid funding cuts and a tax on people who rely on Medicaid for health coverage. What does this mean for Americans and Louisianians on Medicaid? It means health coverage losses, less money for Medicaid, people off the rolls. Unfortunately, less Medicaid Funding leads to tough decisions. Louisiana policymakers could be forced to cut services and kick people off Medicaid, or consider reducing income eligibility levels for mandatory eligibility groups, such as children, pregnant women, and parents/caretakers. Almost half of the population in my district relies on Medicaid for health coverage. The effects of this proposal will be extremely devastating for people in my district, the state of Louisiana, and the people across the country who rely on Medicaid for health care. I will tell you, when we expanded Medicaid in Louisiana, we put tons of people on the rolls who had been the ward of emergency rooms, which was a burden on the system. We also took the state from a fiscal cliff and brought them into a point where resources were available to reopen rural hospitals, where up until then, many of these communities did not have access to hospitals. The reverse will also be true. If we take away these provider taxes, the state will have no choice but to reduce the amount of people they can serve. And when they reduce the amount of people they can serve, rural hospitals will in fact close. It's a domino effect. Follow the dollars. That is what the net effect is going to be. While on its face, it sounds good to say, this is just trying to take baby steps. Well, these baby steps are steps that will hurt people who are barely trying to step at all. I implore you to take a long look at the science. Look at the fact that these are people and not simply numbers on a spreadsheet. I yield.
Gentleman yields. Any other members seeking recognition?
that was my time.
Oh, excuse me, I'm sorry.
I just want to add, as people have heard me say before, my district is urban, suburban, and rural. I start on the south side of Chicago, and I have 4,500 farms in my district also. In every part of my district, urban, suburban, and rural, some of my hospitals are already hanging by a thread, and they're already cutting services, moving obstetrics to other hospitals. A couple of my hospitals have already tried to do this. So please listen to my colleagues. Please listen to this amendment. We are hanging by a thread right now, and I'm so afraid more of my hospitals will close in every part of my district. I yield back.
Gentlelady yields. Does any other member seek recognition? The chair recognizes the gentlelady from Massachusetts for 5 minutes.
Thank you, Mr. Chair. In Massachusetts and in nearly every state, provider taxes are a vital tool to keep Medicaid afloat. Provider taxes are a core part of how states finance their Medicaid programs and maintain access to care, especially during public health emergencies and system-wide crises. When provider taxes are frozen, it strips states of the flexibility they need to act quickly when emergencies hit, whether it's a pandemic, a natural disaster, or the collapse of a hospital system. These taxes, reviewed and approved by CMS, help states make up for chronic underfunding in Medicaid and ensure that care remains accessible for low-income seniors, people with disabilities, and families who depend on long-term care. We can have a conversation about different financing models, but the fact is, this is the system in place. And if we freeze provider taxes, states will lose critical Medicaid funding. And while my Republican colleagues claim the real problem in healthcare is a lack of providers, this policy will only deepen that shortage. Freezing provider taxes will result in fewer nurses in nursing homes, fewer doctors in community hospitals, and fewer providers able to stay open in the hardest hit parts of our state. We've already seen the consequences when our healthcare system is pushed past its breaking point. When Steward Healthcare collapsed in Massachusetts, hospitals shuttered overnight. Patients were forced to travel hours for emergency care. The state had no choice but to step in, and provider taxes were one of the only immediate levers we had to stabilize the situation. This bill takes that tool away. It doesn't just tie states' hands, it tells them to stand by and watch the next crisis unfold without the power to respond. There is nothing neutral about that. This is federal overreach, plain and simple, with devastating consequences for the people that we represent. If this bill passes, states will be expected to manage public health disasters with fewer resources, fewer options, and more red tape. We should be equipping states to protect access to care, not making it harder for them to do so. So I urge my colleagues to think twice before forcing this cut on the backs of working families, and I yield back.
Gentlelady yields. Are there other members seeking recognition? The chair recognizes the gentlelady from Florida for 5 minutes.
Thank you, Mr. Chairman. I want to thank the gentleman from Texas for offering this amendment. It's really an essential piece of financing healthcare back home. And boy, my Florida hospitals are very outspoken and concerned about this because, like my colleague from Texas, Florida is pretty stingy. They've been very conservative. They have not expanded Medicaid, and we have an older population that, as all the baby boomers retire and enter into long-term care or have really chronic or acute conditions, the hospitals and skilled nursing use this flexibility to serve everyone. And what the Republican bill is doing, it's kind of choking off the ability to serve those residents, all for a tax cut for billionaires, by the way. So remember, don't forget that part. So I have a couple questions for council because I want to make sure that I'm clear on this. Council, is there any circumstance in which a state could establish a new provider tax or increase in an existing provider tax? And I'll give you a few circumstances and just confirm yes or no whether a state could establish a new provider tax in that scenario. Okay. If a state has concerns about the duration of its home and community-based services wait lists, which sometimes leaves our neighbors with disabilities, including children, waiting for as long as 20 years to get the care that they need, could the state establish a new or increased provider tax to generate revenue to invest in expanding home and community-based services?
The bill in question would grandfather in all current provider taxes.
But my question was, could they establish a new or increased provider tax to address the wait list on home and community-based services?
The bill does not permit increases in provider taxes.
Okay. If there is an economic downturn, and thus the state has to manage the competing problem of Medicaid spending going up because fewer people have jobs. At the same time, the state revenues are going down. Could the state get a new provider tax or increase it to, could they increase it then?
The bill does not permit increases on the amount or rate of the tax imposed, but does not otherwise prohibit other usage of state funds.
So no. If uncompensated care increases dramatically, given 13.7 million fewer people having health insurance under the GOP bill, can a state increase its provider taxes to generate revenue to help fund payments to shore up hospitals at imminent risk of closing?
The bill does not permit increases in the amount or rate of the tax.
How about if a hurricane hits? It devastates a region and it creates massive demand for health care. Could a state get a new provider tax or increase an existing provider tax then?
The bill does not permit increases in the amount or rate of the tax.
Okay. Well, you heard it. It doesn't matter what the circumstance is. They don't have the flexibility. The GOP now is choking off the ability for our hospitals back home, our states, to be able to serve everyone, no matter what the circumstances is. So they're not going to have many options. They're going to say, all right, taxpayers, we're going to you to raise taxes from everyone. That's not great. Or they will slash other things like public education. More likely, as acknowledged by the Congressional Budget Office, states will have to turn to cutting provider payments, cutting benefits, cutting people off of their coverage, all to squeeze more money out for billionaire tax giveaway. So my colleague from Florida, I'm happy to yield you some time, the remaining time.
Thank you. I just associate myself with the amazing remarks of Representative Castor. We've heard from a ton of local hospitals and the Florida Hospital Association, not groups known for being, super spendthrift or liberal, right? They have the provider tax capped at 4% right now. That would be a permanent cap, and that would restrict their ability to be able to react to different emergencies that may happen. And so I certainly support the amendment, and I yield back to the gentlelady.
Gentlelady yields back. The gentlelady yields back. The chair will now recognize Mr. Tonko for 5 minutes to speak on the amendment.
Thank you, Mr. Chair. I speak in support of the amendment offered by the gentleman from Texas. I have hospitals in my region that have truly struggled and are hurting. Many of these same hospitals have been hit especially hard over the last few years, and yet they provide services in communities where people have nowhere else to go. If it were not for these hospitals, my constituents could not get care. And I'm not the only one. There are several members here that have hospitals in their districts that would be harmed by these policies. Mr. Chair, a hospital in your district, the Medical Center in Bowling Green, would lose millions of dollars from these cuts to Medicaid. What does that mean? That means people losing their jobs and their health care, or worse. Other members, who I cannot name per the rules of this committee because Republicans are so scared of being called out for what they're doing to their constituents, have hospitals in their districts that will lose millions of dollars if these changes to Medicaid go through. I also recognize that hospitals don't get to pick their patients in the way that other parts of our health system unfortunately can do. In the capital region of New York, our hospitals provide access to care for those who need it most. With that in mind, I am extremely concerned that the cuts to Medicaid made in this package will pull the foundation out from hospitals that are already struggling. But don't take it from me. Listen to our hospitals, including many from my communities. Dr. Stephen Hanks, President and CEO of the St. Peter's Health Partners in Albany and St. Joseph's Health in Syracuse, shared how devastating these proposed Medicaid changes would be. I quote him in that he stated, restrictions on coverage are, in fact, camouflaging direct cuts to hospitals, forcing us to shoulder more and more uncompensated care. These proposals will result in significant harm to our systems and cuts to the tune of tens of millions of dollars that will force us to make some incredibly difficult decisions. Congressman Taco's proposed efforts on our behalf is a welcome effort to help prevent a disaster. We strongly urge others to join in supporting this action to ensure our hospitals can continue to serve our communities. The Healthcare Association of New York State, Haney's, which is New York's statewide hospital, and Continuing Care Association shared this statement, and I quote, no patient, provider, or community will be healthier if the U.S. House Energy and Commerce Committee's Medicaid proposals go into effect. This package will cause a substantial number of New Yorkers who rely on Medicaid to lose their coverage, and it will slash all New Yorkers' access to care by cutting essential funding for hospitals and other providers. Haney's urges New York's congressional delegation to reject this bill. The Greater New York Hospital Association slammed the Republican Medicaid cuts and said this, and I quote, the bill's massive cuts will strip health coverage from millions of hardworking Americans, drive up uncompensated care costs for financially struggling hospitals, and shift unsustainable costs to states that will have no choice but to reduce hospital reimbursements, cut health insurance benefits, or limit eligibility. It will severely harm the constituents of every member of Congress that votes for it and the hospitals that care for them. Furthermore, Medicaid cuts to hospitals affect all patients, not just those with Medicaid coverage. This bill should be rejected. And America's Essential Hospitals shared this, and I quote, America's Essential Hospitals is deeply concerned by the draft reconciliation bill text released by the House Committee on Energy and Commerce. This unprecedented level of Medicaid cuts would devastate the program, undermining the ability of essential hospitals to provide critical services, including trauma care, behavioral health, maternal health, and public health emergency response. These hospitals, which already operate on thin margins, cannot absorb such losses without reducing services or closing their doors altogether. The president of the Federation for American Hospitals said this, and I quote, "Congressional Republicans and President Trump rightly pledged to protect Medicaid benefits and coverage. This bill fails that test. I couldn't agree more, and I urge everyone to support this amendment and support our hospitals across our nation." With that, Mr. Chair, I yield back the remainder of my time.
Thank you. The gentleman yields back, and I have a submission for the record. The gentleman, my good friend from New York, mentioned my hospitals in my area. So I had a message today from the Kentucky Hospital Association. It says, appreciates all the hard work Chairman Guthrie put into protecting Medicaid in Kentucky, and it says, Chairman Guthrie's mark will assure our hospitals can continue to provide care to our patients where they are and when they need it. So I look forward to seeing where you got those numbers, because it doesn't seem to match up with the Kentucky Hospital Association. And anyone seek recognition to speak on the amendment? Gentleman from Massachusetts, you're recognized for 5 minutes to speak on the amendment.
Thank you, Chairman. I want to start by associating myself with the comments from the gentlewoman from Florida and gentlewoman from Massachusetts about the criticality that these taxes provide for flexibility for states to respond to disasters and to unforeseen circumstances where they need that spending power. Like Mr. Hahn, I saw it in Massachusetts with Steward. I also, though, Mr. Chairman, I want to actually say that your description of the provider taxes is not wholly without merit. You laid out legitimate critiques that could be addressed in a bipartisan fashion. And the gentleman from California is not wrong when he says that former presidents Obama and Biden had in the past talked about provider taxes as challenging. Here's the difference, though. Presidents Obama and Biden had a plan. They talked about something that needed to be fixed, and then they had a plan to fix it. What we heard from the gentleman from California is, well, we're going to freeze it, and then we're just going to kind of hope that Congress solves a big problem. And the problem with that is that hospital services are the fastest inflating sector of the U.S. economy. So when you freeze something, in fact, you're not freezing it. It's a cut, let's be real. And then you're cutting rural hospitals, and then you're telling these rural hospitals, but don't worry, because Congress is on the case, and they're going to solve this problem for you immediately. And you're going to have to forgive these rural hospitals for saying, well, that doesn't help me serve my patients right now. And the states from saying, that doesn't help me cover my population right now. So this is an example of something that, had this bill been done in a bipartisan fashion, had you brought to the table, Mr. Chairman, a critique of provider taxes along with a solution, and had we been having a conversation about taxes and healthcare together as opposed to having cuts to healthcare serve cuts to taxes, we could have actually gotten to a really strong bipartisan solution here. And instead, we're in a situation where we're going to be having cuts to rural hospitals in service of tax cuts for the wealthiest Americans. And that's a backwards policy. I yield back.
Gentleman yields back. Any other seeking recognition? Gentleman from New Jersey is recognized for 5 minutes to speak on the amendment.
Thank you, Chairman. I speak in support of the amendment. States rely on provider taxes to finance their share of Medicaid costs and close the cost gap for essential services our families rely on. Depriving states of this vital support would be devastating for states, hospitals, especially safety net and rural hospitals, and our constituents who stand to lose life-saving coverage. My colleagues on the other side of the aisle are trying to pretend this policy isn't as harmful as it is. But over time, as state health needs change and as factors such as inflation, medication prices, increases in demand, and changes in utilization increase the overall cost of care, this policy would reduce the value of resources that support our Medicaid patients, all without giving states any other means to compensate for the loss, as my colleague from Massachusetts pointed out. This would leave states with three damaging choices: slash payments to hospitals, nursing homes, and other providers, cut benefits for patients, or kick people off the program entirely. I thank my Democratic colleagues for speaking about the impacts that this provision of the bill would have on hospitals in their districts and states. I would ask my Republican colleagues, have you talked to hospitals in your district? Have you talked to your nursing homes? Have you talked to your healthcare providers? Because they have been overwhelmingly clear that they don't want this. Let's be clear, for all Republicans have thrown around terms like efficiency today, they're only trying to reduce the amount of money the federal government spends on essential health services. They're not trying to make the overall healthcare system work better. In fact, this Republican proposal will make our healthcare system less efficient and more expensive. First, they devastate state budgets, forcing them to pay more and cut coverage. Then, many of our most vulnerable community members lose insurance or lose benefits that keep them healthy. And then families in all of our districts become sicker, requiring more care that they would otherwise need from a system that is now less equipped to provide it. So who loses? Our states, our healthcare providers, our hospitals, and most importantly, our constituents. The only reason to take a hammer to provider taxes is to deliberately force states into a corner. Either they can cut care or they can eat the cost. So clearly, this bill, and specifically this provision, has a deep and lasting impact on how we pay and provide for Medicaid across the country. So I want to touch on two quotes from the president from this year. In February, he said, quote, "Medicare, Medicaid, none of that stuff is going to be touched." So between 13.7 million people losing health care coverage or states not being able to have flexibility on their provider taxes, I just ask any of my Republican colleagues if they would say that is not touching Medicaid. So it seems that the president misled the American people when he said Medicare, Medicaid, none of that stuff is going to be touched based on the text of this bill. In April of this year, President Trump said, quote, "House Republicans are working to invest more money in Medicaid than we spend today." But with respect to this bill and specifically this provision, it seems that we will not be investing more money in Medicaid, and I welcome any Republicans who believe that this bill, and specifically this provision, would lead to a greater investment, investing more money in Medicaid than we spend today. So this bill is 0 for 2 on promises that President Trump just this year made to all Americans. One, again, being that Medicaid is not going to be touched, and two, that House Republicans are working to invest more money in Medicaid than we spend today. Clearly, that was not accurate. That is not what we are doing here today. In fact, we are doing the opposite. We are cutting health care for so many Americans who rely on Medicaid, and that is why so many Democrats are opposed to what is happening here, especially the fact that it's happening in the middle of the night and early in the morning when Americans cannot see that the Republican majority is cutting health care for over 13 million Americans. Thank you, and I yield back.
Gentleman yields back, and the gentleman from Alabama is recognized.
Thank you, Chairman. I rise in opposition to the amendment.
Gentleman's
Move to strike
recognized.
the last word.
Gentleman's recognized.
You know, we've been sitting here all night, and I appreciate the opportunity to spend this evening with you. My Democrat colleagues acting as though this is an unreasonable policy to freeze provider taxes when Democratic leadership from just a few years ago were trying to reform provider taxes in a much more serious and deliberate way. In President Obama's fiscal year 2013 budget, it said the budget seeks to make Medicaid more efficient by streamlining financing and reimbursement policies. Specifically, the budget proposes reduce the Medicaid provider tax threshold beginning in 2015 to promote integrity of federal-state financing. And what that plan called for was reducing the provider tax to 3.5%, phasing it down to 3.5%. Even Vice President Joe Biden had this to say, it's a scam. The states were gaming the system, taxing doctors and hospitals so they could get federal reimbursement and then returning the money to the providers. He said, let's call it like it is and let's just do this. The Washington Post, talking about what a hideously complex program it is, that it needed to be made more transparent and accountable. They're, in an editorial, they wrote, we refer specifically to reforming the so-called provider taxes that 46 states and the district use to fund increased payment rates to Medicaid providers and to shift the cost to the federal government. Dick Durbin called it a bit of a charade. He's still in office. They supported, as I said, cut the provider tax to 3.5%. And in one study, the GAO found that the state's reliance on provider taxes and local government funds decreased states' share of new Medicaid payments and effectively increased the federal share of net Medicaid payments by 5 percentage points in fiscal year 2018. So again, what we're saying here today is that by freezing these state provider taxes at current rates, we can make sure states have skin in the game to help the Medicaid program run as efficiently and effectively as possible. Also run in such a way that it's not a complete scam, as Vice President Biden called it at the time. And the problem is, if we don't address this, the states are going to continue to have an over-reliance on provider taxes, which erodes that incentive for the program to operate in a more transparent and honest way. So, once again, and again, I keep hearing my colleagues say there's 13 million people going to lose their health insurance, and we all know that's inaccurate. I'm trying to be sensitive to their sensibilities about the use of words, Mr. Chairman, but that is totally inaccurate. But it's okay for them to keep doing it because it's totally in keeping with their message. I yield back.
Yield to me?
Yes, sir.
I just wanted to, point out what President Trump did say was waste, fraud, and abuse. I say word efficiency because, fraud is doing stuff just illegally, and it's not illegal to do what they're doing, but it is something we have to get a handle on to be efficient. And talking about not cutting, we're holding it harmless. People are getting the money that they're getting from the program, and provider taxes is 6% of the revenue of the provider. So as the revenue increases, the provider tax increases with it as well. It doesn't just freeze it at the current dollar value, it just freezes at the current rate. So I appreciate you yielding to me, and I'll yield back to you.
Well, you just reinforced what's going on here is the misrepresentation of the facts is a fraud in and of itself, but we've been listening to that all night. I yield back.
Gentleman yields back. Anyone seeking recognition? Gentleman from California, Mr. Mullen, is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I move to strike the last word. The needless freeze of state provider taxes included in this bill is an existential threat to thousands of hospitals and community health centers across the country. Provider taxes have been in place for over 2 decades, and 49 states use them today. This is not fraud or abuse, but rather a legitimate and vital funding stream that states desperately need. California voters made their decision clear when they voted for Proposition 35 in 2024 to enact a permanent provider tax. 68% of Californians supported the measure, including the majority of voters in every California congressional district, Democratic and Republican alike. The provider tax freeze and redistribution requirements included in the bill would be catastrophic. They would effectively overturn the will of the voters in my state and dozens of others. Countless hospitals and community health centers would close, especially in rural areas. And at a time when the cost of living is already too high, they will raise health care premiums for everyone. I urge my colleagues to think of their constituents and communities and vote yes on the amendment. I yield back.
Gentleman yields back. Is there any further discussion on the amendment? Seeing none, if there's no further discussion, the vote occurs on the amendment. Roll call vote. The roll call vote has been requested, and the clerk will call the roll.
Mr. Latta? Mr. Latta?
No.
Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Crenshaw? Mr. Crenshaw votes no. Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no.
Mr. Allen, Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Ruley votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Ms. Fedorchak? Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark?
Aye.
Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Vesey? Mr. Vesey votes aye. Ms. Kelly? Ms. Kelly votes aye. Mr. Badagan? Ms. Badagan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no.
So how's Mr. Allen recorded?
Mr. Allen is not recorded. Mr. Allen votes no.
Ms. Fletcher?
Ms. Fletcher is not recorded. Ms. Fletcher votes aye.
Anyone on the Republican side here to? Anyone on the Democrat side? Seeing none, the clerk will report. Clerk will report.
Mr. Chairman, on that vote, there were 24 ayes and 27 noes.
The amendment is not agreed to.
Mr. Chairman, an amendment.
Yes, the gentlelady from Florida.
I have an amendment at the desk labeled 047.
The clerk will report.
Mr. Chairman, could the gentlelady please specify the amendment?
Oh.
It's Health, FCD, AMD 047.
HE-FCD-AMD_047, amendment offered by Ms. Castor, strike section 44.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Good morning, everyone. This is an amendment that's certain to wake you up. It's relating to state-directed payments. Seriously, though, this is an amendment, again, that highlights the fact that my Republican colleagues are choking off some of the important ways that we finance care to our neighbors back home, all to provide a tax cut to the wealthiest across the country. But these state-directed payments are a real lifeline to hospitals, nursing homes, other providers that treat a high volume of Medicaid managed care beneficiaries. I think we all know, especially after our discussion here, that Medicaid is very lean, it's efficient, so much so that it often reimburses providers and hospitals at rates below the actual cost of care. In Florida, Medicaid reimburses providers at approximately 48 cents for every dollar spent providing care. And I'm going to use Florida as an example, but 40 states use these direct payments. This makes state-directed payment particularly important in states like Florida, where hospitals are operating on a razor-thin margin and they need help to bridge the gap. The direct payment program helps address this shortfall. DPP accounts for about $2 billion in federal dollars to Florida each year to help serve our neighbors. Without DPP, Florida hospitals would operate at a shortfall of about $5.7 billion. With DPP, the shortfall is currently $3.7 billion. It's up to states to establish state-directed payment programs, and they are often targeted towards services that would otherwise be very difficult to afford. For example, in the Tampa Bay area, Tampa General Hospital uses these funds to operate their Health Park Clinic in East Tampa, the only place in Hillsborough County that our neighbors who are or underinsured can find access to a specialist. And even with DPP, the clinic operates at a net loss of $15 million. The hospital wants to expand the clinic, but they likely will be unable to afford to continue operating it, let alone grow it, if the GOP bill passes. Now, Baycare Health System uses DPP to invest in behavioral health services in a state where we rank at the bottom of the barrel in providing mental health care. But even with DPP, they still operate at a loss of about $50 to $60 million a year. If you look south into Manatee County, right now over 50% of women in Manatee County leave the county to deliver their babies in a high-quality facility. But thanks to DPP, Baycare is investing in rural labor and delivery units and will soon open an NICU for moms and babies in underserved Manatee County. Now, these are just a few of the examples from the Tampa Bay area, but these state-directed payments are also very important tools for safety net providers of all types, home and community-based services, dental, long-term care, anywhere they're serving a high volume of Medicaid patients. Here are a few examples outside of Florida. Memorial Health University Medical Center in Savannah uses support from Georgia Strong, a Medicaid state-directed payment program, to expand its primary care services by hiring additional physicians to grow its rural track residency program. I know a lot of folks here over the past day have talked about how difficult it is to have doctors. We have a doctor shortage, nursing shortage. This is what these dollars go to. In 70% of patients at UPMC Chautauqua in Jamestown, New York, are covered by Medicaid, Medicare, or are uninsured. The hospital there serves as a safety net for surrounding counties. They receive directed payments for inpatient and outpatient services of about $25 million. So slashing Medicaid here would destabilize care for an already underserved community. Cook Children's Medical Center in Fort Worth, Texas, delivers critical care to a booming region where 32% of children are served by Medicaid and another 7% are underinsured. Cook receives about $257 million Medicaid state-directed payments. So you can see that if you're squeezing here, the people in that area are going to have less care. Chatham Hospital in Siler City, North Carolina, serves a 25-bed critical access hospital serving 1,200 adults and children each month. But thanks in part to these enhanced Medicaid payments, the hospital's been able to buck the trend of rural maternity ward closures. All I'm trying to say is you're squeezing the Medicaid services, you're squeezing our providers that ultimately impacts the care for everyone. It's not wise. It's fiscally irresponsible to do this again, to provide a massive tax giveaway to people who really don't need it. Please pass this amendment. I yield back my time.
Thanks. The gentlelady yields back, and I'll recognize myself for 5 minutes to address the amendment. So state-directed payments, or SDPs, were created by CMS in 2016 and allow states to direct managed care organizations to pay providers according to specific rates or methods based on stated value that the payment will provide to the provider. As more state Medicaid programs have moved enrollees into MCO arrangements for their care, SDP arrangements have grown rapidly. Traditionally, supplemental payments could not exceed amounts paid by Medicare. However, the Biden-Harris administration finalized regulations permitting state-directed payments to be paid up to the average commercial rate, which can be 2 to 5 times above Medicare rates. In 2023, the Government Accountability Office reported that CMS was approving state-directed payments that resulted in hospital payments well above the Medicare payment rates in selected states. The growth of state-directed payments is a concern given the broader growth in Medicaid spending and because states are often financing the state-directed payments with provider taxes rather than state general funds, which doubles down on efforts by states to reduce their share of financing of Medicaid. CBO estimates that Medicaid spending has ramped up considerably in the past 2 years, despite the unwinding after the pandemic. And CBO has said that contributing factors to these trends are states' Medicaid financing loopholes and directed payments, and CMS estimates that state-directed payments could exceed $125 billion in 2033. So what this policy does is direct HHS to revise its current regulations to limit state-directed payments for services furnished on or after the enactment of the legislation from exceeding the total published Medicare payment rate for this service. This policy does not affect total payment rates for state-directed payments approved prior to this legislation's enactment. Placing these guardrails on state-directed payments will prevent states from shifting costs back to the federal government, and maintaining the integrity of the federal-state financing of Medicaid is key to driving efficiencies in the program. And I urge my colleagues to oppose the amendment, and I will yield back. Any further discussion on the amendment? The gentlelady from California, you're recognized for 5 minutes to discuss the amendment.
Thank you very much, Mr. Chairman. I move to strike the last word.
Gentlelady's recognized.
This bill before us doesn't just designate health care for the most vulnerable populations. This bill will tear irreparable holes in the fabric holding many of our communities together. It's no secret. This bill would undoubtedly force many of those hospitals, clinics, nursing homes, and emergency medical services and other providers to close their doors. In California alone, this bill will result in tens of billions of dollars of cuts to hospitals over the next 10 years. Many cuts come from limiting state-directed payments. If a hospital shutters a labor and delivery ward, that means no one has a place to go to give birth. When more moms-to-be are forced to drive hours to the closest birthing facility and are having dangerous labor complications as a result, Republicans will be to blame. Medicaid is the single largest payer for long-term care in this country. If an assisted living facility can't afford to keep its doors open after taking a major hit to its biggest revenue stream, that means no one can find a bed. When more of our constituents can't find a safe and comfortable place for their parents or grandparents to grow old, Republicans will be to blame. If an emergency room closes, that means no one has a place to go when they need immediate care. And if emergency medical services have to take an ambulance off the road, that means one less ambulance available when anyone has a medical emergency. When more people are dying en route to the closed ER after a major heart attack or accident, Republicans will be to blame. These cuts will be felt acutely by each and every person in our districts. We also need to consider that our healthcare facilities are often the anchors of our communities. They are often the largest employer and major economic drivers in their regions. I'd like to submit for the record this letter from over 200 California organizations about how detrimental these cuts will be, not only to the health of more than 15 million Californians, but also to the basic economic foundations of the entire state. Medicaid supports over 500,000 jobs in California. In my district alone, 12,000 employees, doctors, nurses, technicians, and support staff rely on Medicaid funding for their salaries. I know I'm not the only one in representing a district where healthcare is one of the top employers. If Republicans succeed today, millions of livelihoods across the country will be at risk. In California, we've seen this story play out. Just a few years ago, a local hospital in the rural Central Valley of California, Madera Community Hospital, had to close its doors due to financial struggles. Predictably, the health effects on Madera residents were immediate. Women were driving hours to give birth, cancer patients had nowhere to go, or for their prescriptions. Hospitals in neighborhood areas were overflowing. And soon after, Madera was feeling the vacuum effect of one of its major institutions closing. Thousands of people lost their jobs. Businesses closed. People who could afford to moved out of town. Others were left unemployed and scrambling. Madera basically turned into a ghost town. Fortunately, Madera was able to access emergency state funding that allowed it to reopen its doors. But hospitals can't be started up overnight. Many of the doctors, nurses, and support staff who worked at Madera found other jobs when it closed. It's been no small feat to get all the critical services back to full capacity. The cuts in this bill will be the final nail in the coffin for a community hospital that is already teetering in the brink. Are Republicans ready for this story to play out in their districts? For their constituents to be out of jobs, out of health care coverage, and have nowhere to turn in an emergency? I yield back the remainder of my time.
The lady yields back. Is there further discussion on the amendment? Seeing none. If there's no further discussion, the vote occurs on the amendment. A roll call has been requested, and the clerk will call the roll.
Mr. Lotta? Mr. Lotta votes no. Mr. Griffith? Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Palmer? Mr. Dunn? Mr. Crenshaw? Mr. Crenshaw votes no. Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Kamick? Mr. Obernolte? Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Ruley votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko? Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Veazey? Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Badagan? Ms. Badagan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no.
How is Mr. Griffith recorded?
Mr. Griffith is not recorded.
How is Mr.
Mr.
Carter
Griffith
of
votes
Georgia?
no. Mr. Palmer is not recorded.
Mr. Palmer?
Mr. Palmer is not recorded. Mr. Palmer votes no.
Mr. Carter of Georgia?
Mr. Carter of Georgia is not recorded. Mr. Carter of Georgia votes no.
Dr. Miller Meeks?
Dr. Miller Meeks is not recorded. Dr. Miller Meeks votes no.
Ms. Fedorchak?
Ms. Fedorchak is not recorded. Ms. Fedorchak votes no.
Mr. Obernolte?
Mr. Obernolte is not recorded.
Mr.
Obernolte
Allen?
votes no. Mr. Allen is not recorded. Mr. Allen votes no.
Landsman. Mr. Landsman?
Mr. Landsman is not recorded. Mr. Landsman votes aye. Mr. Menendez is recorded as aye.
The clerk will report the result.
Mr. Chairman, on that vote, there were 23 ayes and 28 noes.
The amendment is not agreed to. Are there any further amendments? The gentleman from
Mr. Chairman, I have an amendment at the desk.
Louisiana is recognized.
Mr. Chairman, I have an amendment at the desk, AMD_008.
Mr. Chairman, could the gentleman specify if that's FCD-AMD_008?
Yes, that's correct.
The clerk will report the amendment.
FCD AMD.
FCD-AMD_008 amendment offered by Mr. Carter of Louisiana. Add at the end the following section, conditional effectiveness. This subtitle and the amendments made by
Without
this
objection, the
subtitle.
reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. My amendment states that 100% of any reduction in state expenditures resulting from reduced enrollment must be reinvested to provide medical assistance to individuals eligible for Medicaid, including people who need home and community-based services. That means that this money would go to children, mothers, people with disabilities, and the elderly, instead of going to tax cuts for billionaires and multinational corporations. My Republican friends say they want to help the people that Medicaid was quote-unquote intended for, and people who need it most. And to that I say, put your money where your mouth is. But we all know that they won't, because they're beholden to Mr. Musk and Mr. Trump and the tax cuts that they've promised. Because it's never been about helping people or reforming Medicaid. It's never been about curbing waste, fraud, and abuse. We're all for curbing waste, fraud, and abuse. It's always been about stripping away health care from the working poor to fill the pockets of high-paid, rich donors. It's always been about enriching billionaires or ripping away people's health care and gutting critical services like those provided through Medicaid's Home and Community-Based Services Program. The Home and Community-Based Services Program allows seniors and people with disabilities to receive services like bathing, medication management, and food preparation in the comfort of their own homes or communities. In Louisiana, over 11,400 people are eligible and are on a waiting list for Medicaid home and community-based services. Let me say that again. In Louisiana, over 11,400 people are eligible and are on a waiting list for Medicaid home and community-based services. Under this plan, that number will continue to grow as Medicaid and home and community-based services are put on the chopping block. Medicaid, and specifically the home and community-based services, play a crucial role in providing life-saving care for millions of Americans in Louisiana. It's essential that we continue to uplift this program and the impact that it has had on those who rely on it most, including my constituents, Katie and Connor Corcoran, who you met earlier today. We've joined here today to do something for the people, not to take away from the people. For Katie and Connor, Medicaid's Home and Community-Based Service Program means life for their child. It means the ability to care for him 24/7 while both parents are still working. As I shared with the committee earlier, when Connor was first diagnosed, his physicians warned his parents that his life was extremely fragile and there was a high chance that he would not survive childhood. His Medicaid coverage is the reason he's able to live and to see his high school graduation day on May 7th of this year. My amendment is about making sure that these funds go toward helping more families like Connor and Katie's. This amendment isn't just about one family. Katie's family never thought that they would need Medicaid. We're all one event away from needing the help from one another and neighbors and Medicaid to assist us to get through. I urge my colleagues to join me in preventing these attacks on the people that need health care the most. If the true goal here today is to protect Medicaid, there should be no opposition to my amendment. I urge my colleagues to vote yes on my amendment. And if they don't, I'd like to know why they feel the need to hide behind an untruth. This untruth that they're helping the most vulnerable in our communities when in reality, they're devastating them the most. We know that the pain that will come from these cuts are real. But if we are true that every dollar that's cut will go back into Medicaid to make it better, to make it stronger, to make it more efficient, to truly serve more people that need it, then this is an amendment that should fly out of here with no objection. Mr. Chairman, I yield.
The gentleman yields. I recognize myself for 5 minutes. This amendment demands any reduction in federal spending as a result of this bill would be wholly offset by a subsequent increase in federal spending. This is in face of Medicaid spending that has continued to increase unchecked for decades. Federal and state governments spent $759 billion on Medicaid last year and are projected to spend $812 billion this year. This annual figure could reach $1.1 trillion by 2035. We must take steps today to bend the cost curve for Medicaid to ensure that it remains stronger, to ensure that it remains more stable for the future generations. This bill will prevent future gaming of money laundering schemes that shift these increasing costs onto the federal government. These are important steps to be taken today. These steps need to ensure that this critical program is stronger for the future. That is why I urge my colleagues to oppose this amendment, and I yield back. Are there any further?
Okay, roll call.
Seeing none, the gentleman requests a recorded vote. The clerk, I'm sorry.
Yes, recorded. Mr. Tonko, do you want to be recognized?
Yes.
I'm sorry.
For what purpose does the gentleman seek recognition?
Mr. Chair, I move to strike the last word.
The gentleman is recognized.
Mr. Chair, members of the majority may not be interested in defending their cuts to Medicaid, but I believe their constituents still have a right to have their voices heard as part of this debate, including the people of New York's 23rd District that have relied upon and benefited from Medicaid. I can't share the name per the rules of this committee. That should tell you something. Republicans are so terrified that they will have to answer to their constituents that we can't name other members. Every single Medicaid recipient in New York's 23rd District will be impacted by the clawing back of the 10% FMAP match. Let me repeat that. Every single constituent from the 23rd District who relies on Medicaid will be impacted by this cut to Medicaid. Whether it's reduced benefits or completely losing coverage, no one will be spared. I would like to share several stories from constituents of a colleague here who can't be named from the 23rd District. Their stories deserve to be heard, and so I'm proud to share them, as I was asked to, with every member of the committee. In New York's 23rd District, 193,200 people are covered by Medicaid. The first one comes from Julie from Hamburg. I'm writing today not, and I quote her, I'm writing today not as a policy expert, but as a mother, a community worker, and someone who knows firsthand what it means to fall through the cracks. In 2023, I lost my job after becoming seriously ill. I was homeless for 3 months, struggling to survive while trying to keep life as stable as possible for my daughter. It was Medicaid that allowed me to access care and begin to heal. Without it, I wouldn't have recovered. Without it, I wouldn't be here today doing the work I love. Now I work at the St. Peter and Paul Outreach and Food Pantry in Hamburg, where I serve families every day who are facing the same impossible choices I once did between rent and medication, food and gas, groceries and a doctor visit. I still rely on Medicaid to keep myself and my daughter healthy. If I were to lose Medicaid, it would jeopardize the fragile stability I've worked so hard to rebuild. As someone living with a significant disability, my access to essential treatment, therapy, and medications would be sharply limited, or it would disappear altogether. Without care, I could easily slip back into crisis, unable to work, parent, or maintain my health. For people like me, Medicaid isn't extra help. It indeed is survival. With that, Mr. Chair, I yield back. Your turn.
The gentleman yields. Is there any further discussion? The gentlelady is recognized.
Thank you, Mr. Chairman. Mr. Chair, I move to strike the last word.
The gentlelady is recognized.
I'd like to build on the support expressed for constituents in New York's 23rd District who have benefited from Medicaid by sharing an additional story that highlights its impact. From Chemung County residents demand local leaders oppose possible social safety net cuts. I'd like to enter into the record the WSK Public Broadcasting of March 12th, 2025.
So ordered.
Thank you. Megan Osterhock spoke to the legislature as a business owner, healthcare worker, and a mother. She's an independent voter and voted for Congressman Langworthy in November, but said she now regrets that choice. I spoke with him, said Osterhout. Did I like everything he had to say? Definitely not. I don't like anything any politician has to say in whole, but his values and what he supported led me to believe that he would be a stopgap. He's definitely not a stopgap. Osterhout, a registered nurse in Chemung County, is worried about the possibility of job losses for caretakers and healthcare workers. Should Medicaid be cut along with the services that come with those jobs? In 2024, there were nearly 7,000 jobs in healthcare and social services in Chemung County, according to the Southern Tier Economic Growth. In January, Medicaid enrollment in Chemung County was 36% of the population, according to the most recent population data from the U.S. Census Bureau. Medicaid enrollment in the county in 2024, which is the most recent data available, was 25% of the population. Does my Republican colleague from New York have anything to say to one of your constituents, Megan? Well, I guess not, because he's not here. Well, we can say that cruelty is the point. Thank you, and I yield back the remainder of my time.
Gentlelady yields. The gentlewoman from New York is recognized.
I would like to speak to also reiterate the points made by my colleagues from New York, particularly around New York's 23rd district, which we know and see have over 300,000 people in the Finger Lakes who rely on Medicaid for their insurance. In fact, in a 2021 assessment, Corning found that 45,000 people in Chemung and Steuben counties have state-provided Medicaid, while just one regional dental provider accepts Medicaid coverage. Many residents travel long distances to receive care or go without care. And we know that, that the representation and what we've seen here understands that rural hospitals are at risk and that rural hospitals require protection in the face of Medicaid cuts. But we have a constituent of New York's 23rd district who has reached out and asked us to amplify this story. Her name is Laura. Laura says, quote, "I have 3 clients on Medicaid. I'm their aide. One is 85 and nearly blind. Another is 39 with brain and stomach cancer. The third is 73 and had a stroke. She can only use one arm. If Medicaid is cut, they'll lose their personal care aide, and I'll lose my job. So many poor people would be left without health care, and frankly, without it, they would die." Now, I know many of my colleagues on the other side of the aisle think that this is all hyperbole and exaggeration. But we've seen from the provisions regarding nursing home staffing that the danger is very much real. And many people have their life and their health put at risk because of insufficient nurse staffing ratios and other conditions in nursing homes that would be impacted by Medicaid funding levels. And with that, I yield back.
The gentlelady yields. Is there any further discussion? The gentleman from New Jersey is recognized for 5 minutes.
Thank you, Chairman. I want to thank my colleague from Louisiana for introducing this amendment because it really gets at what we've been discussing this entire morning, which is that if the idea is to enhance Medicaid and make it better for the people that rely on it, then this amendment would do exactly that. Any money that the state has from folks who are no longer enrolled in Medicaid would go back into the system to make the program better for people. And this is the point that Democrats have been making this entire hearing, is that we hear from our friends across the aisle that they want to improve and strengthen Medicaid. Well, any savings that either the federal government or states have should be reinvested into the program. You know, everyone that we hear from back home and all of my colleagues from New York on this side of the aisle we're speaking to, they rely on Medicaid, and any additional funds we can put into Medicaid would improve the program, make life easier for them, make healthcare more accessible, and that's exactly what as a Congress and as a committee we should be striving to do. There are 5 colleagues across the aisle who have over 200,000 people in their district who are covered by Medicaid. There is a colleague across the aisle who has over 300,000 people in their district covered by Medicaid. The more people in your district covered by Medicaid, the more I think you would want to improve the program. So we can absolutely work together, but the way to show some good faith is by supporting Mr. Individual from Louisiana, because his amendment does exactly that. So let's put the partisanship aside. Let's do what's right for all of our constituents, whether they're in red or blue districts, and make sure that we're reinvesting any savings back into the program that so many people rely on, that we all care so much for. This should be a very easy yes for everyone in this committee. I look forward to everyone supporting this amendment, especially those 5 members across the aisle who have over 200,000 constituents who are covered by Medicaid, especially for that individual across the aisle who has over 300,000 constituents covered by Medicaid. I have to believe for the 6 of them, this is an obvious yes. I look forward to their support for Mr. Carr's amendment, and I yield back.
Gentleman yields. The chair recognizes the gentlelady from Florida.
Thank you, Mr. Chairman. I oppose the amendment and want to take a moment to address some of the misinformation being promulgated about our Republican proposals to reform Medicaid. Let's be clear. The idea that Republicans are ending Medicaid coverage for those in need is a myth. That narrative is not based in fact. These reforms are about preserving Medicaid for the people who truly need it. Seniors, people with disabilities, and low-income families, making sure that this program can continue to serve them for generations to come. In my district, Florida's 15th, we have hardworking families, children, and elderly neighbors who rely on Medicaid for essential care. They're not asking for a handout. They're asking for a system that works, that is fiscally sustainable and solvent, and one that can ensure that care is available when they need it most. And that is exactly what Republican reforms aim to deliver. What we're proposing are common sense improvements, restoring work requirements for able-bodied adults without dependents, modernizing systems to prevent fraud and abuse, and ending misdirected payments to those who are deceased or who are not eligible for the program. These reforms are not about taking something away. They are about protecting the integrity of the program so that the people we represent, those who truly need this support, can count on it to be there now and in the future. Our reforms are about restoring integrity to the system and ensuring that it works for the long haul. So that's the real conversation that we should have been having all night long, one that is grounded in facts and grounded in good faith, about how to strengthen Medicaid, not some story untethered from reality used to scare people with baseless claims. The American people deserve better than fiction and scare tactics. They deserve the truth and real solutions, and that is what our Republican reforms will deliver. Thank you, Mr. Chairman. I yield back.
Gentlelady yields. The gentleman from Ohio is recognized for 5 minutes.
Thank you, Mr. Chair. This is where the argument sort of goes off the rails. If you're cutting $715 billion in Medicaid, people are going to lose coverage, including eligible people. They're going to lose coverage in part because of the red tape and the paperwork. We know that because we've seen it in other states. But they're going to lose coverage when states lose money, and then to make matters worse, you're tying the hands of states by saying don't touch the provider tax, so they don't have money to cover the gap. People will lose their health insurance, and these are people who are eligible or deserving, people who need it. The challenge on the waste, fraud, and abuse question is the GAO has put out a set of changes that CMS should pursue as it relates to waste, fraud, and abuse. And I'm wondering on the IT system, which has been a big issue for CMS, this is a question for council, where in the bill can I find language that tackles what my colleague just mentioned in terms of fixing the IT issues as it relates to waste, fraud, and abuse?
On page 88, line 17 of the AIMS, there is funding for grants to states for systems.
But that doesn't resolve the GAO's recommendation that the CMS changes be made, just money for states.
If the question is in regards to the systems that the states run for waste, fraud, and abuse.
It was to CMS.
Then that funding is in regards to states.
Right, so it's not there. My challenge is that there are several GAO recommendations around waste, fraud, and abuse, most of which, or none of which, is in this bill. I mean, the big changes in this bill have to do with paperwork and red tape around questions of whether or not people are working. Of course, they're working or they can't work. And we know from other states where they've done this, people just give up or they lose their health care, even though they're eligible. The cuts to states, and then the provider not allowing states to change the provider tax. The last one, and I'll stop. The requiring of a new fee. I guess this is a question for my colleague, because you mentioned waste, fraud, and abuse and modernizing the system. I'm still so unclear on the fee for low-income families. I don't know, my colleague, I can't address her by name. Maybe I'll address the chair. Because the person sitting in the chair when I asked last didn't have an answer. I don't understand why the fee. And I know that people watching who now on Medicaid are going to have to pay an extra fee for all kinds of services they get. Why is there a fee for low-income people that goes to pay for tax cuts? That's not modernizing the system. That's not money going back into the system. That's not waste, fraud, and abuse. What is the purpose of that new fee?
Could you please clarify specifically which fees you're addressing?
Yeah, the fees that y'all are adding for folks on Medicaid, $16,000 a year, $18,000 a year, low-income families that now have to pay an additional fee for any number of...
Is the gentleman referring to the $35 copay?
Yeah, anytime, every time. I mean, I just don't, like, that's not money going back into the system. I don't understand that one. And I suspect people who are about to be charged more money every time they interact with the healthcare system, for what? What's the point?
Your time has expired. The gentleman from New York is recognized.
No answer.
I got it. Thank you very much, Mr. Chairman.
Oh, never mind.
You know, we've heard an awful lot of noise here in this chamber today, yesterday. But ultimately, it seems like my colleagues on the other side of the aisle are looking to die on two hills, which aren't extreme proposals. These are basic principles. If you're able-bodied and you have no dependents and you're receiving taxpayer-funded Medicaid, you should be expected to work, look for work, or enroll in job training. And if you're in this country illegally, you should not be receiving a single dollar of Medicaid benefits. Period. Hard stop. These are not radical ideas. They're common sense, and they're proven. In fact, back in the 1990s, Democrat President Bill Clinton, he worked with Congress to reform welfare by requiring work from able-bodied adults. It was wildly successful. Employment went up, dependency went down, and Americans believed in the system again. Now Democrats pretend that those same ideas that were so successful in that era are heartless. But we have to stop looking at work as punishment. It's an empowerment. A job brings dignity, it brings pride, self-reliance. If you can work, if you are able-bodied and you don't have dependents in your home, you should. And taxpayers shouldn't be subsidizing those who simply choose not to contribute. And let's address what we saw in this hearing room. Democrats have staged a grand performance, bringing in disabled individuals as props to push a false narrative. Their staff had them convinced that we were cutting traditional Medicaid, the statutory population, and they were wrong. It was exploitive, and it was dishonest, and it's been dishonest. Let's be clear, not one disabled person is at risk of losing Medicaid under this legislation, not one. This has been 6 months of fear-mongering. Democratic members of Congress, governors, U.S. senators telling groups of seniors and vulnerable Americans that they're in danger. They're not. This isn't about cutting care, it's about restoring credibility to this system. We are protecting Medicaid for those that it was intended to serve, not for able-bodied adults that refuse to get into the workforce, and certainly not for illegal immigrants who have no legal right to these benefits. Because yes, illegal immigrants are burdening the system. They do that very much so in our state of New York. And every dollar spent on someone here unlawfully is a dollar denied to a law-abiding citizen in need. That's not compassion, it's theft from working families. If we do nothing, Medicaid will collapse under its own weight. That's not speculation, it's basic math. We will not apologize for expecting work in exchange for benefits. President Clinton didn't, and neither should we. We will not ignore fraud or allow public benefits to go to those who broke the law to be here. And we will not be lectured by those who use fear and stagecraft to defend a broken and unsustainable system. This is about fundamental fairness, sustainability, and integrity. Let's act accordingly. Thank you.
Will the gentleman yield?
I yield back to the chairman.
Will the gentleman yield?
I yield back to the chairman.
Oh, come on. I'm one of your guys.
I
Put your glasses on.
I couldn't see him, Morgan.
I understand.
Sure.
Will the gentleman yield?
I'd be happy to yield for a minute.
All right. I appreciate it. All right. Let me answer the gentleman from Ohio's question. The bill allows for a copay. In fact, it mandates that there be a copay for those people on Medicaid expansion only who have 100 to 133% of the poverty level. The state sets the amount somewhere between $1 with a maximum of $35. So my colleagues on the other side keep saying it's $35. It could be, depending on the state. That money, as I understand it, goes to the state to help offset their costs in the Medicaid expansion program if they choose to do that. This is not the only federal program that has a copay, and let me explain the theory behind it. And you can disagree with it, but here's the general thought. When you get to that level, you are eligible for the Medicaid expansion in the expansion states, but you're also eligible to get an Obamacare plan. But all Obamacare plans have copays. So if the state wants to encourage people as they get closer to the line to start looking at Obamacare plans, this makes it more like an Obamacare plan. Now that's up to the state. They can charge the nominal amount. In fact, some would argue it could even be less than $1 as long as it's over zero, but let's go with $1. And it just says that if you're in that area where you're getting close to the line, and a pay raise at work probably puts you over the line, this is going to make it a little bit more like Obamacare. And so that's the reasoning, Mr. Chairman, that this is there, and it is a state option between $1 and $35. 35 is the cap. Does the gentleman from New York yield back?
I do yield back.
The gentleman yields. The gentlelady from Virginia is recognized.
Thank you, Mr. Chair. You know, people with disabilities were told under the first Trump administration, we're going to let the states put work requirements in place and individuals with disabilities aren't going to lose their health insurance. And that turned out not to be true. The only examples we have of states that imposed Medicaid work requirements ended up kicking people with disabilities off of Medicaid. And my colleagues on the other side of the aisle have admitted Georgia screwed it up. Arkansas screwed it up, but we don't have an example of a state that imposed a work requirement that didn't impact individuals with disabilities. So they've seen this script before. That's why they're skeptical. We keep hearing this bill is to make sure that Medicaid stays sustainable. But if that were the case, we would adopt the amendment from the gentleman from Louisiana, because any savings should be invested in actually ensuring that the costs that are increasing under Medicaid the most are addressed. And that is the cost of long-term care, seniors, individuals with disabilities, because they have much more complex needs. This bill does not invest in long-term care facilities. This bill does not invest in long-term care facility workforce. This bill does not invest in driving down the cost of prescription drugs in a meaningful way. This bill does not do anything to ensure that any of the savings that the states or the federal government sees gets reinvested in the program. And this bill is happening in a larger context where NIH research that helps fund R&D for new treatments and new drugs is being cut, making it that much more difficult for them to do that unless companies invest their own work funds in, which then they're going to want to recover their R&D costs. This bill is happening in the larger context of other cuts that the states are going to have to backfill. And all of that is being ignored in this bill. And all of that is being ignored in the talking points of my colleagues that says, we are going to save Medicaid by addressing undocumented immigrants getting care, a very small percentage of able-bodied people who are not working. There's not enough money there to make Medicaid long-term sustainable if we're not addressing the underlying increased cost of care for seniors, individuals with disabilities. As the population continues to age, as the population continues to have these complex medical conditions, as you continue to have people living in areas where they get pollution, this bill cuts funding to address that. So you will forgive us for being skeptical when the context of what we're doing this bill on is to fund tax cuts. That's what the resolution that congressional Republicans passed, I don't know, a month or two ago said. Find $880 billion in cuts to fund tax cuts. Not to make investments in Medicaid, not to make investments in our public safety infrastructure, not to make investments in cybersecurity, not to make investments in addressing AI needs, not to make investments in environmental sustainability, energy sustainability, or anything else, but to fund tax cuts. So forgive our skepticism that this bill is actually going to do anything to long-term, make Medicaid more long-term sustainable, when what it's really going to do is cause 13.7 million people to lose health insurance between what this bill is doing and the failure to extend the tax cuts. 13.7 people will lose health insurance. That will cause costs to go up for everybody else. And this bill is doing nothing to address that either. I yield back.
Gentlelady yields. The gentleman from Massachusetts is recognized.
Thank you, Chairman. The gentleman from New York made a couple of claims, one about work requirements and the other about individuals with disabilities that I wanted to respond to. First on work requirements. So I'll just put forward as a premise, I think the best social program is a job. I absolutely agree in the dignity of a job and of work, and I think you would find on this side of the aisle a lot of agreement with that premise, and actually the last 3 Democratic presidents under their tenure have created a lot more jobs than the 3 contemporaneous Republican presidents. So Democrats like work, and Democrats, when we're in charge, see more jobs get created. The challenge that you have is the work requirements that you're talking about are not work requirements, they're paperwork requirements. And if you don't believe me, you should believe Luke Seaborn. And I'm reading this from ProPublica. Luke Seaborn was a 54-year-old from rural Jefferson in Georgia, became the de facto face of Georgia Pathways to Coverage, which was the governor's insurance program for impoverished Georgians. Luke Seaborn was a mechanic, earned a minimal salary, and he said, quote, "I used to think of Pathways as a blessing. Now, quote, I'm done with it," because his benefits were canceled twice due to bureaucratic red tape. So here's my question for the gentleman from New York. Someone like Mr. Seaborn, who gets canceled from Medicaid because of the paperwork requirements, not his own fault, he's working. Then he can't join the ACA exchanges. So when he gets sick, what's he supposed to do? I'll yield my time to the gentleman from New York. Does he go to the emergency room? Because that costs a lot more money.
You live in as blue a state as I do. You don't trust that your state can manage this program. We have an IRS that literally can track a $600 Venmo transaction, but you don't think that we can track a work requirement. You have that little faith in our government to handle this task at hand?
Just ask Mr. Seaborn.
I mean,
he's living in the
come with
state
story
that did
after
it.
sob story after sob story on how it fails. But you don't come with any solutions as to how do we lift people out of dependency on government, cradle to grave. I mean, you all love Obamacare the most, but it broke Medicaid.
Reclaiming my time, I literally didn't hear an answer from Mr. Seaborn, who does not have access to Medicaid, does not have access to the Affordable Care Act. He gets sick. What is he supposed to do? He goes, I'll tell you what he's going to do. I'll answer the question myself. He goes to the emergency room. It costs somewhere between 8 to 10 times more money. And you know who pays for that? People who get insurance through their employer. Everybody in the middle class is going to see a price hike because of these paperwork requirements. I want to move now to the other point that the gentleman from New York made, which was about individuals with disabilities. Apparently, we're fear-mongering on this side of the aisle, but here's the thing. Most of the optional spending that states have under Medicaid goes for home and community-based services, for individuals with disabilities, at-home care, dignity-providing care for the elderly, for people with profound autism, for people who need help with the activities of daily living. When we crush these states by taking $780 billion out of their health care coverage, they are going to have to pull back on home and community-based services. That is going to affect families taking care of individuals with disabilities. And the disability community knows that. They have seen this before. They saw this over the last 15 years. That every time Republicans try to take health care away, it's the individuals with disabilities and it's the elderly who end up paying first for it. So my question for you, for this gentleman from New York is, can you guarantee that no one with a disability or who is elderly is going to lose access to home and community-based services because of this bill?
No one is going to lose their coverage because a state...
I didn't ask about coverage. Home and community-based care. Will they lose access to at-home care? Dignity-providing care?
We have absolutely protected the traditional population of whom Medicaid was designed in statute to protect.
Yeah, individuals with disabilities and the elderly who get at-home care right now.
And every dollar that goes for any of these other categories goes away from that population, and you know it.
So, but are you saying that you're guaranteeing that home and community-based services will not be cut? I'll actually direct this to the chairman of the committee. Does the chairman of the committee want to put forward that home and community-based services, long-term services and supports for the elderly or for those with
We have absolutely protected traditional Medicaid. States make those decisions, what they do. We are leaving states with the money. We're leaving them with the hold harmless.
Mr. Chairman, you're leaving states with an
I trust my
impossible
state
trade-off.
is going to do that. I trust that the Commonwealth of Kentucky is going to continue its process. I put a letter in the record what our hospital said, because they know the truth of this bill, and you can say it all you want, but it's just not accurate what you're saying.
It's not accurate that home and community-based services are going to get pulled back? That's
The time has
that's state
expired.
funding.
You're saying that your states are going to do that. I'd say my state's not going to do that.
We shall see.
The gentleman's time has expired. Is there any further discussion? Seeing none, the vote occurs, hold on. The gentlelady from New York is recognized.
I think even when indulging the logic of kicking, shifting, transferring, moving people off of Medicaid, whatever word we want to use, what is the logic once you take someone off of Medicaid? What's the logic behind preventing them from purchasing an ACA plan at their income level? Okay, you know, all right, you've determined that someone's not eligible, you don't want them to be on, so you kick them off of Medicaid, and now they can't even buy it on their own on the ACA schedule. I mean, at this point, then what you're doing is you're taking someone who's like, say, a single mom, kicking them off of Medicaid if you determine that there's an ineligibility there, and then she has to somehow pay full freight and not be able to take ACA subsidies on that? I mean, you're leaving people on the street. That's what this is, putting people on the street. Single mom, you know, I bought, I had to buy my healthcare off the exchange when I was a waitress. Cost hundreds of dollars a month. Could barely afford it. That was with the subsidy. Trying to pay that thing full freight, you're making people uninsured. I just don't understand the logic of, if you're going to say someone should be self-sufficient and you kick them off of Medicaid, why then prevent them from buying in on their own 2 feet? Or can any of my Republican colleagues kind of illuminate the logic behind that?
Gentlelady yield. So a single mom with a dependent is exempted in our bill.
But say you have someone, you know, let's say she's in that income bracket. Let's say she's not exempt, right? Or let's say you have an individual, even if she's not a single mom, an individual who's not exempt. But you kick them off of Medicaid and you prevent them from buying into the ACA plan that's affordable at their income level.
Kind of think of I'm sorry, generally, your example. So again, if they're not eligible for Medicaid, where would they go?
So to my understanding, if someone is kicked off the Medicaid rolls.
Because they're make too much money? I mean, why would they? Because a single mom would be on Medicaid.
Let's say a single woman. Let's say a single woman.
Single woman that's working, that's eligible
Say
to
she's
work.
working, let's say she's deemed, she's one of these individuals that one of the 7.6 million people that are deemed ineligible for Medicaid. They would be also ineligible to buy into the ACA, correct?
Well, so you got the 7.6, either they're ineligible for Medicaid. If they're eligible for Medicaid, there would only be the work requirement. So if they work, they wouldn't lose Medicaid. And then the other one would be if they were not a legal presence here. So they would still be eligible to buy into ACA. I know another committee's working on that program. I can't answer that
But
question
it wouldn't be at the subsidized rate. It would have to be full freight.
Depends on what, I mean, I know another committee's working on that jurisdiction. I can't answer that question for you, but unless somebody here could. But I know that the scenario you first rose, they shouldn't lose their Medicaid under this bill.
And say for a work requirement, the retrospective on looking backwards on this, I've heard different things between states could look back several months, and if a person has a spotty employment record on that month, it seems like as though it would be unclear what the standard would be on whether they meet the work requirement or not. Is that?
I'm not
Is there
familiar with that.
additional
I'll get back with you on that, I have to say, but I don't think so, because the idea is if they're engaged, they don't even have to be working. They could be education. We want people to move up. That's what we want. I know we all do. So engage in, if they can't find work, volunteer. Like there was some question about, what about, now we go up to
So
64?
say, for example, like many of the instances that we've seen, this creates a lot of a bureaucratic burden. Someone's letter gets sent and their address isn't on the thing. They're not able to fill it in on time. They get bumped off of Medicaid. If someone is bumped off for whatever reason, it seems as though they are prevented from being able to buy into the ACA at the subsidized rate for their income level.
I don't know anyone that'd be prevented from buying. I don't know the answer about the ACA. That's, unless you're talking about the premium tax credits, which I don't know the answer to that.
Would you like me to yield to you?
I would, thank you. If the gentlelady would yield, there's only a few. So if, Mr. Chairman, if you don't think anybody would be bumped off, then why would you have that provision in the bill?
The time has expired.
Mr. Chairman. Oh, I got somebody else over there.
The gentleman from New Jersey is recognized.
I just wanted to say to Ms. Ocasio-Cortez, there's a very simple reason why, there's a very simple reason for this, to my colleague from New York, and I'm not supposed to mention names. And it's because the CBO assumed exactly what you said, that if I'm kicked off Medicaid because I didn't file the paperwork, you know, which is, of course, what CBO says is the main reason why people are going to be kicked off, not because they're not eligible, but because they didn't meet, they forgot to, you know, they didn't get through the red tape. They missed it. They went back and saw that they worked, you know, 3 years ago, even if they're working now. All the different reasons that are being, they weren't able to meet the exceptions, you know, that they were pregnant, or some of the other things are exceptions because they couldn't figure out how to justify that or provide the paperwork for that, whatever it is. Then they would, the CBO assumed that they would naturally then go to the ACA marketplace, the exchange, and buy a subsidized policy, and therefore there'd be no savings. So in other words, if the savings is for Medicaid is 300, I'm just making it up, 300 billion, because of all these people who are kicked off because of red tape, the CBO assumed those people would move to the marketplace, they would get health coverage through the subsidy, and therefore there'd be no savings because the government would still have to pay for their health insurance through the ACA. So strictly because of that. There's no other reason. It makes no sense. That's the reason. And it's sad because essentially, because they want to meet the, you know, this draconian cut of 880, or now it's almost $1 trillion, they have to say to those people, you can't go to the marketplace. And I would yield to the gentlewoman.
And so, Mr. Ranking Member, if I'm understanding what you're saying correctly, we're talking about 13.7 million Americans who will lose their health insurance due to this bill, as well as some of the lack of expansions in the ACA.
Sure.
Those 13.7 million people, once they're kicked off their insurance, naturally would turn to the ACA marketplace to say, maybe I can buy insurance off the exchange. Except then those people will not have the income support, the income subsidy, to be able to buy ACA insurance the way other people would in that marketplace, correct?
Right, and if I could reclaim my time, essentially, CBO assumes that if you get kicked off Medicaid for all these red tape things, I mean, the list is endless, you would then go to the marketplace, you'd be eligible for the maximum subsidy because your income is so low, and it's going to cost the government as much money for that as it would if you're on Medicaid, or approximately, and therefore there's no savings. There's the 300 or whatever savings that they get from kicking off the people doesn't exist anymore. There's nothing else. I mean, they may not admit that, but that's the reality. Are you back?
The gentleman from Virginia is recognized.
Thank you very much. Well, I appreciate the ranking member's explanation because that makes a lot of sense. This is CBO math. And I've always had a hard time with CBO math, but so what they're saying is that they're making the assumption that while they wouldn't go to the ACA plans, but not that they could not, which has been the argument all night, at least if I understand that. And so sometimes the CBO makes these conclusions, but the point is not whether we have the savings or not in this particular argument. The point is the people would have an option to go to the ACA plans, if I understand it correctly.
Gentlemen yield.
And, well, I need
That's
to
not
yield.
what I said.
I thought that's what you said.
No, the way you've done this bill.
I will yield briefly. I need to also get to my chairman. Go ahead.
I just wanted to say, I'll be quick. The bill says that you can go to the marketplace and pay the full freight, but you can't get the subsidy. So those people can afford, most of them probably, to buy the insurance policy with the subsidy, but they can't afford the full freight.
And to explain that, if I might, I'm going to yield now to the chairman of the full committee.
I think to clarify this, I'd like to ask the council, if the council would clarify the question. Now that I understand the question that was trying to be asked, I didn't follow, I'm sorry, but the council, would you explain?
Yes, thank you for the question. The provision in question pertains to subparagraph B on page 80, which clarifies that section 5000A F1A2 of the Internal Revenue Code only makes eligible advanced premium tax credits for people who are not otherwise eligible for other minimum essential coverage.
But so they are eligible for Medicaid, right? That's so they can't, if they're eligible for Medicaid, but they don't receive benefits because they're not working, are they eligible to go into with the premium tax credits? No.
If an individual is satisfying the community engagement requirements, they would maintain eligibility for Medicaid. If they are not meeting the community engagement requirements, they would be considered eligible for Medicaid and could be re-enrolled in Medicaid as soon as they satisfy the requirements.
But they wouldn't be eligible to go into the Affordable Care Act tax credit because they have other coverage in Medicaid?
They would be considered eligible for Medicaid and thus would be precluded from that definition of minimum essential coverage.
So the purpose of that would be if you're in Medicaid and you're eligible, but you're not meeting the work requirement because you met all the exemptions and you're choosing not to work, then you couldn't go take a subsidized plan somewhere else and not work. Because if you were working, you wouldn't need the subsidized plan because you can't not work and then lose your Medicaid and not work and go to the premium tax credits, right?
Yes, if an individual began to meet the community engagement requirements, they would be re-enrolled in Medicaid.
So what if you're deemed ineligible for other reasons? So it's not a work requirement, you're just deemed ineligible for Medicaid, you don't qualify for Medicaid. Does that prevent you from going to the marketplace?
This provision would not apply in that instance.
So only if you make yourself ineligible does this apply?
Correct.
Wait a minute. Can I?
So if I might restate that, claiming my time back from the chairman, if I might restate that, only if you're able-bodied, eligible for Medicaid expansion, only if you're able-bodied and refuse to do even community service.
That's absurd.
Would you be caught in that conundrum where because you're eligible for Medicaid but refuse to do anything besides sit on the couch, then you wouldn't be eligible for the tax subsidy. You could still get it, but it would cost you a lot of money. Somebody in your family would probably have to pick it up. But if you were ineligible for any other reason, you could still get the tax subsidy for an Affordable Care Act, Obamacare insurance plan, correct?
That's what the provision says.
I appreciate that. I yield to the gentleman from New Jersey.
What did you say?
I yielded.
Oh, you're yielding to me? I don't know what the council's saying. Look, the problem is the chairman is saying that you're kicked off because you refused to work. Of course, what our argument on the Democratic side is you were kicked off because you didn't meet the red tape requirements, not because of work, but because you missed the deadline, you couldn't file, because you were pregnant, whatever. The bottom line is that if you can't meet those red tape requirements, work requirements, exemptions, whatever for pregnancy, whatever, you cannot get the subsidy on the ACA, correct?
Yes, if an individual does not meet the requirements, then they would not meet the definition.
Okay, thank you.
Gentleman's time has
I
expired.
yield back.
Is there any further discussion? Seeing none, there is a roll call vote requested. The clerk will record the call. The clerk will call the roll.
Mr. Lotta? Mr. Lotta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Crenshaw votes no. Mr. Joyce?
No.
Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Ruley votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Ms. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. Deget? Ms. Deget votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Ms. Castor? Aye. Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Veazey? Mr. Veazey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Bedegun? Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Trahan? Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen votes aye. Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no. Mr. Allen is not recorded. Mr. Allen votes no. Ms. Schreier is not recorded. Ms. Schreier votes aye. Ms. Kamick is not recorded. Ms. Kamick votes no. Ms. Bedegun is not recorded. Ms. Bedegun votes aye. Ms. Trahan is not recorded. Ms. Trahan votes aye. Ms. Matsui is recorded as aye. Mr. Chairman, on that vote, there were 24 ayes and 30 noes.
Are there any further amendments?
I do, Mr. Chairman. I have an amendment at the desk under the file Health FCD AMD 203.
The clerk will report the amendment.
Health-FCD-AMD_203, amendment offered by Mr. Ruiz. Add to the end the following section, assessment of effects of coverage losses.
Without
losses on
objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. This amendment would require states to produce an assessment of the effects of the coverage losses from this Medicaid title on rates of uncompensated care as defined in Section 1923 and emergency department wait times for each hospital that receives a disproportionate share hospital payment. As an emergency medicine physician, I have seen firsthand the long wait times patients endure when they present in the emergency department. Sometimes they can wait up to 6 or 8, sometimes 10 hours just to see the physician. Cuts to Medicaid, and make no mistake, that's what these Republican policies are, no matter how you disguise them, will only make these wait times worse and make it more challenging to access care for everyone, not just for Medicaid beneficiaries. The Congressional Budget Office examined several policies in this book, and they found that millions would lose their health coverage. At least 13.7 million more individuals would be without health insurance. Now that's a problem because guess what? People still need medical care regardless of whether they have insurance. If they lose their insurance, they are less likely to be able to afford to go to the doctor and will end up presenting in the emergency department. That means longer wait times for everyone, not just Medicaid patients. Patients may be unable to pay, but the hospital will treat them anyway due to our EMTALA law. That means hospitals will take on even more uncompensated care. California hospitals currently provide an average of $5.1 million in uncompensated care per hospital per year, according to the California Hospital Association. Rural and critical access hospitals especially would be forced to cut back on services like pediatrics or labor and delivery, or close their doors altogether. When a hospital closes, it closes for everyone, including kids on Medicaid, including women who need pregnancy care. So Medicaid cuts will have consequences for everyone. And during this markup and in discourse over the past several months, I've been hearing my Republican colleagues claim over and over that their proposed cuts to Medicaid won't cut benefits or strip health care away from vulnerable individuals. That by cutting funding for this vital health insurance program, they are quote unquote strengthening it. That they won't have devastating impacts on communities and our nation's healthcare system. All this despite common sense and concrete evidence to the contrary. Now, if my colleagues are not, in fact, being honest to the American people just to be able to give tax cuts to the uber wealthy, then they should vote for this amendment to prove it. If you firmly believe that slashing funding for a health insurance program and stripping coverage from millions of Americans will strengthen healthcare in America and will not have devastating impacts on healthcare infrastructure and hospitals, then you have nothing to lose by supporting a study that would, in theory, prove your point. But I have a feeling you suspect that the results of this study would be pretty damning. Otherwise, you would be jumping at this opportunity to prove your claims. So I urge my colleagues to do their due diligence and put their constituents' best interests at the forefront by authorizing this study to investigate the impacts that their proposed Medicaid cuts would have on the hospitals their communities rely on. Thank you, and I yield back the remainder of my time.
Gentleman yields back, and I will recognize myself. And we've already noted that coverage losses associated with this legislation are due to people who are not eligible for the program that are enrolled, able-bodied adults, and truly able-bodied adults. I could read through the qualifications again if you would like, but I think we've put that into the record, who are choosing not to work, and individuals who are not legally in this country. And by reducing burdens on the states, as the Biden administration sweeping eligibility enrollment, so as people who are not eligible to be on Medicaid, the states aren't having to pay the share for ineligible people, so the states will have money, make savings, and Medicaid has payments that help make providers whole for the cost of uncompensated care. such as disproportionate share hospital payments. And I will point out that this bill delays the DSH cuts for 4 years. And urge my colleagues to oppose this amendment and vote for the underlying bill. And I will yield back. And the gentlelady from New York, Ms. Clark, is recognized for 5 minutes to support of the amendment, or speak on the amendment, I'm sorry.
Thank you, Chairman, and I indeed do support this amendment as presented by my colleague, Mr. Ruiz. As the chair of the Congressional Black Caucus, I would be remiss if I did not point out that these cruel cuts to Medicaid will leave millions of Black Americans across the nation without a lifeline. The NAACP published a report. Medicaid cuts would rip away health coverage for millions of Americans, disproportionately harming people of color. Mr. Chair, I'd like to enter this report into the record.
Without objections, ordered.
Currently, there are 13.3 million African Americans who use Medicaid for health care. Historically, Black communities have faced injustices within healthcare systems, and they will absolutely feel the impacts of these cuts by experiencing skyrocketing medical expenses without Medicaid. Black communities will have lifelong health effects without proper access to health care, and the uninsured will experience severe damage to their health without receiving the essential care that Medicaid provides. The biggest driver of racial coverage gap are the states that have not expended Medicaid under the Affordable Care Act. Approximately over 1/3 of the U.S. Black population currently lives in 10 states that haven't expanded Medicaid. The majority of those states are within red states, such as Alabama, Florida, Texas, South Carolina, Tennessee, and, you got it, Georgia. And Black communities in these states and around the country will be even more disproportionately impacted by these cuts. Approximately 35% of Black people are more likely to enroll into Medicaid regardless of Medicaid expansion status. And without a doubt, this will cut off a lifeline to Black children, women, the elderly, disabled individuals, veterans, etc., from receiving proper health care in an already unfair and unjust system. Time and time again, Republicans have demonstrated their relentless obsession to cut billions from safety net programs that are essential to underserved communities, furthering racial disparities in coverage. This is an outright assault on Black health. As chair of the Congressional Black Caucus, I will continue to lead the fight to keep our communities safe from MAGA extremists. Why? Why are Republicans intentionally targeting and inflicting harm to our communities? Well, it's because cruelty is the point. Thank you, and I yield back.
Gentlelady yields back. Is there any further discussion on the amendment? Seeing none. If there's no further discussion, the vote occurs on the amendment. A roll call vote has been requested, and the clerk will call the roll.
Mr. Latta? Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Ruley votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Veazey. Mr. Veazey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Badagan. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
Who is not recorded? Mr. Allen?
Mr. Allen is not recorded. Mr. Allen votes no.
Anyone on the other side? Ms. Kamick?
Ms. Kamick is not recorded.
Mr.
Ms.
Crenshaw?
Kamick votes no. Mr. Crenshaw is not recorded. Mr. Crenshaw votes no.
The clerk or anyone on the Democrat, the clerk will report.
Mr. Chairman, on that vote, there were 23 ayes and 29 noes.
The amendment is not agreed to. Are there any further amendments? Mr. Peters?
Mr. Chairman, I have
From
a
California
at
is
the desk.
recognized.
It is Health FCD AMD 039.
Health-FCD-AMD _039, amendment offered by Mr. Peters, strike section 44141.
Could you read the amendment again?
Health-FCD-AMD _039, amendment offered by Mr. Peters.
Okay, your report, clerk will report. You just reported. You haven't reported it. You've read the title, but you haven't reported. Just report the amendment.
That's the amendment.
To clarify, Health-FCD-AMD _039.
Okay, without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. This amendment has to do with the work requirements. We've discussed that extensively through the night. So what I say will come as a summary of what we discussed. But we should remember what's at stake today. Medicaid covers more than 72 million Americans. That includes nearly 40 million children, 7 million seniors, and 15 million people with disabilities. In my district alone, Medicaid, or Medi-Cal as we call it in California, covers nearly 1 in 5 people, and across the San Diego region, that number's almost 1 in 3. Medicaid helps working families who don't get health insurance through their jobs, and helps struggling rural hospitals stay afloat. Medicaid provides treatment for opioid addiction and mental health services for those who need them the most. And let's not forget, Medicaid is also the largest provider of long-term care in this country. If you have a loved one who relies on home care, if you have a grandma in a nursing home, Medicaid is there to make sure she gets the care she needs. So when Republicans propose slashing Medicaid, what does that really mean? It means seniors will be kicked out of nursing homes. It means people with disabilities will lose their independence. It means kids will miss critical doctor's visits. And we know this because we've seen it before, and we've discussed it. We look at Arkansas. When the state piloted its Medicaid work requirement, over 18,000 people lost coverage, not because they refused to work, but because they struggled to report
their hours in a newly created online-only portal. The vast majority of these people had jobs. Many more were caring for disabled relatives, recovering from illness, or navigating mental health challenges. The problem is, the work requirement didn't account for all that. Local doctors and clinics felt the strain almost immediately. Physicians reported longer waits. Patients missed their follow-up appointments. Emergency rooms saw increases in uncompensated care. And it wasn't just those subject to the mandate who suffered. Everyone in the system felt the impact, including the elderly, pregnant women, children, and people with disabilities. Similar results followed when Georgia experimented with its own mandate, and the evidence is consistent. Republican policies will increase red tape and cut health care coverage for everyone, but they do not increase employment for so-called able-bodied people. Medicaid is the difference between children getting a medication they need or not. It's the difference between a working mother affording prenatal care or risking her pregnancy. It's the difference between a senior being able to stay in their home or being forced into a nursing facility. And we all believe and understand that work is valuable. It provides stability, dignity, and a path toward opportunity. I also believe deeply that every American who can work should be encouraged and supported in doing so. Time and time again, when states have made these cuts, we have not seen increases in employment. What we have seen, we've seen people lose their health coverage, more red tape for doctors, and worse health outcomes. We heard a lot of arguments today that there are exemptions for the elderly or people with disabilities, and the problem is, in practice, these exemptions are often poorly implemented and difficult to navigate, as is the bill before us. People who should qualify still lose coverage. My constituents, veterans with post-traumatic stress injury, new mothers recovering from childbirth, or people managing chronic conditions often can't make it through the reporting process in time. My colleagues will and have pointed to the bill text and say people with disabilities are clearly exempted, but tragically it takes people who are disabled almost 8 months to receive a formal determination from the Social Security Administration. So this bill would kick disabled people who have health care off their coverage today. And that's because many of them are covered by the Affordable Care Act's Medicaid expansion, which the legislation before us would gut. And even for those who do work, often in low-wage, unstable jobs, these mandates create a penalty for workers. A missed shift, a lost job, or a technical error can trigger a cascade that ends in lost coverage. That's not promoting work, it's punishing job loss. When people lose Medicaid, they don't stop getting sick, they just stop getting preventative care. They end up in the emergency room, often sicker and often at greater cost to their family and to the taxpayers. The evidence is overwhelming, and it's from experience. These policies will drastically cut Medicaid funding and take health care away from more than 13 million Americans. The short-term spending cuts we may see on our balance sheet will be outweighed by downstream costs in both dollars and American lives. We can do better than this. I encourage my colleagues to vote yes on my amendment, and I yield back.
Thank you. The gentleman yields back, and I'll recognize myself. And so, again, we've heard a couple of times about Georgia and Arkansas. We are aware of the situations they had. They did not do that intentionally. We have been crafted this bill carefully to avoid the issues that they have. We absolutely don't want people who qualify for Medicaid to not receive Medicaid because of red tape, particularly when they're trying to work and be gainfully employed. If you think about what Medicaid is that people go to work every day, pay their taxes, the hardworking taxpayers pay Medicaid, to provide health insurance for the most vulnerable. And in the expansion populations, we say we're going to provide, our taxpayers are going to provide health insurance for people, if you're a pregnant woman, if you're parents with young children, if you're blind and disabled, if you're low-income seniors, if you're patients with mental health or substance use disorders and other defined issues that people have. And what we're saying, if you're not in any of those categories, if you're a able-bodied working person, then if I'm going to go to work, if an American hardworking taxpayer is going to go to work and pay their taxes, then you should do the same. And what we're requiring is, think about this, we're the able-bodied, as we just defined it, 80 hours a month of work or training program, or actively searching for work, for community service, for part-time education or school, or any combination of the above to satisfy the work requirement. And I just think if for our hardworking taxpayers, that's just fair. And maybe it's a philosophical difference, but we just think it's fair. And I strongly support the bill, and I encourage to vote against the amendment. And I will yield back. Lady from Colorado, what purpose do you seek recognition?
Move to strike the last word.
Then the lady's recognized.
Well, Mr. Chairman, I'm so glad that you're hoping that nobody will be thrown off of Medicaid because of the red tape that's involved with this work requirement. But for the last number of hours, you've heard example after example of people who were thrown off because of this. And also, your counsel has refused, well, hasn't refused. The fact is the bill doesn't delineate how you're going to decide, is somebody pregnant? Did somebody have a miscarriage? How do we tell if somebody has a mental health issue? There's all of these gaps in the bill. And so I do believe you, Mr. Chairman, that you don't think that qualified people should be thrown off, but the only experience we have is the experience of Georgia and Arkansas, and you don't want it to be like that, but to be honest, your bill is so vague that millions of people will be thrown off because they can't meet these vague requirements and the paperwork requirements. And so that's why this amendment is so important, and that's why I want to thank my colleague from California for offering it. And I just, these are real people, and these are real people who need health care, and they're going to lose their insurance. 8.6 million of them are going to lose their insurance from this, and the other 5 million are going to lose their insurance from the Medicaid or from the ACA expansion, and that's the way it is. And you can describe it and sugarcoat it any way you can, but that's what's going to happen to Americans, and I yield back.
Gentlelady yields back. Is anyone seeking purpose for speaking on the amendment? Gentlelady from California, Ms. Matsui, is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Republicans claim that people with disabilities won't be harmed by the red tape requirements in this bill because they're supposedly protected by their disability status. But let's be clear. 2/3 of adults with disabilities on Medicaid are not eligible under the primary disability pathway. And it's nearly impossible for states to identify people with disabilities in the Medicaid expansion group. That includes many people with mental health conditions. For example, Patricia. Patricia is 51 and has multiple mental health diagnoses that left her unable to work. Thanks to Medicaid, she was able to see a psychologist and be prescribed medication to manage her conditions. But once she'd been stabilized, she was healthy again to find work. But if the Republicans' bill was already law, Patricia might have waited up to 9 months on average to get an official disability determination. She might have been overwhelmed by the mountains of paperwork and regular eligibility checks required to keep her coverage. Without Medicaid, she wouldn't have been able to go back to work, threatening yet another source of health care coverage. And we can't forget, DOGE is also slashing staff at Social Security Administration offices, which means people with disabilities will have to wait even longer for their paperwork to be approved. This bill is setting traps for people with disabilities to lose their coverage, and that would be devastating for patients like Patricia. I yield back.
Gentlelady yields back. Is there further discussion? Gentlelady from Florida, is Ms. Castor is recognized for 5 minutes to speak on the amendment.
Thank you very much, Mr. Chairman, and I want to thank my colleague from California for offering this amendment. And I hear what you're saying, Mr. Chairman, but the weight of the evidence, I've been looking through all of the expert groups that I respect very much on what they say about this. I was very focused on the American Cancer Society Cancer Action Network. They say the magnitude of cuts being considered cannot be implemented without drastically limiting or in many cases severing access to Medicaid coverage for millions of people across the country, including cancer patients and survivors. But they get right to work requirements. They say the vast majority of those with Medicaid who can work already do so. Nationally, 92% of individuals with Medicaid coverage under 65 who do not receive Social Security disability benefits are either workers, they're caregivers, they're students, or they're unable to work due to illness. And despite this fact, there's been much discussion of establishing the work requirements in Medicaid, but whenever they've been implemented at the state level, these requirements add a huge burden of tracking, recording, and paperwork to Medicaid offices and enrollees and result in people inappropriately losing their coverage or not gaining coverage they otherwise would have qualified for. The people who lose or do not gain coverage because of paperwork mistakes or red tape will likely include some people with cancer or cancer survivors who can't navigate the process to prove they're working or deserve an exemption, in addition to millions of individuals who need cancer screenings or preventative services. And it echoes what the Muscular Dystrophy Association is advising us. Many individuals from neuromuscular community with disabilities will inevitably fall through the cracks. For example, progressive muscle weakness due to neuromuscular disease may working, volunteering, or attending school very difficult, but the lack of visibility, the lack of a visibly obvious disability would result in members of our community losing their Medicaid. Coverage due to unnecessary red tape. They point to the 2022 report by CBO that found that work reporting requirements had no effect on employment and were more likely to just reduce benefits. We urge the committee to reject proposals that institute work or community engagement reporting requirements, as they simply impose immense administrative burdens on states and beneficiaries alike. Here's another one from the National Health Law Program that it's pretty dire. The proposed work requirement is more radical and punishing than any proposal we've seen before. It would terminate coverage for literally millions of low-income people, including workers, people with disabilities and chronic conditions, and caregivers who receive Medicaid through the Adult Expansion Group. The proposal essentially shuts the front door to care, requiring an applicant to demonstrate compliance with the work requirement before he or she can access coverage, requiring people to verify their prior compliance with work requirements before gaining access to coverage creates enormous barriers to needed health care. Goes on, but you simply cannot ignore what everyone is advising us. And I think it's just tremendously troubling that you can, even in the face of all of the evidence, the prior experience in Georgia and Arkansas, what advocates tell us and advise us, that you continue to go down this road, to rip health coverage away, to pay for a tax cut for the wealthy and the well-connected in America. I'll yield to Mr. Peters.
Just wanted to comment. Thank you very much for those comments. I listened to the chairman. We didn't even talk about New Hampshire, but he basically said what New Hampshire state officials said before they went down the work requirements path. What happened in New Hampshire? Only 32% of their Medicaid population was able to complete the work requirements with 100% accuracy and on time, which is required to gain coverage. We haven't even mentioned a third state, all three bad experiences. I yield back. Thank you.
And I yield back.
Gentlelady yields back. The chair recognizes Mr. Crenshaw from Texas. You have 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. To strike the last word. So I want to talk about the reality of these work requirements. Earlier this year, I introduced a bill requiring work requirements on Medicaid, along with Senator Kennedy. And I did that because I believe it's common sense, and I'm glad we included this concept in this bill. So let's talk details. First of all, the requirement begins in 2029. That's a long ways off, by the way, and it also gives states plenty of time to adjust to the concerns that were just brought up. about how to administer this. And here's what it means. It just means that able-bodied, working-age adults without children must show at least 80 hours of work, training, looking for work, or community service per month. That's 20 hours a week to keep Medicaid coverage. This is not crazy. This is fundamentally about independence, responsibility, and above all, dignity. I want to talk about that for a minute. There has never been and never will be dignity in dependency. Now, one might say that the longevity and prosperity of a society depends on this critical truth. And maybe we have fundamental disagreements about this. I don't know. Maybe that's the real source of debate here. I think one side believes that dignity is achieved only by infinite services at the expense of others. And I don't fault you for genuine compassion, but we have to be conscious of second and third order effects, do we not? I'll tell you what I believe about dignity. Dignity is achieved beyond shallow and temporary comforts. It's found by charting your own path and thus creating a sense of meaning that drives one to be the best possible version of themselves. I'm not alone in this belief. Here's an interesting data point. In 2023, an advisory referendum to impose work requirements for welfare recipients was overwhelmingly approved by voters in Wisconsin. 80% voted yes. The referendum asked very clearly, shall able-bodied, childless adults be required to look for work in order to receive taxpayer-funded benefits? Now, that's an electorate of normal, independent-minded voters. It is a swing state after all. This debate isn't really about safety nets. It's about how they're used. We believe that net should bounce you back on your path toward dignity. And perhaps my colleagues envision that net to be more like a hammock, locking more and more able-bodied people with vast potential, into a comfortable government-crafted blanket from which they can never escape. It's comfortable, sure, maybe, but comfort without dignity. Let's be clear, despite the misinformation and fear-mongering, we are not cruel. We're not telling everyone to suck it up and pull it up by your bootstraps. This work requirement has an exhausting number of exemptions. It doesn't apply to kids, seniors, pregnant women, people with substance abuse disorders, people with disabilities, and doesn't apply to people looking for work or volunteering. It gives a 30-day grace period if you lose your job. It was falsely stated before that if you lose your job, suddenly you don't qualify, but that's just not true. Now, there was once a Democrat Party that agreed with this simple concept. If you recall, it was led by President Bill Clinton. I suppose this might be the problem with the modern progressive disposition. Progress followed by progress. Toward what? No one really knows. That's what happens when you don't have defining principles to anchor your political belief system. Principles like personal responsibility, the concept of a meritocracy, and the preservation of the dignity of work. Progressivism eventually progresses into a totally unconstrained dependency on the power of government to meet your every need. That's the logical conclusion of an untethered philosophy. If one government benefit is good, well, then 10 more must be better, right? But here's the kicker. This utopian ideal of a perfect government that provides for your every comfort is indeed nothing but a utopia, an imagined place that can never be real. And because this notion is utterly impossible, as it directly contradicts human nature and also happens to be antithetical to our own Western values, well, the progressive can always find new directions to run toward, new battles to fight. One minute you can be for common sense work requirements, and the next minute that same idea violates some trendy notion of social justice. 5 minutes ago, no one believed a 5-year-old could choose their own gender, but now the progressives embrace it. Progressivism is progress, that's for sure, but it's almost always progress in the wrong direction. I'm proud to be part of this body that is pushing us in the right direction. I yield back.
Gentleman yields back. Is there any further discussion? Gentleman from New Jersey, Mr. Menendez is recognized for 5 minutes.
Thank you, Chairman. I especially appreciate a nice lengthy lecture at 7:40 in the morning from our friends across the aisle. But if you want to talk about the way parties used to be and refer to the Democratic Party from the early 90s, there was a Republican Party that used to be fiscally conservative. And then George W. Bush gave tax cuts to the wealthiest 1%. That put us from a budget surplus and a balanced budget into the deficits that we're facing today. Tax cuts that now we're trying to extend that Trump in his first presidency enacted that are leading us further into a deficit, things that you used to care about. You used to care about a good business environment, and now you have tariffs that get turned on and off every single day, which is a terrible thing for business. Predictability no longer exists in this country. That used to be a foundational principle of the Republican Party. So if you want to lecture Democrats about the party that we used to be, take a good, long, hard look in the mirror, because Republicans are just eroding the pillars that they used to stand for. And this president is at the helm of it, and you all stay silent while he does it. So let's talk about work requirements, because that is what this amendment is about. As we've discussed in length, Medicaid is one of the most powerful tools we have to protect the health and dignity of American families. It helps ensure that children get regular checkups, seniors can afford their medications, and that working parents do not have to choose between caring for their sick child or other necessities. But Republicans are trying to undermine this vital program by pushing a made-up narrative centered around the idea of so-called work requirements. So, you like dealing in facts? Here are facts. Fact 1, nearly all people on Medicaid who can work already work. You will hear Republicans talk about bringing able-bodied people back to work, but make no mistake, this is an entirely false narrative to gain support for a proposal that would take away health care for caregivers, parents, and sick Americans. It's simple. Americans want to work. Those who can do. Fact 2, adding burdensome red tape requirements does not increase employment. It only takes health care away from Americans. Study after study, including a report by the nonpartisan Congressional Budget Office, have shown that adding burdensome red tape requirements do not increase employment at all. When Arkansas tried work requirements in 2018, over 180,000 people lost coverage in just a few months. You may not like that fact, but it is a reality. Not because they didn't work, but because they missed a deadline or didn't fill out a form. This is the problem. Some of the hardest working people in America who rely on Medicaid don't have the time to work their job, take care of their children, take care of their elders, put food on their family's table, and fill out additional paperwork that you all want them to do because you don't think that they're doing enough already in their lives. Fact number 3, red tape requirements lead to more wasteful spending than there exists in the program. You'll hear Republicans talk a lot about waste, fraud, and abuse. But as we've seen in states like Georgia, they spent more money administering their program to kick people off Medicaid than actually providing health care. Fact number 4, as the largest source of federal funding for state budgets, Medicaid bolsters local economies and actually sustains jobs. Undermining Medicaid with barriers and red tapes makes it harder for people to work. I visited with in-home care providers who do such critically important work, and their work is supported by Medicaid. It is just so frustrating to hear, especially one colleague across the aisle, lecture us about who these people are on Medicaid and able-bodied people. And here's the thing that Republicans have not talked about. How many of the 13.7 million individuals who will lose coverage under this bill, how many of them will lose coverage because of these red tape requirements? Because if you think the number is 0, then you're just not living in reality. So what percentage of the 13.7 million people that will lose health care under this bill will lose it because of these red tape requirements? Does the majority have a number? Is it 0? Then say it into the microphone so it can be attributed to you, whoever said 0. Oh, because if you don't like lectures, then you may want to tell your colleague not to give one either. But if you don't want to speak into the microphone so people can have you on the record, then don't say it under your breath. Because the answer is not 0, and you should all know that based on what happened in Georgia and Arkansas and apparently New Hampshire. It's just obscene. You guys want to keep talking? It's just obscene, and you all know it. Listen, Democrats are united in creating better health care outcomes for all Americans, including those in your districts, because you won't speak up for them. I yield back.
Gentleman yields back. Anyone seeking discussion? Gentleman from Virginia is recognized for 5 minutes.
So I've been listening to some of this debate, and let me just get a couple things cleared up. Work requirements only apply to Medicaid expansion. Therefore, by definition, work requirements do not apply to the disabled. They're exempt. They don't have a work requirement. Another thing that we often make a mistake, and both sides of the aisle have done this, we hear the 80 hours a month and we make the mistake of dividing by 4. Now, it's a small matter. I grant you it is a small matter. But as a recovering divorce attorney back in the days when they didn't have formulas for everything and you had to calculate how many expenses that your client, that mama with some kids, has during the month so you can figure out child support and spousal support, you know that it's 4.33 weeks in a month. So an 80-hour requirement actually works out to 18.47 hours a week. So for those of you who are worried that they might not be able to get to 20, you really only have to get to 18 and a half. Now that's a small point, I get it. And y'all don't like the work requirements on the other side of the aisle, I get it. Let's talk about red tape for just a second. I would assume, based on the things that I'm hearing, that some of the states might have a problem. We heard about a guy that don't even have a work requirement, but had red tape problems in Massachusetts. We've heard about problems in New Hampshire. We've heard about some other red tape problems. So one can assume there will be some red tape issues. But nobody has mentioned that not only do you have the ability to go through that process, but if you're doing the work requirement and it's a red tape issue, not a failure to move forward issue, there's a 30-day look back. You're automatically eligible for Medicaid expansion, and you get a 30-day look back. So you actually have the initial time period plus a 30-day time period that's built in. You have to follow the bouncing ball, but I assure you that there are going to be hundreds, if not thousands, of people in every state who will counsel you on how to do this. That's the way these programs have worked in the past, is that there will be people who do that. It's kind of like it's kind of like in any situation, there will be people who figure these things out, and they help other people. And so I would submit to you that there will be a whole lot more knowledge after the first 6 months, and that 30-day period gives you a cushion which will help to alleviate any issues that some of the states will have with red tape. And I yield back.
Gentleman yields back. Anybody, the gentlelady from Massachusetts is recognized for 5 minutes of the amendment.
Thank you, Mr. Chairman. I move to strike the last word. Okay, let's call this what it is. Paperwork requirements, not work requirements, because that's all these so-called work reporting requirements are. Bureaucratic red tape designed not to encourage employment, but to push eligible people out of the Medicaid program altogether. Not because they're refusing to work, but because they missed a deadline. They couldn't navigate a broken website or moved and didn't get the letter in time. And you don't have to take my word for it. We've seen it happen before. In Arkansas, the first state to implement these Republican paperwork requirements, more than 18,000 people lost their Medicaid coverage in just 5 months. Many of those folks were working. They were eligible for their Medicaid coverage. They just couldn't keep up with the paperwork. That's not a success story, that's a warning. And now Republicans want to take that failed experiment and make it national policy. If they succeed, nearly 1 million people in my home state of Massachusetts, almost half of all adults on Mass Health, could be at risk of losing coverage. That includes both expansion and non-expansion adults. And it would be devastating for the working families this program is meant to serve. We saw a preview of this just last year during the Medicaid redetermination process. People were kicked off their coverage not because they no longer qualified, but because they couldn't navigate a complicated, opaque system. Paperwork traps replaced patient care. Now, it's been said a few times already, but it bears repeating. The majority of people on Medicaid are already working. In my state, over 3/4 of enrollees under 65 live in working families. They're home health aides, restaurant workers, janitors, substitute teachers, people doing jobs our economy depends on, jobs that often don't come with health insurance. Others are caregivers or folks dealing with serious health challenges. And yet, here we are, debating whether they should have to jump through hoops just to prove they deserve to have health care. This isn't about accountability. It isn't about cost savings either. In fact, it'll raise costs. As more people lose coverage, hospitals and states will shoulder higher uncompensated care bills. And states will have to pour resources into building systems to enforce these new rules, systems most don't have and many can't afford. We can look at Georgia again, the only state currently implementing a partial paperwork requirement. It's been such a disaster that officials are already offering or overhauling the program. It's not protecting coverage, it's dismantling it. So let's not pretend this is about improving Medicaid. If it were, my Republican colleagues would be offering funding, staffing, and real support to states. Instead, they're pushing an unfunded mandate they know can't be implemented. Why? I don't know. Maybe that's the point. The goal isn't to improve Medicaid. It's to gut it quietly, cruelly, systematically. These paperwork requirements won't stop ineligible people from getting Medicaid. They'll strip eligible people of the coverage they depend on by design. And who will pay the price? Working families, sick kids, seniors, people doing everything right, just trying to stay healthy and stay afloat. This policy isn't misguided, it's malicious, and we will not stay silent while it threatens the lives and the livelihoods of the people we represent. I yield back.
Gentlelady yields back. Any further discussion? Any further? Gentlelady from Virginia, Ms. McClellan, is recognized for 5 minutes on the amendment.
Thank you, Mr. Chair. I think we all recognize and appreciate the dignity of work. And the issue that we have on this side of the aisle with the work requirements is unintended or intended consequences of what happens if you don't get it right and it's not implemented right, as we have seen in at least 2 states that implemented work requirements, and it did kick people off who were eligible. We're trying to make sure that doesn't happen here, because the consequences of losing your health insurance can be catastrophic. Whether it's a day or a month, that person is one accident or illness away from total economic devastation when they're already living by a thread. And so when you get a bill less than 36 hours and you hear, well, just trust us. I'm a trust but verify kind of person. And as I said to my colleague from Virginia, the one thing you can count on is the Virginians are going to read the bill. So I've read the bill and I have some questions. I want to make sure I understand that there aren't going to be instances where people who are eligible get kicked off because of the way this bill was hastily written. So let me ask some questions about the look-back period. And this is for council. So on page 70, line 8, if I'm reading this correctly, and it's been a long time since I pulled an all-nighter, but as I read line 8, it essentially says that when a person applies for Medicaid and needs to demonstrate compliance with the work requirement, the state can look back at compliance for one or more months as specified by the state, consecutive. So my first question to council is, does this allow states, for purposes of determining eligibility, to look back as far as they want?
On page 70, line 8, the language specifies for 1 or more months.
So it could look as long as it wants. That's a yes?
The language specifies for 1 or more months.
Okay. So could, under that language, a state look back 3 months?
As the bill specifies for 1 or more, as specified by the state, consecutive months.
6 months?
If 6 is, yes, 6 is more than 1.
A year?
12 months would be more than 1 month.
And if they look back at the year, does that person have to have been, or 3 months or 6 months, do they have to have had a job or met one of those criteria for the entire look-back period?
The applicable individual as described under the bill would need to satisfy the community engagement requirements for one or more consecutive months as specified by the state.
So if a state sets a 6-month look-back period, and I go and apply for Medicaid coverage, and 3 months ago I lost my job, but 3 days ago I got a job, but they're looking back 6 months, could I be denied Medicaid?
If the individual satisfies the community engagement requirements, which include work, job training, education, volunteering, they would remain in compliance with the community engagement requirements.
But that's not my question. Can a state who sets a 3-month look-back period look back at 3 months? I wasn't employed 3 months ago, but I got a job 3 days ago. Could that state deny me coverage?
If the individual was satisfying the community engagement requirements during the applicable look-back period, then they would satisfy the eligibility requirements.
I think that's not clear. I guess I don't understand what is the point of having a 1 or more look-back period if you have somebody who may have been employed and then unemployed within that look-back period. Which date are you looking at?
Could you phrase the question? Is it a policy question or is it a question in regards to the
I'm just
stated-
trying to understand what the states can and cannot do. I don't know if that's a policy question. I thought it was a legal question.
The states can look at 1 or more consecutive months for eligibility.
Okay. I yield back.
Gentlelady yields back. The other members, the chair recognizes the gentleman from Oregon for 5 minutes.
To the bill, Mr. Speaker, Mr. Chair. So there's a bunch of reasons why we're doing this work requirement. One of them is that we don't want people to be on this program for forever, and this is a really good way to get off it, have a job. But another, and probably the most important thing, is that a majority of Americans want a work requirement. The polling says that 80% of Republicans want a work requirement, 60% of independents, and 47% of Democrats want a work requirement. The taxpayers want a work requirement. That's why we're doing this, because among other reasons, there's a really strong public opinion in favor of people who get Medicaid working. And so we owe it to the taxpayers to do our best to do what they want since they're paying for this program. So of course we should have a work requirement when so many of Americans want us to do exactly what we're doing. And so those of you who are suggesting that there shouldn't be one and there's 1,000 excuses why there shouldn't be, well, great. But the point is the taxpayers are paying for this program and they want a work requirement. And I happen to think personally it's a good idea. Now, people may have all kinds of excuses for why it's not going to work for them, but guess what? We're paying somewhere around $9,000 for each person on that program. Better be trying to get a job. I yield back.
Gentleman yields. Is there another member wanting to speak? The chair recognizes the gentlelady from Washington.
Thank you, Mr. Chairman. I have a question for council. These red tape requirements leave a lot of unanswered questions about how the people Republicans claim they're protecting are actually in real life protected. For example, states are permitted to provide short-term hardship exceptions, but only if they decide to do so. And these exceptions last just for 1 month. So, council, one of these short-term hardship exceptions is for someone who during a month or part of a month receives, quote, inpatient psychiatric hospital services. Can you confirm this hardship exception applies only while the person is receiving inpatient care in a psychiatric hospital, or at least in the same month as they are in that psychiatric hospital?
Yes, the short-term hardship event that's defined on page 74 pertains to individuals that are in those facilities.
So just for that 1 month, and then they would need maybe to reapply. So just also to confirm, the text on page 73 said that the individual would need to request this exception themselves while they're an inpatient of a psychiatric hospital, or at least in the same month as they are a patient. I'm just thinking about what this looks like in real life. I'm referring to line 20 where it says, quote, upon the request of such individual under procedures established by the state. Is that correct, yes or no?
That's what the text says, yes.
Okay, that's tough. If you think about what it must be like for those patients to be in the hospital and having to make these applications themselves. Okay, and then just to confirm, once a person is discharged after having a severe enough mental health crisis to land them in the hospital, they're gonna need to comply with the work standard at least by the start of the next month. So like, if they were, if they were hospitalized inpatient for psychiatric crisis from like April 20th to April 29th, by May 1st, they'd have to have a job or they'd lose their insurance. Is that correct?
I would point you to two sections, one on page 75, line 13, which includes such individual experiences, any other short-term hardship, and as well as the applicable exemptions under paragraph 9, which would include other medical frail definitions.
Okay, so you're saying that even if they're not hospitalized, that having some like post-hospital continuing psychiatric care or adjustment period, that could also allow a state to provide an exception, but not guarantee for that patient that they would have the exception?
On page 85, line 8, there is a mandatory exemption for with a disabling mental disorder.
Okay, so then I'm trying to get really drill down on this because it's I'm a doctor. I've had patients who have had this circumstance of being inpatient, coming out. They're still not okay. They're just not needing to be in the hospital 24/7. And so I guess it's just kind of a fine point on what is considered disabling, where that extends to, who decides, and if this is up to the states.
The definition of disabling mental disorder is defined by the secretary, and there's also on page 86, line 15, as it pertains, I'm sorry, I cited the wrong page there. On page 85, line 17, subject to the approval of the secretary with any other medical condition identified by the state that is not otherwise identified under this clause.
Right. Thank you for helping to clarify that. I think we've already expressed our concern about Secretary Kennedy labeling anybody with any sort of illness and making a judgment on that, but this is just one of the exemptions that Republicans are claiming protect people. And a person who's having a mental health crisis that's serious enough for that person to be an inpatient of a psychiatric hospital would now need to, on their own, request an exemption, and then if they got that, they would then have to get right back to work as soon as it ticked over to the next month. And this is, it's a tall order to ask of somebody going through a real crisis. So thank you, I yield back.
Gentlelady yields. Are there other members looking to speak? The chair recognizes a gentleman from Ohio for 5 minutes.
Thank you, Mr. Chair. We have been at this for, 15, 20 hours, long time. And we've been asking questions of members, but of council about the bill text and who's eligible, who's not, what the paperwork requirements are. There have been scenario after scenario after scenario, and I think I can speak for most of my colleagues, at least over here, there's just pure confusion. And I feel terrible for you because this is an enormous bill that has huge implications for millions of Americans who rely on Medicaid for health insurance. And here we are asking pretty basic questions about eligibility, and the answer is, well, just read this section, or I would refer you to this sentence. Ultimately, you walk away very unclear as to whether or not you're insured, if you're eligible, which is precisely the point. And that's the only way you get to the number of $700 billion in savings and millions of people, most of whom, or a lot of whom, are eligible, but don't get the health insurance anymore because it's so confusing. There's so much red tape. There's so much bureaucracy. And people just give up. And that's what happened in Georgia. And that's what's going to happen if this bill moves forward, plus the cuts to states. You're just going to see an enormous amount of people lose their health insurance. And when you take that much money out of the system, everybody suffers. I mean, you know, we know that. We know when you take nearly $1 trillion out of the system between the cuts here and the subsidies that are going away as part of ACA, then you are going to see hospitals shutter their doors. You're going to see physicians close their practices. Everyone will suffer. That's it. It is, I think you have demonstrated, unfortunately, that this is very confusing, maybe intentionally so. But the result will be millions and millions of people just don't get health insurance, and most of whom are probably eligible. I yield back.
Gentleman yields. Chair now recognizes the gentleman for Texas for 5 minutes.
Yeah, thank you, Mr. Chairman. It's as if these are the first time these questions have ever been asked, but it's not. This isn't the first time we've ever asked these questions. In fact, the states that don't expand go through this process every single day. And at one point in time, every state made these adjudications and had these questions and looked at these eligibility requirements. So how disingenuous to act like this is the first time we've ever asked these questions, because it's not. The accusation that this is for cruelty purposes, give me a break. And I actually am heartened, though, to hear my colleagues talk about bureaucracy and red tape. I mean, it's about time. So that's a good positive thing that has come out of this hearing. But when we're talking about work requirements, we've established very clearly 4 or 5 hours ago in this markup that the other side of the aisle is not in favor of work requirements. They don't believe people should be able to have to work to do any of this, get any of these benefits. And I think that the American people have spoken loud and clear. My district doesn't have people that are just sitting around not working or not looking for a job. They all are looking for a job. They all are working. They all are trying to do that. And if they can't because they have some sort of disability, or they're a veteran or a pregnant woman, then they are covered by Medicaid. And thank goodness we are getting to a point where the delivery of health care to them is going to be tailored, it's going to be beneficial, it's going to be much better than it has been. And by the way, the people that are going to have some work requirements are going to get a plan that is going to be better for them. And it's going to allow them to continue to live out that American dream. So it's hard to sit here and listen to this false narrative that these are the first time, this is the first time we've ever had these questions. The first time that the Secretary of HHS has ever had to weigh in on who's eligible and who's not, because that is false.
Would the gentleman yield?
And I'll yield time after I'm done talking. That is a false narrative that in no way, shape, or form should ever be insinuated that Medicaid has not had to ask those questions. So I'll yield 30 seconds.
So you mentioned the Secretary of Health and Human Services, and on this side, like we all kind of just instinctively laugh when we think about RFK making scientifically driven decisions. But actually, let's set that aside for a second.
Let's set that aside. If that's the purpose of your question, then.
Because I want to really drive into a very specific concern I have, which is corruption. Because the head of DOJ for the healthcare department is a man named Brad Smith. And the thing about Brad Smith is that he's the CEO of Main Street Health, which provides primary care services to patients in rural America. He's also the executive chairman of CareBridge, which serves homebound Medicaid patients. Now, this is the guy who is in charge of CMS right now. Do you have any concerns that maybe there's a conflict of interest about a guy who makes money off of Medicaid being in charge of these decisions?
We'll stick to the work requirements piece.
Well,
I'm
they're
going to
related.
Mr. Auchincloss, I'll take my time back. I'm sorry, the gentleman from Massachusetts. I'll take my time back. I'd love to have that conversation at some point, but right now we're talking about work requirements. And I think the most important thing for all of those that are in the audience right now, all of those that are watching through the TV, the millions of people that are watching through the TV, is that there is a healthy debate that has happened, and two sides of this debate have emerged. One side does not believe in work requirements. It has been stated clearly that there is no belief that you have to actually do anything to receive benefits, that you have to show if you're an able-bodied adult, not previously covered in that list, has been clearly stated, pregnant women, individuals under the age of 19 or over the age of 64, foster youth, former foster youth under the age of 26, members of tribes, individuals who are considered medically frail, which includes but is not limited to individuals who are blind, disabled, or have chronic substance use disorder, and that goes on and on and on. Those folks that I just listed and more are not subject to this. They are the ones that Medicaid was designed for, and they will receive their benefits, and actually they will receive better benefits because the ones that it was not designed for are going to be subject to work requirements, and I yield back.
Gentleman yields. Is there any other member looking to speak? Chair recognizes the gentleman from California for 5 minutes.
Yeah, let me just be very clear. This side does not believe in work requirements because of the red tape barriers that force people off of the Medicaid rolls. That's the only reason. And when the gentleman asked me, that's the reason why I told him he's misconstruing the reason for his own narrative. And so with that, I just want to clear the record. I'm opposed to the work requirements because of the red tape. They're designed to get people to fall off the Medicaid. Those are the eligible individuals. And with that, I yield
Will the
back.
gentleman yield? Will the gentleman yield?
No, I yield back.
Gentleman yields back. Is there any other member looking to speak? Chair recognizes the gentleman from Massachusetts for 5 minutes.
Thank you, Chairman. I would really just, because we have to engage on the question of the Secretary of Health and Human Services being part of this bureaucracy that the Republicans are implementing. We got a brand new bureaucracy now, right? That's cascading across the states, and Secretary HHS and the office therein is part of it. So I would ask both the chairman of the Health Sub and the chairman of the full committee, are you two concerned about a guy who, and I'll give his job description, CEO of Main Street Health, which provides primary care services to patients in rural America, and executive chairman of CareBridge, which serves homebound Medicaid patients. He is working right now at HHS, and he's making money off HHS. Are either of you concerned about that?
I'm sorry, I didn't hear you. Can you say that again?
Okay, we'll do it again. Brad Smith, head of DOJ for healthcare, CEO of a company that provides primary care services to patients in rural America, and executive chairman of CareBridge, which serves homebound Medicaid patients. Now, he's going to be part of this apparatus, this bureaucracy that Republicans are creating. He is front and
I
center.
don't believe we're creating a bureaucracy. I don't think that's accurate.
Okay. He is part of this new schema that Republicans are putting in place to make sure that people are filling out paperwork sufficiently. Are you concerned about his role in this, given that he is making money off of CMS decisions?
I don't believe that DOJ is involved in this bill, in this decision-making process. So,
Because DOJ has been so
isn't
hands-off across the federal government to date?
not involved in this process.
So there's no concerns about a guy who makes money off of CMS being front and center for decisions about who gets care. He literally makes money off Medicaid.
DOJ does not have decisions in this bill. So,
Will the gentleman yield?
That's fine.
Are you against efficiencies and looking at them?
I'm for return on investment. And when Doge fires the guy at the FDA who makes sure that eye drops don't blind you, that's not an ROI, okay? That is foolish decision-making that creates uncertainty for business and makes Americans less safe. And putting this guy, who has a direct conflict of interest, he runs a Medicaid business, putting him front and center in this opaque, complicated scheme that you're all putting together for work requirements invites corruption. And it's not like this administration has exactly inspired confidence in their ability to keep their private sector and public sector responsibilities separate.
Will the gentleman yield?
Please.
Explain to me, I'm thinking back to when Biden was vice president under Obama, and he went to Ukraine and withheld $1 billion tax dollars. So that was okay in your mind, but him trying to cut spending in finance places is not okay.
Take it back my time. The whataboutism, it's not going to cut it in this room, and it's not going to cut it with your constituents. It's not going to cut it when they're losing home and community-based services so that Brad Smith can make an extra $1 billion. The whataboutism is going to get very stale very fast. And eventually, y'all are going to have to do town halls, and it's not going to work. I'll yield back my time.
Will the gentleman yield?
I'll yield to the gentleman from New Jersey.
What's going to so it gets yielding to me? So just real quick, because my colleague from Texas was sort of talking about our approach to red tape and how one of his key takeaways was how Democrats feel about red tape and about making government services more efficient. I would just sort of go back, it feels like days ago, but it was just hours ago when we had the markup on the energy section of this bill. And with respect to working individuals across all of our districts who are on Medicaid, who now have this additional red tape reporting obligations that are part of this bill, you're sticking it to them. They're probably going to lose health care insurance because of it. When it comes to energy permitting reform and expediting the system there, in that space, you're just comfortable with people paying a flat fee, $10 million, $1 million, $50,000, and you'll greenlight the process there. So for the uber wealthy corporations in the energy sector, pay a one-time fee and do as you please. For hardworking Americans across the country, more reporting, more red tape, more of a burden on their day-to-day lives when they already are working, taking care of their families, taking care of their children, taking care of their elders, making sure they have a roof over their family's head, making sure they can afford groceries. But you know what? Let's stick them with some additional work requirements like we saw in Georgia, like we saw in Arkansas, so that way maybe they fall off Medicaid, and that way we have to pay less into it, so states have to pay less into it. It's such an interesting approach, that when it comes to workers across America, make it harder, make it more burdensome. When it comes to energy producers, giant energy companies, just pay a simple amount and we'll make it the easiest process in the world. I think it says a lot about the values and priorities of the Republican Party. I yield back to my colleague from Massachusetts.
I yield back to the chair.
Gentleman yields. Are any other members looking to speak? Hearing none. Okay. Hearing none. The vote occurs on the amendment. Recorded vote has been requested. The clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Hudson? Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Balderson votes no.